Good morning. Good morning, my friends. Happy whatever day it is. I think it's Thursday. Happy Thursday, my friends. Today is Thursday, September 19th, 2024. And it was exactly 6 months ago today that 14-year-old Carly Gregg shot and killed her mother, Ashley Smiley. 6 months ago today. And we're almost finished with this murder trial, an attempted murder trial for the attempted murder of Carly's stepfather, Heath Smiley. You asked for it, you got it, because you guys have been asking, why haven't we heard from the treating doctors of Carly? And the first witness that the state is calling today in their rebuttal case is one of the treating medical providers of Carly Gregg. So you're going to get to hear from her. Can give a minute or two or a little bit. They started at about right even before 8:45 Central Time. And that is when the judge told the jury to be there today. So they were started a couple minutes early. I was surprised, but we're a little bit behind. So that's good because we can fast forward through the breaks and gives everybody a chance to get on in here and watch it. I was watching Peter Tragos this morning, lawyer. You know, he did a premiere of a show, I guess, that he recorded maybe last night on the Carly Gregg case. So if you haven't watched it and you want to hear another legal opinion, go check that out later. It is up. It is done. It's only about an hour long, so you have time for that later. I'm a little happier with Carly's outfit today, although it's not, as matronly as some of the other outfits she's been wearing during the trial. I think it's better suited for her age group. Oh, hi, Wednesday. Wednesday, you changed your name. You changed your name. Still singing Block Island in my head all night. That's hilarious. Thanks, Laura. And thanks to Kit Carson for becoming new members. Welcome. Welcome. I think you're going to like it here. I don't know. I feel like StreamYard is a little glitchy today. So mods, let me know if it starts glitching on me and if I have to restart my browser. Every day, it's a new technical difficulty, whether it be YouTube or StreamYard or something. All right. Thoughts, concerns, anybody else having nightmares about this case or this trial? Smash the like, please, on your way in. Let's get to it. Let's get on over to Rankin County, Mississippi. Sorry, I didn't want to misname the state. Rankin County, Mississippi, to the courtroom of Judge Dewey K. Arthur. He's not taken any of it. He hasn't been during the pretrial. He hasn't been during the trial. I imagine that that's the way he is in every case that he handles. And here we go. The state is beginning their rebuttal case. It only started about a little over half an hour ago, so we're not that far behind. And here we go. She does look different today, right? It's a little more childlike. The outfits she wore the first 3 days, I think, were a little too matronly. And if I was her attorney, I wouldn't want her to look that old because I wouldn't want the jury to see her as an adult. I would want them to see her as a child. The volume's not up yet, so let's give it a second. This is actually navy blue, Elf. Maybe it looks black on your screen, but it's navy blue, her dress.
All right, good morning, ladies and gentlemen of the jury. Did everyone follow the court's instructions overnight? Did anyone allow themselves to be exposed to any media accounts, any social media, or any news account of this case? Everyone shaking their head in the negative. We will proceed. All right, the defendant having rested, the state may call any witnesses it wishes to call in rebuttal.
State calls Olivia Lieber.
Olivia Lieber.
She does look more confident. We cannot get it louder. You need to turn volume up on your end. It's law and crimes issue. I'm going to stay away from the mic so I sound quieter. If you are having trouble hearing, put on your earbuds. Turn up the volume on your own end. The volume has been low throughout the course of this.
Have a seat. You can adjust yourself up to the microphone. You don't have to speak directly up to it.
Okay.
But I do need you to speak so that lady in the very back row.
Okay, got it.
You understand that you're now under oath, your answers are sworn answers subject to felony perjury. All right, you may proceed.
If you would, Olivia, introduce yourself to these men and women. I'm Olivia Lieber. And Olivia, where do you work?
The closed captions are on, so just give them a second to catch up. I am not sick. I'm totally fine. I am not sick. I can't turn up the volume. Please turn down your own volume. And also, the closed captions are on. Okay? It's going to be a morning if everybody starts complaining. Carly will not testify. The defense has closed their case. They have arrested. Okay? Okay? First of all, I'm going to point out that I do not approve of the state prosecutor calling this nurse practitioner by her first name, Olivia. She could call her nurse so-and-so. She could call her Ms. So-and-so, but she refers to her as Olivia, which in my mind as a juror makes me think either they have some sort of casual relationship or she's not really a serious medical provider if we're just going to call her Olivia, but that's my own personal opinion.
Precise mind. And tell us a little bit. I'm Olivia Lieber. And Olivia, where do you work? Precise Mind. And tell us a little bit about what Precise Mind is.
It's an outpatient mental health clinic, and we do research and mental health care for all ages.
Just to be clear, you're a little nervous today, right?
Yes, yeah, I am.
Is this your first time to ever testify?
Yes.
All right. How do you, and what is your role at Precise?
I'm a psychiatric mental health nurse practitioner.
And can you kind of tell us a little bit about what that is and what you do?
Yeah. I got a degree with a master's degree in advanced nursing practice. So I chose to specialize in psychiatric mental health. The nurse practitioner program requires 1,200 hours of clinical practice, and we have to do different specialty groups, have experience with different specialty groups like geriatrics, adolescents, outpatient and inpatient psychiatry. So it's just a specialized nurse practitioner role, provider role.
And when did you do that?
That was 2.5 years ago, and I graduated in December 2021.
And have you been at Precise the whole time since then?
Yes. Mm-hmm.
And what is it that you do? I know you told us that you're a nurse practitioner there, but what is it that you actually do, like with patients at Precise?
Okay, we evaluate them and assess them, and we diagnose and then do medication management.
When you're evaluating them, is it important that they provide you accurate information?
Oh yes, very.
And why is that?
Because we base our diagnosis on that.
Did you have the opportunity to have a patient by the name of Carly Gregg?
Yes.
Do you see her in the courtroom?
I do.
Is she at the defense table?
Yes.
Olivia, I want to talk to you. Do y'all keep medical records of your treatment that you provide to patients?
Yes.
And did you do that with Ms. Gregg as well?
Mm-hmm.
May I press witness line?
I don't know why the captions aren't showing up, but they were showing up before, so maybe.
Thank you. After what's been marked previously as State's Exhibit number 19, if you could take a minute and look at that and see if you recognize those documents.
Mm-hmm. Yes, these are my notes from her visits.
And again, why is it important that we have medical records?
Well, we can't remember everything that we've done, and just to basically keep a treatment plan of what we've seen, what we think is going on, and what we need to address, and then the plan that we come up with the patient and or parents.
Do you recall the first time that you met Carly Gregg?
Mhm.
When was that?
That was January 15th,
Okay.
2024.
And prior to actually having an appointment with you and you being in the room with her, did she also fill out any paperwork or have any testing done?
They are required to fill out intake paperwork that have a few screenings and just demographic information.
Did you have Ms. Gregg do any additional screenings or questionnaires?
No.
And who has them fill out if you'll turn to base stamps number, it's 757, Olivia, in that.
Okay.
I'm looking at something called the cardiac screening questionnaire.
Okay. Got it.
Kind of talk us through what that is and who has the patient fill out that form.
These are all sent to every patient. It's just like a whole intake packet, basically. If they're a minor, usually the parent does it. And this cardiac screening is mostly for patients that we're going to have on a stimulant or something that could affect their cardiac function.
And in your treatment with Ms. Gregg, you didn't really need much from the cardiac questionnaire. I want to take you to, looks like there is 2 pages after that. There's an adult ADHD self-report scale checklist.
Mm-hmm.
Is that similar in nature in that the patient fills that out before they ever meet with you?
Uh-huh.
Is that something that you review?
Yes.
I want to talk about just a couple of things on that page.
Okay.
Olivia, down at question 6, it says, how often do you feel overly active and compelled to do things like you're driven by a motor?
Mm-hmm.
And the response was very often.
Right.
Did you review that when you were making rendering treatment to Carly?
Yes.
What about number 9 when she said she had difficulty concentrating on what people say sometimes? And she said often.
Mm-hmm. I see that.
Okay. And then if you'll turn back to the next page for me, 760, how often do you have difficulty unwinding or relaxing when you have time by yourself? And what did she say?
Rarely.
And what does that mean to you?
That this is just normal adolescent behavior. We have ups and downs at that age, and typically you can have a range of energy and or sleep disturbances throughout that age group, throughout life. So that just means that she has no trouble unwinding and relaxing, just what it says.
And then when you take the page before that, when she talks about being overly active and sometimes having concentration problems, did you take that to mean the same thing, just a regular teenager that has ups and downs?
Once I asked her more about possible ADHD, that was ruled out. So yes.
Okay. And so this is not your entire treatment of Ms. Gregg, right?
Absolutely not.
Okay, it does have closed captions on my phone. It just does not have them right here. So I'm going to just refresh this and see.
Controlled, but also
if it
signify the
fixes it.
possibility.
All right. Refreshing the browser often helps. Okay, I'm going to start it from looking at her notes.
You can take that off if you need to.
Thank
But
you.
I think what's been on previously is State's Exhibit number 19. If you could take a minute and look at that and see if you recognize those documents.
Mm-hmm. Yes, these are my notes from her visits.
It's not.
And again, why
Okay.
is it important that we have
Okay.
medical?
Okay. Everybody wants to be heard. Listen. I'm going to start again.
Remember
I'm going to start
everything.
again. I am not a cupcake. I'm not a cupcake. I can't make everyone happy. I just can't. I can't make everyone happy. So here's what we're going to do. I'll check the court TV stream to see if it's better. But I will tell you, traditionally during this trial, it has not been better because it only plays in one of my ears. So that's the problem with court TV. But since we can't all just be happy that I'm here streaming this, we're going to check it. It's not. It's only playing in one of my ears. So again, I can't make everyone happy. This is how it's going to be. Turn it up on your end, and I'm going to try And be quiet so I don't blow your ears out, okay? Put on your earbuds if it helps you. Turn up your volume. Put on a speaker. There's plenty of ways that you can modulate it on your end because the browser extension doesn't work. Okay? Thank you. For the love of the traveling Mary.
We've done, and just to basically keep a treatment plan of what we've seen, what we think is going on, and what we need to address, and then the plan that we come up with the patient and or parents.
Do you recall the first time that you met Carly Gregg?
Mhm.
When was that?
That was January 15th,
Okay.
2024.
And prior to actually having an appointment with you and you being in the room with her, did she also fill out any paperwork or have any testing done?
They are required to fill out intake paperwork that have a few screenings and just demographic information.
Did you have Ms. Gregg do any additional screenings or questionnaires?
No.
And who has them fill out if you'll turn to base stamps number, it's 757, Olivia. Is
Okay,
that-
again,
Okay.
Sunday doodles.
I
Sunday
think it's
doodles. If you're gonna redirect people to another stream from my stream, go there. Just go. Get your one-way ticket to Block Island and peace out. Who does that? Why do people do that? Okay, it's already a morning, you guys. Really? Do we really need to behave this way in the chat? I can see why Grizzly isn't covering this case anymore because these are not my regulars.
something called the cardiac screening questionnaire.
Okay. Got it.
Kind of talk us through what that is and who has the patient fill out that form.
These are all sent to every patient. It's just like a whole intake packet, basically. If they're a minor, usually the parent does it. And this cardiac screening is mostly for patients that we're going to have on a stimulant or something that could affect their cardiac function.
And in your treatment with Ms. Gregg, you didn't really need much from the cardiac
No.
questionnaire. I want to take you to, looks like there is 2 pages after that. There is an adult ADHD self-report scale checklist.
Mm-hmm.
Is that similar in nature in that the patient fills that out before they ever meet with you? Is that something that you review?
Yes.
I want to talk about just a couple of things on that page.
Okay.
Olivia, down at question 6, it says, how often do you feel overly active and compelled to do things like you're driven by a motor?
Mm-hmm.
And the response was very often.
Right.
Did you review that when you were making rendering treatment to Carly?
Yes.
What about number 9 when she said she had difficulty concentrating on what people say sometimes? And she said often.
Mm-hmm. I see that.
Okay. And then if you'll turn back to the next page for me, 760, how often do you have difficulty unwinding or relaxing when you have time by yourself? And what did she say?
Rarely.
And what does that mean to you?
That this is just normal adolescent behavior. We have ups and downs at that age, and typically you can have a range of energy and or sleep disturbances throughout that age group, throughout life. So that just means that she has no trouble unwinding and relaxing, just what it says.
And then when you take the page before that, when she talks about being overly active and sometimes having concentration problems, did you take that to be the same thing, just a regular teenager that has ups and downs?
Once I asked her more about possible ADHD, that was ruled out. So yes.
Okay. And so this is not your entire treatment of Ms. Gregg, right?
Absolutely not.
I'm going to ask you to keep looking. There's something called, Olivia, the modified mini screen.
Got it.
On the following pages, it's 761, 762, and 763. What is, if you can tell us, those of us that are not in the medical field, what the modified mini screen is?
This is one of the intake screenings that we do just to kind of identify, really to let the patient look at possible symptoms they could be having and then just answer yes or no to those so that we're made aware of them. I usually overlook these before the patient comes in and just to kind of have an idea of what to ask about that I need to, focus on beforehand.
And if the patient responds yes or no, you would then ask some kind of follow-up questions.
Definitely.
When you're meeting with them. And did you do that specifically with Carly Gregg?
Yes.
Remember when Dr. Berry came on the show yesterday and she told us that, the treatment can only be as good as what the reporting is. So if Carly's not being accurate or truthful on this questionnaire, that could be an issue with regard to her treatment.
I want to point you to the very last page of that document. Question number 21. If you could read that for the ladies and gentlemen, what the question is and what Ms. Gregg's response was to that.
Have you ever heard things other people couldn't hear, such as voices? And she said no.
And what date was that was put in your system?
January 15th, 24.
2024.
Mm-hmm.
So, Olivia, you told us a little bit about and I think that most of us have been to the doctor's office, right? We have to fill out these forms, different places, different forms. You said you look over those forms, and then tell us about what you do kind of when you meet a patient for the very first time.
Okay. Usually I ask about kind of what brought them here, what their chief complaint is, so to say. And then I do a whole mental evaluation, and that includes sleeping and eating habits. For her age group, I would ask about social stressors, friend groups, if she has a good support system, a number of things, just to kind of narrow down what's going on.
And I want to talk specifically about Carly Gregg. When she came in, what were you told was the reason for her visit with you?
Depression and anxiety, and she had some social stressors.
And what did she describe those social stressors to be?
We talked about her.
Don't follow the closed captions. The closed captions said sexual stressors. It's social stressors. And also, the prosecution is trying to point out that Carly did not admit to or say that she was hearing voices in January of 2024.
Her childhood and kind of having not a great relationship with her dad.
Thank you, Lori.
And an altercation with her mom recently. I'm going to refer to
Altercation. I don't like that word. Altercation. Altercation is not a medical term. Altercation is something you would see in a police report. Maybe conflict would be better. Altercation with her mom.
my notes.
Yeah, if you would take a look at that and then tell us once you've had a chance to review that. And that's the note
Okay.
from January the 15th of 2024.
Yes.
And now maybe you understand why the
She said that
defense
she had
didn't
started
cause-
feeling depressed since 6th grade, and then the social stressors were her parents and their custody battle.
Did she also mention that she had a little sister that had died some years back?
Yes.
I want to ask you, it says that about midway down, it says she's in the 10th grade at Northwest Rankin, and she loves school and is the valedictorian.
Yes.
How did you get that information?
I was mostly asking about school in regards to ADHD and ruling that out. And so I asked her how school was, and she said she loved it. She's a great student, and she's a smart girl.
Did she tell you that she was the valedictorian?
Yes.
Would it surprise you to learn she wasn't?
No.
Okay. Let's see. She talked about, in your notes, it says, talking about that she was in therapy previously.
Right.
What did you learn about the reason that she was in therapy when she was younger?
If I understood correctly, or remember correctly, it was based on the divorce court or custody court ordering her to go to equine therapy.
And who was that divorce? If you don't know, that's okay.
I think it was a custody battle between her dad and her mom.
Her biological dad.
Right.
Okay. Thank you for clearing that up for us.
Okay, I live in New York where we don't have court-ordered equine therapy. So if you live in a place where this is commonplace, let me know.
And at some point, down at the end of the note there in your history, it says her mom says that she's been lying and talking to a guy on Snapchat on a burner phone, and she's hiding it from her mom.
Mm-hmm.
Her mom made her cut him off after they found out she was cutting her thighs and taking sleeping pills.
Right.
Is that something that you remember discussing with Carly and Ashley Smiley that day?
Yes.
And at any point, did Carly say, "No, I wasn't taking sleeping pills"?
Not that I recall.
And at some point after your evaluation with
Okay, but you don't ask her at any point, did Carly say, no, I'm not cutting my thighs? Why is nobody making a big deal about the fact that this girl is self mutilating at 14 years old and had been doing it apparently for years before her mother found out about it? That's a huge red flag with regard to something not being right inside of Carly and her mental health and on being unable to control her impulses and inner pain. But, prosecutor, focus on the sleeping pills, which we found out were melatonin, which is natural, by the way.
her and you're in there on that first day, was there discussions about maybe giving her some medicine to try to help with her issues?
Yeah.
Tell us about that.
First, we talked about counseling, and that was definitely recommended. And then we kind of pointed out the priorities and what was getting in the way of her life the most and making things most difficult and what was a priority to address. And then we talked about medication options and what to start.
And what did you end up starting her on?
Zoloft,
And do you remember what the milligrams was?
25 milligrams daily.
And tell ladies and gentlemen just a little bit about, is that a lot of medicine? Is that a little bit of medicine?
No, that's a starting dose, and I'm usually conservative with my approaches, so that was just a normal starting dose for her age.
And is that one of the lowest dosages that you can actually prescribe?
Yes.
I want to walk you through, Olivia, on page, I'm looking at page 744. So I want to make sure we're looking at the same thing under behavioral health history.
Oh, that's so cool.
Which page was it?
744 down at the bottom right. I'm still in your January 15, 2024.
Okay, one sec. Got it.
Down there it says Carly had grown tired of counseling and wanted to stop. Do you remember them talking to you about that?
Yes.
Can you tell us a little bit more?
After the equine therapy, she had tried other counselors that she wasn't necessarily happy with and stopped at some point.
It actually even says down there, subsequent providers appeared far less impactful as Carly grew disillusioned with the courts.
Right.
Were those your words or something that they told you?
This portion was filled out by Ashley.
Okay. Thank you for that.
Mhm.
I want to take you to the next page where you talk about.
I want to hear that again now that I know that Ashley wrote that.
Point.
It actually even says down there, subsequent providers appeared far less impactful as Carly grew disillusioned with the courts.
Right.
Carly grew disillusioned with the courts? Her mother wrote that? What does that mean? Carly was angry at the courts because she was forced to go visit her biological dad, who was doing drugs in front of her, who beat her mother because her mother told her that her biological father beat her because they had to escape from him in the middle of the night when she was 4 years old. And she was still forced to have visitation with him. And he did drugs in front of her and forced her to chug a beer when she was 12. And one time she had to hide under the bed from him because she was afraid of him. And he would sit in the chair all day and not talk to her and not feed her or give her any water or anything to drink when she was just a toddler.
Were those your words or something that they told you?
This portion was filled out by Ashley.
Okay. Thank you for that.
But,
I want to take you to the next page where you talk about.
let's not dig any deeper. Mental health professional, nurse practitioner who's just going to send her off with a script for Zoloft. Cool.
Mental status exam and risk assessment. And
Okay.
if you could tell us what that is and what you're looking for.
We're really just observing for any kind of abnormal behavior or things that stand out, like memory, attention span. They articulate well. If they're cooperative, and then mood, affect. If their judgment is sound, and if they have any presence of psychosis, hallucinations, delusions.
So I want to walk.
What about the cutting? Is that abnormal behavior? Because now I want to get back to this because now we're kind of just glossing over it. Was that abnormal behavior that didn't stand out to you? We're not gonna dig into that a little bit more?
Walk you through a couple of those for Carly on January the 15th.
Okay.
What did you report her psychomotor behavior to be?
Well coordinated, which is normal.
What about her speech?
Normal rate and volume.
She wasn't talking really fast or really loud. What about when you go to her about her cognitive abilities on that day? Can you describe for the ladies and gentlemen what you said about her attention span and concentration?
They were all within normal limits.
Her orientation to time, place, and person.
She was oriented to all.
And so what does that mean?
That she's aware of where she is, who she is, and the date and time and situation.
What did Carly report regarding her recent memory, her ability to recall things?
That it was within normal limits.
And what about remote memory? So things that were not happening right at that moment, but kind of in the past.
Same.
Down a little further, you talked about her emotional state. Can you tell us what her mood and affect were?
They were during the appointment. It was normal and alert and oriented and appropriate.
Her judgment and insight that day, is that something you also took into consideration?
Mm-hmm.
And what did you determine to be Carly's judgment and insight?
Within normal limits.
I want to take you.
Her judgment was within normal limits and she was cutting her thighs. Am I insane? Maybe I'm the one who's insane. Maybe Carly Gregg is totally normal for, shooting her mother in the face because of all of these underlying issues that nobody seems to give a crap about. Hold on. Her judgment and insight is within normal limits. Okay.
Appropriate.
Her judgment and insight that day, is that something you also took into consideration?
Mm-hmm.
And what did you determine to be Carly's judgment and insight?
Within normal limits.
I want to take you, Olivia, to there's a section in that assessment about thought processes.
Mm-hmm.
Could you tell us about what you observed and what your records indicate about whether or not Carly was having abnormal or psychotic thoughts on January the 15th, 2024?
She denied those.
And did she ever tell you that she was having those types of thoughts before January the 15th of 2024?
No, she denied hallucinations or delusions.
Don't you think a lot of kids would lie about that, Mary? She did mention the cutting. That was one of the first things that she said, that she had been cutting her thighs.
And what was your diagnosis of Carly from your encounter with her in January 15th of 2024?
Adjustment disorder with mixed anxiety and depressed mood, and then major depressive disorder, single episode, moderate severity.
So for those of us that are not in the medical field,
Mm-hmm.
will you break that down for
Yeah.
us and just tell us kind of what that means?
Sure. An adjustment disorder is basically just based on a stressful situation that might have happened that is their reaction to that. So it's pretty common, especially in her.
She's completely unqualified to be giving these opinions. I'm sorry. She's completely unqualified just because she has a master's in whatever to be giving a medical opinion. She's a nurse practitioner. To even be identifying these disorders, but perhaps this will be addressed on cross.
Age group. So, and then I specify, there's a specifier that you can add that says with mixed anxiety or depressed mood. So I added that. And then major depressive disorder. And then you can specify single episode or if it's been recurrent, and then the severity, if it's moderate or severe or minimal.
And you put single episode. Can you tell us what you meant by that?
Just that it wasn't chronic, that I was aware of at that time.
Okay. And so, and again, you're just able to render your opinions based off the information provided.
Right. Mm-hmm.
Does that appear to be?
It wasn't chronic, but she had been seeing therapists for years. And she is reporting that she started feeling depressed in 6th grade, and now she's in like 10th grade. I'm taking that back a second.
That.
Just that it wasn't chronic, that I was aware of at that time.
Okay.
But she
so,
told you.
And again, you're just able to render your opinions based off the information provided.
Right. Mm-hmm.
Does that appear to be, I'm sorry, there's actually another page to that. I want to talk to you about that before we move on.
Okay.
It talks about your clinical assessment and treatment plan, and we've already talked about what medication you put her on.
Right.
Tell us, there's another paragraph on that page that says SSRI slash SNRI slash TCA, and then it talks about patient warned of possible side effects. Can you tell us what that means?
This is just a warning for those drug classes that of possible side effects that could happen that I go over with all my patients.
And did you go over those side effects with Carly Gregg?
Yes.
And one of those side effects is self-harm, right?
Mm-hmm.
So what do you tell them, if they're having thoughts of suicide, what do you need to do?
Go to the emergency room, call us, and stop the medication, or go to the emergency room if you are afraid that you're going to.
She was already self-harming. She was cutting herself. Now we're just going to say, okay, I know you're already cutting yourself. You're already self-harming. But if it gets worse and you think you want to commit suicide, go to the ER. Here's a prescription.
You're going to harm yourself or others.
And at any point between January and the next time you saw Carly, did she tell you that she was having any trouble with her medication?
No.
I want to talk about the next time that you had the opportunity to provide treatment to Carly. Was that on February the 14th of 2024?
Correct.
And the notes I'm looking at say that was a telemed.
Right.
And it was mom was present.
Uh-huh.
So tell ladies and gentlemen, what does that mean, telemed?
They just have the option to do in person or a Zoom call for their appointment.
And what did Carly tell you? There's sort of a history provided by the patient. What did she tell you about the medication she was on at that point?
That it had not really had an impact on her at that time.
And so kind of what was your discussion about? We're on 25 milligrams. And then what did you talk to them about?
How it's affected them and if they've had any bad side effects. And if they have not, then, and it has not done anything like for her at that point, then we usually go up on it.
And I want to talk about those side effects because your medical records specifically say the patient denied SI, HI, and AVH. So if you could walk us through, what does it mean when it says patient denied SI?
Suicidal ideations.
And when she denied HI, what does that
Homicidal ideation.
And what about when she denied AVH?
Auditory visual hallucinations.
So she's denying seeing things that other people don't see and hearing things that other people don't see.
Right.
Did she also deny any other side effects from the medication?
Right.
You did a mental assessment and risk assessment on Miss Gregg again on that day. Can you walk us through that day? Was she oriented to time, place, and person?
Yes. And
did she report having any trouble with recent memory or remote memory?
No, not that I saw.
Down under thought processes, did she report having any abnormal or psychotic thoughts?
No.
And again, on page 3, in the records, it talks again about these SSRIs. And I think I failed to ask you, Olivia, is Zoloft an SSRI medication? What does SSRI mean?
Selective serotonin reuptake inhibitor, and that's the drug class for Zoloft, and that just means that it increases the available serotonin in the synaptic.
And what is serotonin?
It is a neurotransmitter that most people call the happy neurotransmitter, and it affects mood and sleep.
So when you put somebody on an SSRI, the goal is to try to make them a little bit happier.
Right.
Hence the antidepressant medication is
Yes.
going to help depression.
Yes.
And it says that, again, the patient was warned of any side effects. Do you recall if you specifically went back over that with them?
I don't recall.
Okay.
Didn't she say her mother was also present during that Zoom call that they had, their telehealth appointment? So is there a possibility that 14-year-old might not admit in front of a parent that they're thinking of taking their own life or having severe side effects? I don't know.
Was that the, you had a telemed conversation with them? Carly discussed that she didn't feel the medicine was really doing anything to her, so you decided to up it to
Right.
50 milligrams.
Mm-hmm.
Was there an opportunity that you had to see Carly after that?
Yes, one more time.
One more time. Okay.
Mhm.
And was that in person or was that telemed?
That was telemed as well.
And the records that I have been provided show that you saw her on March the 12th
Right.
of 2024.
That's right.
Could you tell us about what was relayed to you by Carly on the 12th?
1 week
She
before the
said
murder.
that the medication was making her feel like a zombie.
1 week before the murder, she tells this treating health provider, nurse practitioner, who has a master's in something, psychiatric nurse practitioner, that the medication is making her feel like a zombie. This is 1 week before the murder to the day, March 12th, 2024. Pay attention.
And what was your discussion with them once she stated that she kind of felt zombie-like?
I never want that for any adolescent. So we definitely were not going to increase it, and we just decided to go ahead and switch it to a different medication so that she didn't have that flatness and take away her personality.
When you talk about switching,
In my opinion, this is helping the defense. This is the state's rebuttal case. This is helping the defense. And this is stuff that the defense fought to keep out. I mean, the prosecution fought to keep out the medication and the changes in medication. She's reporting over her Zoom appointment that the medication is now making her feel like a zombie because she upped her from the 25 milligrams of Zoloft in January, 30 days later to 50 milligrams. And then when she sees her 30 days later, she says she feels like a zombie. My description of what it feels like to feel like a zombie may be very different from somebody else's opinion of what it feels like to be a zombie. So you tell me what you think it feels like to be a zombie. When I think of zombies, I think of like The Walking Dead. What did she mean by that? Feeling like a zombie? Do we just, okay, zombie, we all know what that means. 1 week before the murder, okay? They're on notice, my friends.
We're not going to increase it, and we just decided to go ahead and switch it to a different medication so that she didn't have that flatness and take away her personality.
when you talk about switching the medications, did
Okay,
you
so
tell
she's
her?
interpreting zombie feeling like flatness and taking away her personality when really Carly could have meant like I felt like a zombie, like I wanted to go kill somebody. Because don't kids watch like The Walking Dead or other movies where people turn into zombies and then just go eat people and kill them? Or aren't there certain video games? I'm not a gamer, so I really don't know. Where there are zombies in the video games and they go and kill and eat people? But instead of asking her what she meant by that, she thought, the provider thought that she meant that she had a flat affect and was losing her personality.
Just stop taking the Zoloft. Tell us about what your recommendation was.
I recommend tapering off so that you don't have any kind of discontinuation syndrome, which is a possibility, or rebound symptoms. So I told her to take 25 milligrams of Zoloft for 10 days and then stop it, and then start the Lexapro for 5 milligrams at the same time.
I want to back up again. I'm not in the medical field, so I want to make sure that tapering off means the same thing, I think.
Okay.
So she's on the 50 milligrams,
Right.
and then you want to put her on 5 milligrams of Lexapro.
So we're going to define tapering off, but we're not going to define what it feels like to feel like a zombie? Really?
Simultaneously as going down on the Zoloft.
So the Zoloft, you're saying like come down a little bit of this
Right.
while we're taking this so that you don't just get off all the medicine.
Right. Weaning off.
And you said something about to rebound effects, to prevent rebound effects. What does that mean?
If you have a discontinuation syndrome, if you stop your medication abruptly, there's always a risk for symptoms to come back, maybe worse, and then other things that just are uncomfortable whenever you're withdrawing.
And you don't know when you prescribe people medication whether they're adhering to your recommendations or not.
No.
At any point during that evaluation with Miss Gregg, did she report that she was hearing voices?
No.
In fact, I think the very last line you said, again, she denies SI, suicidal ideations,
Mhm.
that she denied homicidal ideations. Is that
Mhm.
right?
Right.
And that she denied AVH, audio,
Auditory visual hallucinations.
She denied it in
And
front
you
of her mother.
also did a mental status exam and risk assessment of Miss Gregg from that day.
Right.
And I'm looking at your records, fate stamps number 754. Could you tell us what your findings were with regards to whether or not Carly Gregg was oriented to time, place, and person?
She was still oriented within normal limits.
So again, she knew where she was, she knew who she was, she knew the time.
Correct.
Her recent memory, what did you determine?
It was normal.
Intact. Excuse me, I didn't mean to interrupt.
I'm sorry. It's intact.
At any point in your providing treatment to Carly Gregg, did she tell you, I'm having memory problems?
Not that I recall, no.
Did she ever tell you about any blackouts, any lapses in time?
No.
Did you ask? Did you ask her? Did you ask her? Is this going to be like a Jen McCabe kind of thing? Well, you didn't ask me that, so I didn't say so.
You go down and you talk about her judgment on that day. Could you tell us what your findings were with regard to that?
Within normal limits.
Mhm.
And her
But she's still
thought
cutting.
process rate.
Normal rate and rhythm.
So if you would, I don't think I'd asked you about that, Olivia, before now.
Mhm.
So she had said on her questionnaire there were like some racing thoughts sometimes.
Right.
Racing thoughts. Hold on a second.
Within normal limits.
And her thought process rate. You go down and you talk about her judgment on that day. Could you tell us what your findings were with regard to that?
Within normal limits.
And her thought process rate.
Normal rate and rhythm.
So if you would, I don't think I'd asked you about that, Olivia, before now.
Olivia.
So
She's
she
calling her
said
Olivia.
on her questionnaire there were like some racing thoughts sometimes.
Right.
But when you observed her, what does her thought process rate was normal and in rhythm mean?
That it was not racing.
And that was the same on all 3 times that you had come in contact with her.
Right.
You didn't come in contact with her
And
over
she
Zoom.
Also, you had questions and reported in your records that her there have been no thoughts of abnormal or psychotic thoughts. Is that correct?
Right.
So to be clear, at no point in the 3 times that you treated Carly Gregg did she report hearing voices.
Right.
At no point did she report that she was having lapses in memory.
Correct.
Did she ever use the word derealized?
No.
She never described herself as feeling derealized?
No.
Did she ever use the word disassociation?
No.
Are those words that people typically use when you're treating them as patients?
Not
Jackson.
typically, no.
Those are more like clinical terms.
Right.
Court's indulgence. No further questions, Your Honor.
Oh, please cross.
Good morning.
Good morning.
How are you?
I'm good.
How many times did you see Carly from January to March of 2024?
3.
And how many of those times were in person?
Once.
And how many of those 3 times was Ashley Smiley also present?
All 3.
All 3. And was she in, like when you were seeing Carly in person, was she in the room with you guys?
Yes. Uh-huh.
Okay.
I just want to
And-
say that when my children are screened, and I have 5 of them, historically, when they are screened for such things as like this, I am sent out of the room. I am also sent out of the room if I bring a child to the emergency room with a broken bone, with a dislocated elbow, with any sort of injury. I am sent out of the room, no matter what age my child is, so that the doctor can speak to my child alone because they're screening for abuse and things like that. To do these interviews in front of her mother immediately says to me, she may not have been telling the truth. And she may not have been telling the truth regardless, because Somebody who's 14 years old may be embarrassed by such things as hearing voices. Okay? I'm just going to point that out.
What, if any, conversations did you have with Miss Smiley during the course of your treatment with Carly?
For any minors, we have to get consent for treatment and medication. We talked about the whole treatment plan and what they were okay with and came up with a plan together.
Is it fair to say that you don't have the same confidentiality between a medical provider and a patient if that patient's a minor and their parents is in the room?
We can, by law, we have to report anything. We cannot tell anything that they tell us except for if they are a danger to themselves or others.
But if the parent's in the room with them,
Oh, yes.
yeah. So there's really no confidentiality between you and Carly if someone else is in the room with you.
I'm not sure I understand.
If a parent is in the room with you, Carly doesn't have confidentiality between you and Carly, right? Because somebody
She
else
could
is
have told me
present.
anything. We could have spoken alone. I gave them the option of that too.
And
We gave them the option of that too. I'm just going to point out this attorney's talking about doctor-patient privilege, confidentiality, which is the same for attorney-client privilege. I have attorney-client privilege with my client as long as the two of us are in the room together. The second they want to bring in their brother, sister, boyfriend to our conversation or our meeting, I have to advise them. You understand that once you bring a third person into this conversation, you're waiving attorney-client privilege. It's the same for medical providers. I'm not surprised that this medical provider doesn't know that. Thank you, Chantal, for the love of the traveling Mary. Love you so much. Love you too. Love you too, Chantal. Thank you. Thank you, Lori, for the super sticker. Thank you, Welsh girl, for tuning in from Welshland, from the UK, and for giving a very generous super sticker. I appreciate you. LA, baby. LA, baby. Thanks for the 10. Some of y'all fell asleep during the golden rule lesson in elementary school, and it shows. If you don't have anything nicer to say, then thank you. I appreciate you. LA, baby. This is the way the day is starting off. It started off with the complainers. I was in a great mood this morning, and now this testimony is really going to throw me off the edge, but we'll see.
if Carly would have reported to you between January and March that she was having auditory hallucinations, would that have been something you felt like you needed to report to a parent?
No.
No. If a patient tells me that they're hearing voices, I do not feel that I would tell her parent. Remember that the jury is going to be weighing the testimony, right? They're going to weigh the testimony of this witness and her qualifications, who actually treated Carly and may have caused some of these issues, with the testimony of a Harvard doctor or a very highly educated forensic child and adolescent psychiatrist. That's where the weight of the testimony comes in. But even if Carly did say she was hearing voices, this nurse practitioner would not have told her parents.
You wouldn't have needed to tell her mom that she was
Not
hearing
legally,
voices?
no.
Not legally.
But just based on your own personal treatment, would you have felt like you needed to?
Personally, yes, probably.
And if you knew that Carly had reported to her best friend in her personal journal that she was hearing voices, would that have changed your diagnosis of Carly?
I can only go off of what I assessed at the time.
If Carly would have told you that she was hearing voices
Mm-hmm.
and having these auditory hallucinations, would that have changed your treatment of Carly?
Yeah.
Would it have? How so?
I would have to rule out. Well, we would have potentially started her on a different medication.
And different how?
An antipsychotic is what we use to treat that.
Okay.
Mm-hmm.
Mm-hmm.
And why would you use an antipsychotic in that situation?
Because that is what hearing voices is. It's psychosis.
Oh, okay. How about you send her to an actual doctor? How about that? How about you maybe get her an emergency appointment for a psychiatrist or even like maybe a 72-hour-old or something. You just would have started her on an antipsychotic. So everything that you're doing and prescribing is based on what this patient's telling you. The system is flawed. It's flawed.
And is it fair to say you can be a great medical provider, great at your job, and doing your very best job, but still miss things sometimes?
Sure.
And is it fair to say that if a person is experiencing memory loss, they might not always be aware of it?
Possibly.
Is it fair to say that if a person has lost time, they might not always be aware of it?
Sure.
And if we can look at, do you still have your report in front of you?
I do.
Can you look at page at the bottom? I think it's 742
Mm-hmm.
in red. And can you look at symptoms?
Uh-huh.
And the visit date there is January 15th, 2024.
Right.
And was that the first time you saw Carly and her
Yes.
mom?
Uh-huh.
And what symptoms were reported at that time?
Depression, anxiety, cutting, insomnia, overthinking, hopeless, racing thoughts, and stress.
And if you will turn to page,
Mimi, are you inside her head? She heard no voices. We don't know. We're not inside her head. That's why we have juries. The jury is going to be the finder of fact here. Please, when you're stating your opinion, say, in my opinion, unless you're inside her head, you don't know what she heard and what she didn't hear. But this witness is telling the jury that if she was hearing voices, that would mean she was psychotic. That's what she just said.
745.
Okay.
And again, this is the same visit date, January 15th, 2024.
Yeah.
Can you read what's written there under family behavioral history for father?
It says father, manic bipolar, ADHD, drug, alcohol, and prescription abuse. And this was filled out by Ashley.
And is bipolar disorder, based on your knowledge and experience, is bipolar disorder often hereditary?
It can be.
And can you tell me what's the difference between someone feeling sad and a major depressive disorder?
Yeah. We all have changes in mood. Sadness is considered normal, and a depressive episode or depression, major depression, is something that interferes with their daily life.
Okay, so it's affecting how you function.
Right.
Okay. And if you could, will you turn to page 748 with me?
Okay.
And if you look at the last paragraph on that page, the first sentence, and this is, I guess, when you're going over her
Right.
prescription medication.
Mhm.
And again, this is still from January 15th, 2024. Can you tell me what's written there on the sentence that reads, this can lead to?
This can lead to increased thoughts of self-harm. Many psychiatric medications have been shown to possibly worsen the symptoms or cause increased thoughts of self-harm. Please stop the medication and notify the clinic if this occurs, and seek help in the emergency department if you do not feel safe.
So it's commonly known in the medical community that sometimes if you put somebody on an SSRI, it can worsen the symptoms they're already experiencing.
The black box warning is for self-harm and suicidal thoughts. So that is a possibility.
What is a black box warning?
Something for the whole class that's considered serious.
Okay, so it's like a warning.
Mm-hmm.
Okay. And if you will, I just have one more.
Her
question
saying
for you.
should be objected to every time. It needs to be verbal for the court record. Cannot be taken down into a transcript. She should be saying yes or no.
If you can turn to page 753. And this was your March 12th, 2024 visit.
Uh-huh.
And can you read the second sentence on that page? And this was after the telehealth visit with Carly and her mom. It starts with, she said she doesn't like the Zoloft.
Right. That it makes her feel like a zombie. So we will wean off of it and switch to Lexapro.
And then will you read what patient's mom?
The patient's mom declined Prozac as she herself took it years ago and it gave her suicidal thoughts.
Okay. And is that what Miss Smiley reported to you that day?
Yes.
Thank you.
Ashley's mom said Prozac made her suicidal. Don't give her Prozac. It made Ashley suicidal.
Beg the court's indulgence, Your Honor. Is it fair to say sometimes patients don't tell you everything you need to know?
Right.
Does that happen more so, like not just with children, but with all patients?
Well, if they're not telling me, I don't know.
But it's fair to say that that happens.
Yeah.
No, tender the witness.
Redirect examination.
Olivia, I think on when Miss Todd was questioning, you said something about that you gave Carly the option to meet with you alone. Can you tell us about that?
Sure. Usually I ask right when I go get the patient out of the waiting room, do you want mom to come or do you want to meet first alone? And I don't recall whether she wanted to be alone. If she wanted to be alone, I would have seen her alone, of course.
And that didn't happen in this case?
No.
Ms. Todd asked you about if a person was having memory problems, they might not report it. They might not know to report it.
Right.
Did Ashley ever report to you that Carly was having memory problems?
No.
Did Ashley ever report to you that Carly was having disassociation?
No.
Did she ever report to you that Carly had said that she feels derealized?
Objection. It's already been asked and answered. It's improperly read.
Overruled.
It was asked and answered.
Did Ashley report to you that she had ever had homicidal thoughts while she was on Prozac?
No.
And I
She
want
wasn't on Prozac.
Ashley.
Oh, no.
The medication, and Miss Todd thankfully had you read that whole thing. It talks about self-harm.
Uh-huh.
It never says that it can cause homicidal thoughts, right?
No.
And in fact, none were ever reported to you in this case.
Correct.
Ms. Todd asked you about the medical history on page 745 regarding Carly's dad.
Right.
And I think it was your testimony that Ashley had filled that information in.
Right.
You did not diagnose Carly's father
No.
with having bipolar.
No.
They do mention, though, that he has a drug, alcohol, and prescription abuse problem, right?
Correct.
In your experience in training, Olivia, can people that are on drugs sometimes appear to have bipolar symptoms?
Sure.
And sometimes doctors, even though they're really good at their job, they might miss something and misdiagnose someone with bipolar.
Correct.
And you have no way of knowing if Mr. Gregg's diagnosis was actually bipolar, do you?
No.
And it very well could have been.
Isn't it also true, doctor, that perhaps addiction is genetic in some senses and it could be passed down to children? Isn't that true? So now you've got a child who has potentially a bipolar, drug addicted parent. There's a couple, and the mother felt suicidal on Prozac. So there's all kinds of family history here. But just keep giving her the meds. No worries. No worries. Cutting, no big whoop.
That it was his drug problem.
Sure.
And so drug problems are also hereditary, aren't they?
Oh,
Yeah.
Drug addiction.
well, at least she
I
asked.
want to take you to page 7.
I didn't know she was going to say that.
Ms. Todd asked you some questions about that note, and that was your treatment record from, February the 14th. I think. Hold on, I'm sorry. No, I'm sorry. That's March the 12th of 2024.
Okay.
That very last line, what did you report regarding Carly's sleep habits?
She reported good sleep.
So March the 12th, 2024, she's telling you that she's sleeping well at night.
Right.
Again, just to be clear, you can only treat with what you're provided with, the information you're provided with.
Correct.
And you were never told that Carly had any memory lapses,
No.
any audio, auditory voices.
Right.
No further questions, Your Honor.
But even if she did tell you you were hearing voices, you wouldn't tell her parents, right? because legally you're not required to. What about the fact that she had been put into an alternative school for a semester because she brought a Swiss Army knife to school? What about that? Did that factor in? Anybody know anything about this alternative school that she was sent to in Mississippi? Was it in Mississippi? Did they send her away to a troubled teen camp or a wilderness camp somewhere? What was this alternative school that we heard about? What happened to her there? Anything? Was it a boarding school? Was it a day school? Were there lots of other troubled kids there? What happened there? Because if anybody knows about the story of that, what happened to Paris Hilton when her parents sent her off to those troubled teen camps, it was horrific. I need to know more about this alternative school now. I have more questions. If anybody knows, please drop it in the chat. We're very collaborative here.
To be finally excused by the state,
Yes, sir.
by the defense. Free to go. Please leave the exhibit.
Okay. She's finally excused.
State may
That's what
call
they
the
said.
next witness.
State calls Rebecca Kerr.
Carly smiled at that last witness, Olivia. Olivia, because she never addressed her by her last name. I think she liked Olivia.
Obviously, adjust yourself up to the microphone. It's not necessary that you speak directly into the microphone. I need you to speak loud enough that lady up there in the corner can hear you. Okay? Do you understand that you're now under oath and your answers are sworn answers subject to penalty of perjury? All right, you may proceed.
If you would introduce yourself.
My name is Rebecca Kirk. I'm a licensed professional counselor.
And Rebecca, where do you work as a licensed professional counselor?
I'm an owner of a small practice called Magnolia Counseling in Madison, Mississippi.
If you could tell us just a little bit about your educational history.
I received my undergraduate degree in English education from Mississippi College, and I taught some prior and most of it simultaneously while I've been a licensed professional counselor. And then I received I taught accelerated English mostly, so gifted students chiefly. In the 9th grade at Madison Rosa Scott for 14 years, and 2 years in Virginia. And then I also received my master's degree in marriage and family therapy and individual counseling from RTS Jackson, which stands for Reformed Theological Seminary. And that consists of a very robust master's degree program where we do 400 face-to-face contact hours in clinic, and then 600 indirect supervision hours, and then postgraduate degree we work and do 3,000 more hours with the public under a licensed supervisor before sitting to take the mental health equivalent evaluation that the state requires for licensure. I also have to do 24 hours of continuing education classes every 2 years to maintain that certification and licensure.
And so is it safe to say that you are in fact licensed?
I am.
And you were back in March of this year too?
Yes, ma'am.
Rebecca, it sounded like you have a lot of experience working with teenagers too.
I do.
Did you have the opportunity?
She's calling her Rebecca also, right? What's up with that? You can't call her Ms. Kirk? I don't know. To me, that's just a little bit, I wouldn't do that. Is that a Southern thing? But I don't think so, because they call everybody else doctor, officer. Why with women? We're just going to call her Rebecca. I don't like it.
To have a patient or a client by the name of Carly Gregg?
Yes.
Do you see Miss Gregg in the courtroom?
Yes.
Same Miss Gregg that you provided services to?
I do.
Do you keep medical records with regards to the sessions that you have with your patients?
I do.
May I approach the witness? Rebecca, I handed you what's previously been marked as State's Exhibit S21. Actually, I think that might be Defense Exhibit D21, excuse me. If you'll take a look at those for us.
Okay.
Do you recognize that document?
I do.
And what is that?
These are my entire treatment notes and summary of counseling Carly, Madison, Gregg.
And in some of those notes, Rebecca, when we got them, there was some writing, like some handwritten stuff in that.
That's right.
Who did that?
Okay, so that the original intake form that she's referring to is completed by Ashley Smiley, or was completed by Ashley Smiley, and the last page concludes with questionnaires, checking off like just main mental problems that a person might be experiencing. It also asks to list the goals for therapy. And the first session that I have with someone, I go over the fact that since she's a minor, I need to speak with just that first session, one of the parental guardians, unless there is a need to contact them otherwise. I make that very clear to any minor and any adult that I see, that confidentiality, and I do kind of want to say this, it's very important to mental health professionals to, sorry,
Oh, she's gonna cry.
to maintain confidentiality
Oh, she feels
and to
terrible.
not really betray that trust. It's very important. And I am doing that somewhat today from some people's perspective, but I'm not according to the Mississippi state law, because of when you declare reasons of insanity, I do have permission to discuss. She has given me permission to discuss her medical history. So confidentiality is important to me. And I make that extremely clear. I just did then. Sorry for that. I worked with teenagers for many years, and so any mental health professional does say and has a duty to say that it is confidential under with the exclusion of just a few circumstances, which would be if someone reports that they're going to harm themselves, if they know of a threat of harm to themselves or another, or if there's any physical abuse. And so I did meet with Ashley Smiley to answer your question for a portion of the first session. And so it's kind of confusing, that last page. I want to explain it. She completed it. She said that there were 3 goals. There are also questionnaires, that are customary. Is it helpful for me to describe what's on this last page or no?
Sure. You'll just tell us. Let me take a step back.
Sure.
If you would, what was the date that this paperwork was filled out?
This was her very first session with me, which I think was January 22nd. Does that sound right? 2024.
Your records reflect the first time you met her was January.
Yes, that's right. I see it here. Mm-hmm.
So, and I apologize, I interrupted you a little bit. Yes, if you'll just tell us sort of what this handwritten note reflects and kind of talk us through that first visit with Ashley and Carly.
Okay. So the first note that I have was completed, or the first set of goals on that last page of the intake form says by Ashley, she wants to feel better about herself. And secondly, another goal would be self-care management, internal thoughts. So then I followed up, and she also wrote, Carly has been complaining of sleeping trouble and thoughts of depression, hopelessness. We discovered issues of cutting and taking old sleeping pills. Those issues have been removed and controlled, but also signify the possible level of depressive thoughts. So then I would continue to just question Ashley Smiley and, wrote down on the same sheet some of the answers she gave me. And then I met with Carly the same session and added to some of that information on the same page that Carly, based on talking to Carly.
So you kind of down at the bottom of that page, Rebecca, there's some things, it's kind of almost like a checklist. This actually says checklist of current functioning. And then somebody has marked easily angered. Do you know, is that something that you would have done or that either Ashley or Carly did?
Either Ashley or Carly, and I would assume it would have been Ashley, but then I confirmed and went over it verbally with Carly as well.
So they both reported that she was easily angered.
Yes.
It does say that she has intrusive or disturbing thoughts. Did y'all talk about what that meant?
Yes. Just basically, I asked her, one of the biggest things that you do is you ask why now, because a lot of times people do war with common stressors and then more severe ones. And I wanted to know exactly why they were coming. And Ashley had said that Carly had been cutting herself, or she had found an old iPod. And in that old iPod, she found out that Carly had been cutting herself for some time. And she also described some dark thoughts. And so I tried to kind of get to the bottom of what that was, thinking that they were, representative there by that check mark of has intrusive, disrupting thoughts.
She found an old iPod, and through the iPod, she found out that she was cutting. So I guess there was like some text capabilities or something on this iPod that she was talking to people, or she was keeping a journal on it in the old iPod.
And at some point they talk about, you have notes and it looks like they mentioned that Carly has trouble going to sleep at night.
That's right.
Um,
And that seemed to be a big deal to her, this sleep issue.
when you're treating a client, how important is it that you're getting accurate information from them?
Extremely. Again, that trust is so important. And so if you're not receiving the correct information, you can't see the whole picture. So you can't really treat the person in the appropriate ways, tailored for them.
We talked about that you had a meeting with Ashley and that you met with Carly. Who knows Carly better than herself?
Yeah.
No one, right?
Right.
So I want to ask you, Rebecca, on this first meeting, did Carly ever report to you any use of illegal drugs?
No.
Did she ever report to you that she was hearing voices of any sort?
No.
Did she ever report that she was having any sort of hallucinations?
No.
What about, did she ever report to you that she was having memory trouble?
No.
What about feeling derealized?
Her mother was
Or
there.
Ashley ever bring up the word disassociation?
Mm-mm.
And to be clear, I want to talk about the first day, but was there ever a time in your treatment of Carly that she reported that she was having any sort of blackout? Like there were times where she didn't remember what she'd done?
No.
So on the first visit, you kind of go through the current functioning and the checklist
Mhm.
With Ashley and Carly.
Mhm.
And then you actually provided some chart notes from that same meeting.
That's right.
If you could, I think you talked about this, that mom reported there was a burner phone.
Mm-hmm.
If you'll look down on page 2 of your records, it says mom was upset, she lied, and when she asked about the relationship. Is that something that Ashley conveyed to you, that she was upset Carly was lying to her?
Yes.
And then
Hazel Eyes says it is a boarding school. You mean the alternative school? If you know the name of it, Hazel Eyes, can you drop it in the chat for me? I'm interested. Thank you.
when you go down a little bit, there's a little bit of handwriting, and I think it says her bio dad.
Correct.
Who wrote that in the records?
I did. It was a grammatical, just edit for clarification.
And to be clear, there's some other times in the
Right.
records that when you produce these, you went in and kind of wrote names.
Because I want to be fully present, but I also want to take, records of what's going on for my need later to help her.
See, it says that she was 4 when her parents separated due to, and you put his and then her bio dad's pill, alcohol, and pot addiction. It goes on to say he was getting high in front of her. Do you remember who told you that?
Yes, both of them did. Ashley actually kind of broke down teary-eyed in the session, which I inferred was what we all feel as parents, which we, feel, am I the best parent? She felt a little bit, I read and then told her, this is not your fault, because she had discovered that he had been doing that for quite some time before Carly told her. It may have been like a year and a half, and I didn't get the impression the visits were often, but I mean, that's irrelevant. When she went, said that he would be high constantly in front of her with drugs all around. And then when she did tell her mom, she stopped, and then they were in actually court, discussion with trying to terminate his rights, I guess, permanently. And that was actually going on while she was seeing me.
And so she's got these other things that Ashley's told you about, the sleep trouble and the things, but you also learned in meeting with them that there's a custody battle going on.
Correct.
What about your note also says she was also taking sleeping pills because last month she hadn't been able to sleep and woke up at 2. And then it talks about now she's taken melatonin. So I want to be clear, in your records, it appears that the melatonin is not the sleeping pills.
Correct.
She was taking.
In fact, it was my perception at the time that that was one of the things Ashley was upset about, is that she was taking sleeping pills.
Did they ever tell you where she'd gotten those?
No, I know nothing more than that. Sorry.
Did you even ask what kind of sleeping pills they were if you knew that they were not melatonin? Was it Ambien? Ambien can cause some crazy hallucinations and things that people don't remember, like getting up in the middle of the night and eating everything in the refrigerator, or getting up in the middle of the night and driving somewhere and not remembering it the next day. We didn't want to dig a little deeper into that. And by the way, whoever put that comment in about your boarding school, this this is not a boarding school that she was sent to. That was like, Deerfield Academy or Choate. She was sent to an alternative school forcibly. She was required to go to this alternative school because she brought a knife to school, a Swiss Army knife that the stepfather gave her. So it's not a lovely, competitive, beautiful boarding school. It's this is an alternative school for troubled youth. And that was the question. So maybe you missed that part. I'm not stereotyping your boarding school.
Is there anything else that you recall specifically about that first interaction with Carly that we have not discussed?
The whole impression of working with her overall seemed to me to center on what was making her cut, these dark, nights of the soul, so to speak, when she was, she reported having like existential thoughts about life and, the meaning and things like that. And so that's kind of
What dark something of the soul? Hold on a second. All right. Remember, this first visit was in January, 2 months before the murders.
the whole impression of working with her overall seemed to me to center on what was making her cut, these dark, nights of the soul, so to speak.
Dark nights of the soul. I've never heard that expression before in a medical setting or any other. These dark nights of the soul.
When she was, she reported having like existential thoughts about life and, the meaning and things like that. And so that's kind of what I flagged in my mind as a practitioner to try to develop more trust and a desire to go there to see what was troubling her.
And do you recall, you said you kind of build rapport, trust with these people. Do you remember how many times you actually saw Carly between the first visit and your last visit with her?
Yes, I saw her every week, every work week, once a week, for a total of 9 sessions, which would have been 9 hours, not counting that time with Ashley. So it would have been a little less that first session.
The next time you saw Carly
I'm
in your
Catholic. I've never
records
heard that.
is from February the 2nd of 2024. Is that right?
Yes.
I want to talk to you. It says persons in attendance, patient. So can you describe for us, what that means?
I am trying to see where you are. Can you tell me what page you're on again?
Yes, sorry, page 4 of 24.
Okay.
And then about a little more than midway down on the bottom, it says persons in attendance. It says patient.
Patient, right.
What does that mean?
She was the only one there from session 2 to session 9. I spoke and interacted with only her, with the exception of Ashley always brought her to her appointments. I don't think I think that's an accurate statement. I think her stepdad did come with Ashley maybe like once or twice. I know like on Valentine's Day, for instance, they were together.
But he didn't ever come into the room.
No, nobody ever. It was just the waiting room. So I would see them in the waiting room, and that was all.
On that same page, Rebecca, you did, it looks like kind of an assessment of what you might do with a patient each time you meet with them.
That's right.
Could you tell us what you observed of her behavior that day?
Yes, it says appearance, normal, grooming and hygiene, attitude, calm and cooperative, behavior, no unusual moments or psychomotor changes, speech, normal rate, tone, volume without pressure, affect, normal range, congruent, thought process, goal directed and logical, perception, no hallucinations or delusions, orientation ×3. So that's like, where you are, like, the time, you can see where you are, hear where you are, those kinds of things. Memory, concentration, short and long term intact, insight, judgment, good, mood, stable and angry and sad.
So she reported to you that she was angry.
Mhm.
And I want to take kind of a couple of those one by one, Rebecca.
Okay.
You talked about behavior, no unusual movements or psychomotor changes. Can you tell us what that means?
Yes. Sometimes people are just very clearly on edge and they can't get to a calm place, and that's evidenced by a lot of movement in their chair or their body that's maybe not related to their emotional feeling of something they're describing necessarily, and then just like rapidity of speech, like very rapid, maybe loud speaking, things like that, maybe looking around a lot.
And you didn't notice any of
I
that?
did not notice any of that ever.
And it says her thought process was goal directed and logical. What does that mean?
She was able to carry on a conversation coherently without distraction, and that would have been okay if she was distracted. But she's very gifted and very, good with her words, and we discuss things in a normal manner.
You said perception, no hallucinations or delusions. What does that mean?
She was not reporting seeing or seeing anything that wasn't there, or not being present with reality or anything of that sort.
And what about her memory and concentration? What did you notice from that day in February the 2nd?
Her short and long-term memory seemed fine to me.
I want to talk to you about what your actual note says from that day and that visit. It says she's frustrated that her friends don't take school as seriously as she and loses her patience. Tell us what you meant when you wrote that.
She was gifted, as I think is a clear fact. She really enjoyed school, and I taught her type of student for 14 years. And so she had like an excitement to talk about school. And she also, I thought that probably one of the things she was dealing with that was difficult for her was possibly that sometimes when you're so gifted and different from others in any way, it doesn't have to do with that, you might feel lonely and a little bit more isolated. So I kind of attributed it mentally. I made a mental note that was probably a relation there. But she was just the patience part. She was just described like being frustrated with peers who were not as quick as she, and that she knew she could be a little rude with them. We also kind of talked about it's difficult when your mom maybe is a teacher too, because you appreciate good teachers and know how hard they work. And
Rebecca, your notes say that she's regretful when she snaps at them and hurts their feelings. So Carly was reporting to you that she's like snapped at some of the kids at school.
Yeah, and I did not get the impression it was in a violent way, but maybe like her temper, she knew that she was losing her patience with them.
And later on, about midway, it says she gets angry at others sleeping through such good teaching.
Yeah.
That's kind of what you were talking
Mhm.
about, that she
Yeah.
recognized she had good teachers.
Yeah.
I want to talk to you, Rebecca, about the next time that you saw Carly. I think you told us that you were seeing her pretty much weekly. The next record I have is from February the 9th of 2024.
That's right.
Want to talk to you again about what you observed from Carly and what you put in your notes regarding her behavior.
Okay. You just want to know
Page
that.
6, yeah, of 24.
Okay, the appearance and stuff.
That's right.
Okay.
Yes.
I think, let me just look at it to make sure I'm not misspeaking. Everything that I read a while ago, and I can read it again if the jury would like that, was normal, except the only change I made was her appearance. I specified her appearance was goth-like, wearing her grandmother's batwing black goth pants and straight hair partly in her face.
But everything else was in normal, and it's her behavior, her speech, her affect, her thought process, the fact she was not having hallucinations or delusions.
Correct.
Her orientation to time, place, and what's the third one? I'm sorry. Times 3.
Time, place, in your hearing, like just all of your 5 senses,
Okay.
you're aware.
And then memory and concentration, short and long term, were intact.
Yes, correct.
And then you also have some treatment notes from that day.
That's right.
I want to point you down to, it's toward the bottom of the paragraph. Toward the bottom of the paragraph, it says she has started cutting. If you would, can you read that sentence for me?
Yes.
Looks like it's fourth up from the
Yeah,
bottom.
I'm sorry. I'm trying to, because I have an edit. I have a grammatical error edit in there, and I'm trying to make sense of it. 1 second. Sorry for that.
No, that's right. I didn't want to read it myself in case I was reading it in the wrong place.
Okay, she has cut, not currently, but in the past, when alone and in her head a lot. It was my understanding that what kind of prompted treatment with the psychiatric nurse practitioner, Olivia Lieber, was that she had found that iPod with this information about how she had been cutting and how she had some dark thoughts. And I was trying to follow up, like I was saying a while ago, with like what was going on with you, like in those times.
And I think your note actually says, Rebecca, after some existential crisis moments of her atheism resulting in a lack of consciousness.
Correct.
Can we break that down just a little bit?
Sure.
Those are some big words for me.
Yeah, that's fine. So I never really could get her to open up about that very much. And I want to be clear that atheism, that was something that I was kind of trying to think might be a possibility. She didn't, as I recall, really use that word. But she did mention the word existentialism, and basically, in my opinion and training, I do think that's related to thoughts of what is the meaning of life, what's its purpose, why are we here? It was my and I could talk more on that maybe, but basically she would get in a depressed state and cut. And she described it as an existential crisis. But I couldn't really get her to describe a whole lot about that.
Okay, I want to just mention something here about stepdad Heath, who said that everything was fine with Carly. She was a very happy kid. She not a problem, very happy, nothing going on. She's been seeing not only this nurse practitioner since January 2024, 3 months before the murder, but she's been seeing this counselor every week. They know about her cutting. They know about these dark thoughts. Now there's some talk of atheism and dark nights of the soul. But according to Heath, everything was hunky-dory. She was the greatest kid ever. Something's not adding up. It seems like Ashley was telling Heath everything. You think Ashley was just hiding that from Heath? But she's going to therapy every week, and he's in the medical field. He's a physical therapy assistant. I don't know. Something's off.
But you tried to ask her about that.
I did. Yeah.
I want to take you to the next time you saw Carly, Valentine's Day, February the 14th of 2024. And I apologize, Rebecca, I didn't ask this earlier. At the top of each of these notes, you mentioned like whatever medication she's on.
That's
at the
correct.
time.
Yes.
Are you and the nurse practitioner, Olivia Lieber, are y'all in contact about that, or is that relayed by the patient?
The psychiatric nurse practitioners or psychiatrists who prescribe psychotropics, they oftentimes refer a patient, and then unless there's a need, like for an alarm, situation, oftentimes we don't collaborate unless needed. So no, I would be reporting what Carly told me about her med changes.
Is that a good idea when it's a pediatric patient?
uh,
Is that a good idea when it's a pediatric patient to just be relying on what the pediatric patient tells you instead of maybe, I don't know, getting the records from the other provider that's providing the medication? I don't know. Call me crazy.
We talked about this, and I'm going to ask you about each time you saw
Sure.
Carly, what you noticed, who was in attendance on that day. Well, we might get straight on this. You said the only time anyone else was in the room was that first visit.
Correct.
What did you observe about her behavior on February the 14th, 2024?
Okay, and I'm just making sure I am looking at the correct note.
Yeah, I'm
let
on
me change
page
it.
8 of 24
Okay,
of your
thank you.
records.
Everything that we have prior discussed was the same. The only difference was her appearance. This time was just black clothing, not necessarily her grandmother's batwing black pants with the black shirt.
She was dressing goth, which makes the outfits that she wore pre-trial even more of an odd choice. As we all frantically Google Newport Academy. Thank you, Hazel Eyes. I appreciate you.
I want to take you to the next page, Rebecca, about midway down. She says, your record says she rated hating herself, including her humor, and says she wouldn't be her friend if she wasn't her because she's dismissive of others' ideas when she knows it's wrong. Was that something that Carly related to you?
Yes.
Tell us about that.
She seemed to, again, be struggling with maybe some social stuff that I believed was stemming from her feelings of being different and having such a zest and fervor, and she really does love to learn. And so she would just talk about, it seemed like she was being introspective about like, what kind of a person am I?
And it seems like a lot of her conversations, at least up to this point, revolved around her at school.
Yes, that's correct.
Was she kind of obsessed with being great at school?
Yeah, she liked school a lot. And she was glad that I could tell that she had been affirmed a lot in her life for being intelligent. And so she was proud of that, but she also just had a genuine love for learning.
I want to take you to your next visit with Carly, February the 21st of 2024, and talk about her appearance. Does it look like that's the same appearance and behaviors, thought process, no hallucinations, no delusions, things like that we talked about?
Correct. And nothing has changed.
Your treatment note, the very first line of that says she's reading The Castle and she likes it and will read Crime and Punishment. So you told us earlier that you were an accelerated English teacher.
Yeah.
What is The Castle? Because I don't know.
I actually do not know that one very well. I just know that they're well known. She also mentioned that she wanted to read The Bell Jar. But I had wanted to read Crime and Punishment for a long time, and I've actually owned a copy for 21 years. So I was really glad that she wanted to read the classic. I knew that was a classic.
Can you tell us what is Crime and Punishment? Kind of what's that story about?
Crime and Punishment.
I mean, what does that have to do with anything? That she wanted to read Crime and Punishment. Okay. Lauren, I put this up earlier. Thanks for the 10. Says, my husband of 47 years is bipolar. I've witnessed the heartbreak of this illness. For this reason, I believe Carly did not receive the help she truly needed. Thanks for sharing your personal story, Lauren, as so many of you do. Dennis the Menace says, Ashley was controlling. She should have seen and asked her to leave the session. Well, it is Mississippi. Thanks, Dennis. Kathleen, thanks for the 10. Didn't Dad say he didn't really know the court stuff, what the court stuff was about? You're right. That Ashley was handling it, yes. And now we've learned that apparently Ashley was trying to terminate his parental rights, the bio dad, and sharing all of that with Carly, which is way too much to lay on a child, in my opinion. Some parents tell their kids way too much. It's not healthy. Clinton, thanks for the compliment on my boss. I appreciate that. Getting well is difficult work. Wendy DB, thank you for the 5. Dennis the Menace says the DA wasn't even listening, looking at her notes. Shards of Words says minors aren't usually prescribed Ambien. That's my point. My point is that did she find these pills in the house? Oh, there's a damn fly.
I asked you if you would tell me a little bit.
Did she find sleeping pills in the house that were intended for someone else? They refer to them as old sleeping pills. I think they should have tried to find out what they were, because Ambien can cause some really wicked side effects.
About what Crime and Punishment is about.
Crime and Punishment is about a protagonist, which is the main character. It was written by a Russian author back in maybe 1866, I believe. And it is the entire book, very difficult book, about a psychopath who lives in Russia, and he is poor. He is a student. He is very intelligent. And he comes on hard times, impoverished, and he has this obsession with this obsessive thinking of basically planning to murder a woman with a hatchet. And the novel kind of really, that murderous act happens pretty early on in the novel. And then the remaining novel continues to kind of be about his processing of it. And he even published something in the paper about why people kill and things like that. Anyway, and then he eventually is sentenced because of his admittance of his crime. That kind of also was found out as well. But he was declared insane, and he served 8 years in a Russian labor camp. And when he was in the Russian labor camp, he was unrepentant, and he did not think that what he had done was wrong and that the woman deserved it. He did actually kill her sister too with a hatchet to her skull, but that was kind of by accident because she came home too early.
And Rebecca, in your notes, you'd actually underlined the fact that she was reading that book.
Well, that was just for grammar, because you're supposed to underline a title of a book if you can't italicize it.
Because she was an
Did
English
you and Carly
teacher.
have any other discussions about reading any kind of literature, like kind of dark literature like that?
Not that I can recall. No.
I read a lot of Stephen King when I was a kid, but I didn't go around murdering anybody, and I didn't kidnap some man and keep him in my basement. So is that what we're going with now, prosecution? Reading Crime and Punishment and made her do it?
And to be clear, in this note, she had not yet read it. She was reading The Castle. This was on 2/21, and she was going to read Crime and Punishment, and she did so later. But I think she read it the week of spring break. And I saw her Monday after spring break. That was my last session with her, the Monday first back after spring break.
Okay, thank you for that. I want to take you to the next note, February the 26th of 2024. Again, without belaboring the point, same appearance, behavior, speech,
Yes.
affect.
The only difference is appearance is black t-shirt and jeans.
In your notes on that day, it said something about she may be on the spectrum. Can you tell us what that meant?
Carly came in that session, and she was telling me that she had a lot of symptoms of kind of autism, and that's what that means. And so, like Asperger's, and she was talking about just sensory issues and things like that. But yeah, that's what that means. Yeah.
And so Carly was telling you that she thought she had autistic symptoms.
Yeah, I mean, she never used the word, but I knew, and most teenagers are very familiar with what that is, and I mean, I just assumed that she thought she had that. Yeah,
And based off your treatment, did you think that she actually had autism?
I didn't. She did report too that her mother didn't either.
I wanted to,
So now you're going to all of a sudden reveal that she may have been on the spectrum? Was she making up those symptoms, or she was telling you symptoms of things that may indicate that she's on the spectrum, but you didn't think she was? In my opinion, all of this rebuttal case is only helping the defense, because now the jury is going to be so confused about what was wrong with her. They're going to be thinking of a million reasons why this could have happened, and that's reasonable doubt. Okay.
take you to the next time that you saw Carly, March the 5th of 2024.
Okay.
Again, you saw her in person.
Correct.
And the history given regarding attitude, behavior, speech, affect, thought process, perception, orientation, memory, and concentration, kind of all that's the exact same.
That's correct.
In your note on that day, you have CBT and attachment therapies were discussed and explored to help alleviate anxiety. Can you tell us what that is?
Yeah, CBT is shorthand for cognitive behavioral therapy and attachment therapy. So those are just, there are many, many different forms of therapy that we're trained in, and cognitive behavioral is really good for depression and anxiety. It's about kind of trying to analyze your unpleasant thoughts and basically, for lack of better words, get a grip on them and have a better life experience. Attachment therapies are rooted in this well-known belief and research about the parent-child.
Not Sir Ray Davies. I think we're all picking up what you're laying down. We all get where you're coming from. You want to lock her up and throw her away, throw away the key forever. We get it. I just want to point out to you that Rebecca Kirk is not a doctor. Okay? I don't think anybody's hating her. I think she's confusing the jury even more with all of the things that she learned about Carly in the 9 visits leading up to the murder. Okay?
Bond and how we feel attached to people in our lives and how that influences us.
You also put in your records, boundary setting and identity work was explored. Could you tell us a little bit more about that?
Yes. So boundary setting would be just your classic, any kind of boundary you need to set to assert your comfort as a human being while also, not causing harm to another, obviously. But a lot of people have trouble saying no to people or sometimes saying yes to them, depending on the circumstance. So it's just kind of more of a work through of like, what do I want and how can I, in a healthy way, communicate that to others.
And at this point, Rebecca, is it safe to say, I mean, you're still in therapy, she's still in therapy with you, and you're trying to work on not cutting anymore and these thoughts of just anxiety and depression?
That's correct.
There weren't any other known psychiatric things disclosed to you?
No.
I'm going to take you to the next time that you saw Carly, March the 13th of 2024. And again, talk about the in-person visit and the observations that you made regarding her appearance, behavior, speech, and et cetera that we've been through. That's not changed either.
Correct. It's the same.
She does report to you that Olivia Liebers changed her medicine because she reported feeling numb.
Yes.
She didn't laugh as much, nor did she feel as upset when her mom yelled at her. That she finished her reading. Is that what you were talking about? That she told you that she'd finished reading the books?
That's right. Specifically that one, yeah.
And she sort of relates like her anger to her mom's stress, I think. And I want to ask you about that. She says when her mom is less stressed, she feels it in less anger. Can you talk to us about what that meant?
Okay. Okay, I'm trying to find where that is. Okay. Um, yes, that's kind of a poorly worded sentence. Sorry about that. I was kind of trying to do it while attending to her, but basically, she appeared to me to feel some codependent feelings, or maybe be a little bit codependent on her mother's emotions, and when Ashley felt something, Carly, seemed to be affected by it.
And I think I misspoke, Rebecca. I said when she'd finished her readings, and then at the very end of that, it says she's about to read
Oh
Crime and
yeah,
Punishment.
yeah,
So
definitely.
that was the following week that you were talking about.
Yes, this is the week of spring break, and she was going to read it during spring break, is what that said.
And then she talked about her mom asked her to promise that she wasn't trying to be a boy. Can you tell us? And then you wrote, I think it was you wrote, due to her new haircut. Can you talk about that?
Yes, I think we only talked about her haircut maybe twice, and she had literally just gotten her haircut before that session.
Wait a second. I need to hear that again.
We're talking about.
Yes, this is the week of spring break, and she was going to read it during spring break, is what that said.
And then she talked about her mom asked her to promise that she wasn't trying to be a boy. Can you tell us?
Her mom asked her, Carly, to promise her she wasn't trying to be a boy because of her haircut. I sense some way deeper issues here.
And then you wrote, I think it was you wrote, due to her new haircut. Can you talk about that?
Yes, I think we only talked about her haircut maybe twice, and she had literally just gotten her haircut before that session. So that day, this would have been a week before my last session with her, I think. She had her med change, she'd gotten her haircut, and I think on a session before that, she had just expressed, I always kind of want to make sure someone's not feeling like identity problems regarding their sexuality or something that needs to be discussed. And she did talk about how her mom, I think, wasn't a fan of it or was a little bit afraid or something. I'm not sure. I really cannot recall, but I feel like the reason why I said this is because we had probably talked about it earlier, as I recall. And so I was trying to follow up. How did you think about your haircut? So she wanted you, she was okay with it. And she was like, yeah, she just said, that promise me you're not trying to be a boy.
And did you, in your 9 sessions with Carly, did you ever think that she was having some sort of identity crisis?
No. And in fact, I followed it up that time and the very next time, which was the last time I saw her, because the next time I saw her would have been the first time her peers at school had seen her new haircut. And I wanted to be sensitive to the fact that, are you being bullied at all? Like, because there were some other negative things that had been said to her and other peers. And she always answered with a positive affect, like, no, it's fine. And I asked her too, like, was that?
Oh, because when kids are being bullied, they're going to tell you that they are being tortured in school. There's the bullying again. We brought this up another time through another witness. Because I remember talking about bullying.
The truth to your mom, you can tell me, it's fine, I'm not going to discuss your stuff. And she's like, no, I told her the truth, or something like that.
So I want to take you to the next report that
I'm not going to discuss your stuff, except now here we are in court because her insanity defense has waived her doctor-patient confidentiality or medical provider because she's not a doctor. And now we know that if Carly was confused about her gender identity, there was no way that her mother was going to accept her. I'm not saying that has anything to do with this whatsoever, but that's what this witness just told us.
I have is a treatment date on March the 18th of 2024. Is that the last time that you saw Carly?
That's correct.
And I do want to talk specifically about each of these on March the 18th. So
Okay.
you saw her in person by herself, right?
Correct.
And you reported that she was wearing a black t-shirt and jeans again.
Yes.
What was her behavior like?
Completely normal, the same as it always had been. She had just gone back to school. It was Monday, the first Monday back after spring break. And this was was it a 5 o'clock session? I'm not sure.
Yes, it's 5:50 p.m. to 5:55 p.m.
Okay. And so 5:50 to 5:55, 5 o'clock.
5 o'clock. Yeah.
Yeah.
Sorry. Yes.
So I met with her for an hour, and basically everything was the same that it had been as far as the way she appeared to me.
And at no time did she report any hallucinations or delusions. At no time did she report any memory or concentration issues.
No.
I want to take you to page 19 of 24. This is regarding your psychotherapy notes, that last visit you had with her. And she talked about kind of walking on eggshells consistently while mom's around. And I think you touched on this a little bit. Carly was maybe a little bit codependent on Ashley's feelings and behaviors. Can you tell us kind of what you meant, what that meant about walking on eggshells?
Yeah, but I think I want to say something a little bit before that, if that's all right.
Yes, please.
I honestly kind of had to lead this session with her and try to dig into some of this stuff that she might be feeling, because I was starting to really kind of wonder if I was really serving her the best I can. And, if I can and someone else can, I want to refer someone. I knew that she was a school teacher. Blue Cross state insurance plans aren't real rewarding on that end. And so I really had kind of contemplated, am I really helping her? Because I felt that the sessions were really mostly about school, but I knew that there had been a big event with why she was coming. And so I really kind of honestly did a little bit of soul searching and decided before this session that I wanted to really try to go there to maybe some painful things that she maybe was being hesitant to speak about. And so I did kind of bring that up. And I think that's important to note. Like, she didn't just start talking about her mom. I was trying to really get to some hardcore stuff with her in the session. And she, we talked about how her mom, when her mom was angry, it was really hard for her to really handle that. And so I'm always trying to get a gauge, obviously, let's rule out abuse. I did not have any indication ever before, during, or after that her mother was abusive, but I can't make that assumption as a clinician. I need to really be sensitive to anything that might not be being reported. And so I wanted to get kind of a measure of what does Ashley look like when she's angry. And she described, and it's in this note, that, she raises her voice sometimes, or slams doors, cabinets, speaks in shorter sentences. I think we actually discussed an example that's not noted here of, well, can you give me an example of her being angry or something at you? And she gave an example of maybe grading some tests of some kids. She's a math teacher. And so they were doing poorly on it, which is not what any teacher wants when she's grading tests that she knows she taught well, which I'm sure Ashley did. And she noticed her mood, and she wanted to be helpful, and she kind of maybe had, and I don't think maybe this event had necessarily recently happened. I was asking her to give me one so we could work through conflict resolution and her emotions and stuff. And she said that she had done, had offered to help her, and then her mother kind of snapped at her in response. And so I try to do a lot of work with okay, well, let's just take that example then. What do we do when we're upset? How can we communicate calmly, clearly? I emphasize the importance of cooling off. Your body needs to self-soothe. When it gets flooded and your heart rate gets to a certain degree, you can't think properly. And so we talked about things like that.
And your report actually says you talked about understanding anger and how to respond to it.
Correct.
That anger is a secondary emotion, and how to confront her mom when she's cooled off was explored. Is that what you kind of just described to us? I went through ways for Carly to approach anger.
That's right. Underneath anger is really sadness or fear or a blocked goal of some sort. Yeah.
I know that's the last time that you treated Carly, but there's actually another note that was added to your records May the 16th of 2024. Could you tell us about that?
Yes. Whenever termination of care has occurred, it's customary for clinicians to do a summary note. Either, sometimes very rarely, it just no communication ever happens, but oftentimes it's the joint, agreement or the agreement of one versus the other. And this was a very different case. And so I had to write a summary report on it like I would any other.
I want to talk to you a little bit about that, Rebecca.
Okay.
It talks about within 24 hours, something terrible had happened. And you state in your last session with me, she appeared emotionally stable and she had no suicidal or homicidal feelings suspected by me nor spoken by her. So I want to ask you about that. You said that she didn't tell you about any feelings, but you didn't think that there was anything like that going on either.
No, that's correct.
And then you also noted that she did not indicate that her medication change from the prior week was negatively affecting her.
Correct.
What did you mean by that?
Well, anytime that a person's prescription meds change, you need them to be very concerned about side effects, depressive thoughts, feelings of suicide, things of that sort. And so I wanted to follow up and make sure she wasn't experiencing any negative reactions regarding that.
You also said that, nor did she appear.
This counselor is telling the jury and you and me that side effects can be very brutal from changing medications in adolescent patients.
Different from any other sessions, nor emotionally unstable or dysregulated. Can you talk about what that means?
Yes, just kind of basically what we said, that was on the first part of each of my sessions. Like, she seemed very oriented to time and space and didn't seem to have erratic speech, loud speech, to be overly angry or overly happy. Just, a normal situation observance of her.
And then you go on to say she did not appear melancholy nor zoned out emotionally. Can you talk about what you meant there?
Yeah, she had reported several times that, at least one time maybe, but I feel like I maybe wrote it more than once. I'm not sure. That with some of the Zoloft, she felt like a zombie. And so, she never really appeared that way to me ever. But she had reported it. So I put it in my notes when that had occurred. But I was saying here that I didn't notice any of it as well.
And you talked about how you had gone through conflict management with Carly on the day before the incident.
Correct.
I think you also talked about kind of what you observed between Carly and Ashley's relationship. Can you talk about why you thought that was important to put in your record?
Yes, sure. Well, ordinarily, termination of care is in a very different manner, and I knew that this one was a very sad act that occurred, and I wanted to be clear that I did not ever observe them together other than in the waiting room, and I never really saw, anything that would allude me to believe that, or hint at any kind of very severe danger or threat.
At any point during your treatment in sessions with Carly, did you think that she was being physically abused by anyone?
No, never. In fact, I asked several times about the stepdad, and I'm very confident in her response, verbally and non-verbally, that it felt very much to me like that nobody that she was living with had been abusing her. Now, her biological father, yes.
And she described some incidents where he had been physical with Ashley as well.
Mm-hmm.
And then what about?
So her biological father was abusing her? Now we're just finding this out? Hold on. And remember, she wrote this summary, I think, after Carly was arrested because the treatment ceased because she was in jail.
Early termination of care is in a very different manner, and I knew that this one was a very sad act that occurred, and I wanted to be clear that I did not ever observe them together other than in the waiting room. And I never really saw, anything that would allude me to believe that, or hint at any kind of very severe danger or threat.
Well, of course she's going to write that
At any
after the
point.
fact, right? Maybe it's true, but she's writing this summary after Carly killed her mother. So wouldn't you be sure to say, I didn't see any signs of this coming as a way to get, escape maybe personal liability if you did and didn't report it? Because you are a mandated reporter. If a patient tells you that they're going to hurt someone or you think they're going to hurt themselves or others, you can break privilege.
Point during your treatment and sessions with Carly, did you think that she was being physically abused by anyone?
No, never. In fact, I asked several times about the stepdad, and I'm very confident in her response, verbally and non-verbally, that it felt very much to me like that nobody that she was living with had been abusing her. Now her biological father, yes.
Nobody she was
There, and
living with had been abusing her. Now her biological father, yes, he was abusing her. There it is.
describe some incidents where he had been physical with Ashley as
Yes.
well.
Mhm.
And then what about, I didn't see any note of this, but did she at any point ever report that she had been sexually abused by anyone?
No. she
Did you
told me
ask
she
her?
had not.
Court's indulgence.
She didn't report that to you, but did you ask her? I'm saying this to you with 30 years experience as a trial lawyer handling predominantly, but not only, child SA cases for plaintiffs who sued the Catholic Church, men and women, both who were abused by priests during their childhood. And until the scandal broke in 2002, they were now adults, some in their 40s, 50s, and 60s, who never told a soul. So did you ask? Did you look for other signs? I have questions.
No further questions, Your Honor.
Cross-examination.
Good morning. Doing well. How about you?
Just fine. My high school English teacher is about to be very proud. I too read Crime and Punishment, and you're right, it was written in 1886 by Dostoevsky. And isn't it true the main protagonist of that novel, Raskolnikov, killed his neighbor? The woman he killed was his neighbor, and he killed her because he hated her.
Yes.
Yeah, I'm sorry, could you speak up?
Yes.
Yes.
Mhm.
And isn't it true, actually, by the end of that novel, Raskolnikov felt so guilty about his action and was so remorseful that he didn't only confess, but he actually, in an act of remorse, bowed to the earth?
That's not the way I interpreted it, but that is the thing about literature. There's a lot of interpretations.
Yeah. Isn't it true, what the book is actually about? The act of murder happens in the first chapter. Isn't it true that the entire book is about how murder is such a horrible act and the weight and consequences that it carries on a person who does that?
Yes and no. I mean, you don't want to get me started. I'll go into my literature mode, but I really don't think the point of the book was about how murder is such a horrible act at all. I mean, I think it was about the psychological dilemma of someone mentally insane. And I mean, honestly, I think that's what that's about. It definitely is talked about, and there are different characters in there, including one that tries to kind of convert him to Christianity and stuff like that. But I mean, even when he's in the Russian labor camp at the end, he says that she kind of deserved to die. Like, I remember there being something like that. Don't quote me because it's been a minute.
But again, he hated his neighbor.
Yeah. she was a greedy, she loaned money to people and was very unkind to them,
Yeah.
but he didn't know her hardly at all. He just went and borrowed money from her.
And he was poor and she was demanding it back.
What did you say? I'm sorry.
And the main character was poor and she was demanding it back.
I mean, it was like a debt type thing. She wasn't, I don't know about the word demanding, but yes, she was greedy. She was definitely greedy.
So he had a motive.
Yes. Mhm.
Did Carly hate her mom?
I never got that impression.
What impression did you get from Carly?
I got the impression that she had complex feelings about her mom, because one time we were talking about her, I tried to talk about the custody case a lot.
Mm-hmm.
And I knew I mean, it was literally going on, and they were supposed to meet, and I would ask, how are you feeling about that? And I'm fine. And I got the impression, I'm just going to let the adults work it out. She seemed to have a lot of trust in Ashley to care for her and to protect her, as well as her stepdad in that. And, but there was one time when we were talking about the biodad and then her mom, and, she said emphatically, like, I know he doesn't love me. But I had to ask, like, do you believe that your mother loves you? And she really was a little unsure on that answer.
Yeah. But did Carly love her mom?
Yeah, I believe that she did. I had nothing to tell me otherwise.
And you said that Carly was a little codependent on her mom's feelings. Do you mean that Carly's emotions were real tied in to
Yes,
how her mom
that's
felt?
correct. Mm-hmm. It was
And-
probably mutual. Yes.
Yeah. And the feeling that, the example about, her mom, the example about being angry Carly gave you was actually about an incident in which Carly's mom got angry with Carly when Carly had tried to help her mom.
Yes,
Writing
that's
papers.
correct. Mm-hmm.
Okay. And it really hurt Carly's feelings. Her mom snapping at her when Carly was trying to help. It hurt Carly.
That's right.
Didn't make her angry, right?
Well, I can't speak to that. In fact, I would assume it does make one angry from what I know about emotion. Again, anger is a secondary emotion. And it is the more safe thing that we feel when we maybe feel threatened or unsafe. And it would be understandable that her environment growing up, she had to deal with a lot of emotions, that she didn't get to maybe express healthily. So that can make one be a little, anyone, and that's a normal thing.
And is it fair to say that Carly felt like she had to walk on eggshells around her mom because she didn't want to make her mom angry or
Yes.
more stressed out?
Mm-hmm.
And and Carly was always very careful. She didn't want to hurt her mom's feelings, right?
I don't know about her always being very careful, but I do know that, and I think that would be impossible for someone to always, but I do know that she seems sensitive to her mother's feelings. Yes.
And Carly didn't want to hurt her mom's feelings.
Right.
Is it fair to say that Carly really wanted to please her mom?
Yeah, I think so for sure.
Carly wanted her mom to feel proud of her?
Mm-hmm.
Is it fair to say that Carly didn't ever want to worry her mom?
I don't know about ever, but I do know that probably chiefly, like, no child wants to worry their parent. Yeah.
Is it fair to say that, Carly knew her mom was pretty stressed out and didn't want to add to that stress?
I really can't speak to, like, the level of stress she observed in her mother. But again, just making a basic assumption of any normal person, and she never led me to believe that she was different from any other average person. I would have concluded that, but I can't say that because I didn't observe every situation.
Yeah.
I only know what she reported to me when she came to me.
Okay. And is it fair to say that a person can sometimes, if their feelings get hurt and it makes them mad later, that a person can feel mad without expressing that emotion to others?
Yeah, absolutely. Yeah.
And did you in fact know that Carly never got a chance to read Crime and Punishment?
No.
I'm sorry.
No, it was my understanding that she did.
Well, it was your understanding that she was planning to?
No,
right?
I thought that she told me when she came back the Monday after spring break that she had read it, but
Objection, Your Honor, there's something in evidence to show otherwise.
Overruled.
And
Because the only person who
And-
could testify to that would be Carly, and Carly has not testified that she did not read Crime and Punishment, but the judge is letting it in.
Is it? And the question that, that you had asked Carly about her haircut and her friends teasing her about cutting her hair shorter, and about whether that meant something about her sexuality. Isn't it true that in your notes you reported she actually laughed in answering that question and said
Right.
no?
That's right. Yeah.
Yeah. So she found that to be, somewhat a humorous.
Yeah. Right.
Yeah, not a concern.
Well, what had happened, we were walking out actually with the padlock door, and I said, "Oh, what did your friends think about your haircut the first day back?" And she said, "Oh."
Wait a second. Did she say with the padlocked door? Hold on.
That question and said
Right.
no.
That's right. Yeah.
Yeah. So she found that to be, somewhat a humorous.
Yeah. Right.
Yeah, not a concern.
Well, what had happened, we were walking out actually with the padlock door, and I said, "Oh, what did your friends think about your haircut the first day back?" And she said, "Oh, they said it makes me look even more gay now." And I said, "Oh," I said, "Is that a true statement?" And she said no, and I said, "Oh, well, I'm sorry." And then she replied with, "Oh, it's not a big deal. Like,
She's
doesn't bother me."
Okay, maybe the door to like the office building locks at a certain time, and so she had to take her out the door because it was locked. She had to go unlock the door for her. That's what I'm thinking. But then she says that her friend said, "Oh, your haircut makes you look more gay." Hold on.
"What did your friends think about your haircut the first day back?" And she said, "Oh, they said it makes me look even more gay now." And I said, "Oh," I said, "Is that a true statement?" And she said no, and I said, "Oh, well, I'm sorry." And then she replied with, "Oh, it's not a big deal. Like,
she's
doesn't bother me." Yeah.
And on the handwritten initial assessment that Ashley wrote to you, is it true that in that she wrote that Carly had been having intrusive, and she marked the box for intrusive and disruptive thoughts?
Correct.
Okay. Is it true she marked the box that Carly was having thoughts that got stuck?
Yes, that's correct.
Is it true that she reported several different times on this page that Carly had really been experiencing some difficulty sleeping?
Yes.
And in her own handwriting, doesn't Ashley write that Carly was severely unable in the last month to sleep?
Yeah, that's right.
Okay. And somewhat for the last year?
Mm-hmm.
Isn't it also true that she wrote in her own handwriting that at 2 a.m., Carly had a habit of waking up at 2 a.m. and then not being able to go back to sleep?
Correct.
Okay. And isn't it true that Carly also wrote that Ashley had written that Carly seemed to have a poor self-image?
Yes. Wait, where are you referring to? I just want to
The
make
box.
sure. Yes, that's correct. Mm-hmm.
Okay. And isn't it also true that Ashley had marked the box that Carly had been experiencing panic attacks? And when asked how often, Ashley wrote Carly had at least been having one panic attack per month.
Yes, with the correction of it didn't say at least, it
Or
said
does it
one
one per month?
month. Yeah.
And isn't it true that Ashley had marked the box saying that Carly had been having difficulty completing homework or class?
All right. Not Sir Ray Davies. I'm going to ask you nicely to stop spamming the chat. Like you've said that 400 times. Like I said before, we understand your thoughts on this. Okay. It's up to a jury. I'm going to say this louder for people in the back. It's up to a jury to decide whether or not it's been proven. Final warning on spamming the chat. Maybe other creators might take it. I'm not going to. I asked you once nicely. This is nicely number 2. Okay.
Work.
Where's that one at? I'm sorry.
That one is, may I approach, Your Honor?
I'm sorry. This is kind of a busy page.
That one is front.
Okay. Oh no, I don't. No, that wasn't checked.
For sure.
I don't think it was checked.
Can you tell if it was checked?
I
If you
don't-
can't tell,
You
it's
know
good.
what? You know what? Let me look at your page because you're right. Mine is a little bit.
Yes, ma'am.
I'm sorry.
You need to refer to the original exhibit, please, as far as to making determination.
Okay.
If you would, please refer to the original, to the exhibit.
I mean, it does seem hard to read because I have written some notes to the left, but that would be surprising to me. But I'm not saying that it may not be checked underneath my handwritten note to the left. I'm really unsure.
It's just hard to read
Yeah,
because of the
That's right.
handwriting.
Yeah.
So it could be, might not be.
Yeah.
And isn't it true that what is easy to read is that Ashley had written just a few short places down that Carly had been sad and withdrawn in her mood?
Yes.
And at the top of that page, and I know it's kind of a little bit messy, but at the top of that page, isn't it true that somebody reported that Carly had made a 30 on the SAT? or
Correct.
ACT?
Mhm.
Okay, and that somebody had written in the response to the first question, what are your goals that you hope to achieve through counseling?
Mhm.
Someone had written, either Ashley or you, she wants to feel better about herself socially, personally, physically insecure,
Yes.
and had been so since 5th or 6th grade.
That's correct. So she began by writing she wants to feel better about herself, and then I followed up with both of them and added more notes to give more detail to that. That's right.
Isn't it true also on that page, in kind of response to the question number 2, it says father had been emotionally and physically abusive,
Mhm.
and also had bipolar
And
and
drug
ADHD.
addict.
Yeah,
Uh-huh.
and drug addict.
That's right.
And that there had been times years ago that she had reported he, meaning the father, had been getting high in front of her the whole time during his visitation periods.
That's correct.
And then briefly describe your or your child's current difficulty. Can you read for us what's written there?
Yes, it says, this is written by Ashley. Carly has been complaining of sleeping trouble and thoughts of depression, hopelessness. We discovered issues of cutting and taking old sleeping pills. Those issues have been removed and controlled, but also signify the possible level of depressive thoughts.
So, did Carly's mom, and on this page, there's a box for, hurts animals. That box isn't checked, is it?
There is a box for, no, it's not checked.
Okay. And it's also a box for hurts friends or siblings. That box isn't checked, is it?
Correct.
And during the course of your counseling with Carly, did you ever consider her a psychopath?
Never.
Did you ever consider her a sociopath?
Never.
And again, you've met with her how many times?
9 hours, roughly 9 hours. Yes.
So 9 different sessions.
That's right. Mhm.
From January to March.
Mhm.
And were you aware that Carly had written in a journal about hearing auditory hallucinations?
Mm-mm. Unless it was the reference to that iPod. I'm not sure if they're considering that a journal or what.
But the reference.
I was never told about any kind of hallucinations, just dark thoughts is the way it was described to me in that iPod.
Okay. And did you know that in one of Carly's journal entries, when she was talking about feeling like she was losing control of the auditory hallucinations, that she'd actually written in there that she had considered bringing her journal to you?
No.
Mm.
No, not at all.
Do you think that speaks to the level of trust Carly had in you?
I can't really speak to that. You'd have to ask her.
Were you aware of the fact that Carly has repeatedly told people that you were the first counselor she ever felt like helped her?
She's gonna cry again.
Were you aware?
No, it's not.
if Carly would have reported to you during one of your sessions that she was experiencing auditory hallucinations, would that have been something you felt like you needed to report to her mom?
Not necessarily. I would have followed up with a lot of questions to determine if she was a threat to herself or others.
And if Carly would have reported to
Same thing that the nurse practitioner said. Even if she did report that she was hearing voices and having auditory hallucinations, she would not have told her mother.
you that she felt
Wouldn't have made a
like
difference.
she was losing control of herself to the auditory hallucinations, was that something you would have felt like you needed to report to her mom?
Again, not necessarily. I would have asked her to clarify with a lot of questions. What does control mean to you? You know, that means 1,000 things to different people. But if I had asked it enough to determine that she was a threat to herself or others, then yes, I would have reported it.
And is it fair to say that
So hearing voices is okay.
Carly had some
Hearing
fear
voices
in
is
regards to-
okay. Hearing voices is okay until the voices tell you to go kill somebody. Until the voices are telling you to kill yourself. No big whoop. Hello? Anyone? Bueller? Anyone? Maybe get the child into a psych hold. Maybe recommend to them, listen, she's hearing voices. I'm not really sure what this is about, but I think she needs to be seen inpatient somewhere. Maybe just, a 72-hour hold in a child psych hospital to try and figure out what's going on. So maybe she can get the help that she needs, even though we know she's already self-mutilating. Right? Right?
her dad?
Her biological
Hold on.
father.
Yes. And is it fair to say that Carly had some fear in regards to her dad?
Her biological father.
Yes.
That was very perplexing for me, honestly. I just could not get her to open up a lot about what I knew had to have been traumatic instances. I mean, she seemed very indifferent and apathetic towards him. But yeah,
Apathetic, like she's putting on a good
And
face, because guess who told
is
us
it fair to
that
say
Carly
that
was real good at putting on a good face and making everybody think that everything was fine? Guess who told us that? Her stepfather, Heath Smiley, who testified in both cases, prosecution's case in chief and the defense case in chief. Carly was good at putting on faces, right? She seemed very indifferent and apathetic toward her biological father, according to this witness.
different and apathetic towards him. But yeah,
And is it fair to say that Carly saw her father as someone who is not a successful person?
correct. Yeah, she did not like him. She was glad she's with her mother.
And is it fair to say that if someone is afraid of having a certain mental health diagnosis, that might motivate them to not be fully forthcoming with their therapist about what they're experiencing?
Sure.
Mm-hmm. And she was afraid of being
And-
diagnosed like her father. That's come out several times during the course of this trial. Even her mother would say to her, "Boy, I sure hope you don't turn out like your father. Bipolar."
Carly would have told you that she was smoking marijuana to help her sleep at night. Is that something you would have felt the need to tell her mom?
No.
Would Carly have had any way of knowing without disclosing that to you that you wouldn't have reported that to her mom?
Yes, she would, because I told her that on the first session.
But Carly had seen you talk with her mom before, correct?
Because she's smart enough to know that legally anyone under the age of 18 has to do it that way.
Hmm?
And Did Carly or Ashley ever tell you about an incident in which Carly had gotten in trouble for taking a knife to school?
Never.
You don't recall that?
No.
And during the time in which you were with Carly, had either Carly or her mom reported to you that Carly had seemed to develop?
Ma'am, sir, opinions. Nobody's hating on the professionals. We're dissecting testimony here. That's what we do here. I've never seen you here before, but welcome. Hey, cool. Says she didn't report hearing voices. Why is there so much hate for these professionals? This professional just told you that even if she did say that she was hearing voices, she wouldn't have told her mother. So even if she did report it, it wouldn't have made a damn bit of difference. That's the point that we're making here. Okay.
Developed a hypersensitivity to certain sounds?
In that session note regarding the symptoms, she came telling me, she just gave me a lot. It's probably in that one. She kind of came in talking about a lot of symptoms that typically is customary to like an Asperger's or autistic diagnosis.
And that these certain sounds, when she heard them, kind of caused her to feel irritated?
Yes, but again, like it was not ever anything, I want to be clear, like a hallucinatory manner. It was all in the context of that person's tapping that pen or tapping their foot or something
Yeah.
like that,
Yeah, not furious, but just annoyed,
Yeah, right,
irritated.
right.
Yeah. And based on your sessions with Carly, when Carly would mention, having periods of time when she would be questioning the meaning of life, did that seem to be during the time periods in which Carly was experiencing depression?
I need you to repeat that, please. I'm unclear what you're asking.
Yeah. When you talked about that Carly would have these existential times and she'd be questioning, the meaning of life and things like that. Was that also during periods of time in which Carly was experiencing depression?
Well, that's what was kind of problematic about treating her, is that was really the only thing of real emotional conflict that I ever had her report, and it was because of the iPod stuff. And so I kept trying to kind of dig and find out what was troubling her. So, I mean, during that's what I'm talking about with the existential. She didn't really open up a whole lot. The last session we did talk about kind of reality and life and morality and some things like that. But,
Yeah.
But it wasn't because she said she had been upset about it and needed to discuss it. It was based on something, I think, as I recall, her father is a Jehovah's Witness, her bio dad, and she knew I was a Christian because that's something that I like to tell people so it doesn't blindside them if they're different. And she said, "I'm sorry, I know you're a Christian. He's a Jehovah's Witness, and I believe that that's definitely a cult, So we kind of talked a little bit about it that way thematically, but not in a way that was, like I'm troubled and I need to talk about this kind of thing.
Yeah. And during your sessions with Carly, did she ever strike you as a violent child?
No.
And when you learned about the events that had transpired on March 19th, were you shocked?
It's the most shocking day of my life.
And that's based on the 9 sessions you had with Carly and the hours you spent with her.
Yes, because I had no clue that nor had she ever reported that she was severely mentally troubled to any degree like that.
And you would just,
But guys,
based
isn't
on
that up to you to determine despite what she tells you? Hold on, I need to hear more about this Jehovah's Witness discussion because I was distracted by the chat and the people fighting in the chat. And really, I'm just going to start having a zero tolerance policy because I'm not going to play that game that Grizzly had to play.
Yeah.
But it wasn't because she said she had been upset about it and needed to discuss it. It was based on something, I think, as I recall, her father is a Jehovah's Witness, her bio dad, and she knew I was a Christian because that's something that I like to tell people so it doesn't blindside them if they're different. And she said, I'm sorry, I know you're a Christian. He's a Jehovah's.
So she tells her patients that she's a Christian so that it doesn't blindside them? Yeah, that's exactly what she said, zippy zoom zoom, and that's why I had to rewind it.
Witness, and I believe that that's definitely a cult, you know. So we kind of talked a little bit about it that way thematically, but not in a way that was, you know, like I'm troubled and I need to talk about this kind of thing.
Yeah. And during your sessions with Carly, did she ever strike you as a violent child?
No.
And when you learned about the events that had transpired on March 19th, were you shocked?
It's the most shocking day of my life.
And that's based on the 9 sessions you had with Carly and the hours you spent with her.
Yes, because I had no clue that nor had she ever reported that she was severely mentally troubled to any degree like that.
And you just, based on your knowledge of Carly and her relationship with her mom, you were shocked to find out what had occurred on March 19th.
Yes.
Thank you. We tender the witness.
Say which good reader up.
Rebecca, as a therapist, how many people do you see that have complaints about depression or anxiety?
Almost every single one of them.
How many of them have gone on to kill their mom?
0. Oh, sorry, her. Before that, none.
Do you have any patients that have ever reported hearing voices?
I have sometimes, yes.
And how many of them went on to kill their mom?
None.
Objection.
You were asked about whether or not
For those other patients that were hearing voices, were they minors? Were they adolescents? Were they children? Were they adults? Did you do anything further for them, or just what did you do? How did you cure them so they didn't go kill anybody? Not that voices would definitely make somebody kill somebody, but I'd dig in a little bit more to that.
Ashley being mad at Carly made Carly angry and hurt her feelings. And I think you talked about anger being the second emotion. Did that make Carly angry? Sorry, you got to answer.
Yes, sorry.
You were asked about Carly wanting to please her mom and not worry her. Someone keeping secrets from their mom about a phone mom didn't know about, a secret boyfriend, the fact that someone's using drugs and cutting themselves. Does that sound like somebody who's so worried about hurting mom's feelings to you?
Can you please repeat that question?
Yeah, sorry, it was a bad one. You were asked about Carly not wanting to anger her mom.
Right.
And keeping secrets from your parent, doing things that are dangerous. Does that sound like somebody who's worried about hurting their parents' feelings?
I mean, honestly, it's I can't really speak to that. I mean, I would think that there could be a lot of motivations regarding that. But
Carly never reported having any mental health issues other than depression or anxiety to you, correct?
correct.
No further questions, Your Honor.
All right, this witness be finally excused by the state.
Yes, sir.
By the defense.
Yes, Your Honor.
All right, ma'am, you're free to leave. If you would hand that to the bank.
Finally.
After I take care of the jury, give me just a moment. All right, ladies and gentlemen, the jury is about 10:30 and the lawyers want to talk. So that's a good time for y'all to use the restroom. Okay, everyone remain seated while the jury exits. Just knock on the door and let the bailiff know when we're ready. Okay.
All right, we're a bit behind, so we can fast forward.
That's something.
Yes, sir. I was just wondering how many more witnesses the prosecutors intend to call.
We haven't exactly made that decision yet. I mean, we know 2 for sure.
Okay.
They have 2 more witnesses.
They say. All right. We'll be in recess for about 15 minutes.
All right, we could just fast forward through this whole entire break.
All right. Defense ready? Is the defense ready? All right, bring them in.
Bring them in. Stand down. Getting used to the Mississippi lingo.
Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth? So help you God?
I do.
Have a seat. Again, you don't have to talk directly in the microphone, but make sure that gentleman up there can hear you, okay?
Yes, sir.
Do you understand you're now under oath and your answers will be sworn answers under penalty of perjury?
Yes, I do.
All right, you may proceed.
If you would, state your name for the record.
Amanda Gugliano, Gugliano.
And Dr. Gugliano, where are you currently employed?
I currently work at Mississippi State Hospital, and I also have a private practice where I do forensic psychological evaluations.
And if you could tell us just a little bit about what it is you do out at the Mississippi State Hospital.
I am the director of the Forensic Evaluation Service. So we are the only forensic service for the entire state. We do some outpatient evaluations, but now things have changed. It's mostly inpatient evaluations. And then, so we do inpatient evaluations for the court regarding competence to stand trial, someone's mental state at the time of the alleged offense, and sometimes some other factors too, such as mitigating circumstances or a violence risk assessment. Then we also provide treatment for individuals who have been found not guilty by reason of insanity. And we provide treatment for people who have been found incompetent to stand trial, and we're attempting to restore them to competence.
And you talked about the fact that you, excuse me, are a forensic psychologist that do, you also perform private evaluations or do something on the side. Can you talk about that, please?
Yes, I have a private practice where I conduct forensic evaluations for both the state and the federal court. And those are typically related to the similar issues as I do for the state hospital: competence to stand trial, mental state at the time of the alleged offense. I have also done some death penalty evaluations if someone's competent to waive or assert post-conviction appeals, or competence to proceed with post-conviction appeals also.
And when you're doing these evaluations, who are you usually doing those on behalf of?
It's most often it's court ordered. So it's, in my opinion, when something's court order, I consider that as the court's expert. My report goes to the court, and then both sides usually get a copy of it. Sometimes I am retained privately by one side, either the defense or the prosecution, and then I'm conducting the evaluation for them. So the person that I'm actually seeing and evaluating is not my client. It's the court or whichever attorney retained me.
And so if they're not your client, you're not actually providing them any type of treatment, right?
That's correct.
Could you give the ladies and gentlemen a little bit of information about your educational background?
I have a Bachelor of Science degree in psychology and a Bachelor of Arts degree in sociology from Lindenwood University, which is a private liberal arts school in Missouri. I received my master's in clinical psychology from the Arizona School of Professional Psychology in 2006, and I received my doctorate in clinical psychology from the Arizona School of Professional Psychology in 2008.
And do you have any type of licensure or certifications here in Mississippi?
Yes, I'm a licensed psychologist in Mississippi, and then I'm also certified as a forensic evaluator by the Department of Mental Health.
Tell us a little bit about what that means, evaluator through the Mississippi Department of Mental Health.
Yes, so
Thanks, Maureen, for the Cash App, who says you might need something stronger than coffee today. Thanks, Maureen.
the Department of Mental Health has a process where they train and credential psychologists or psychiatrists
to be forensic evaluators. So they are credentialed to do evaluations of competence to stand trial or mental state at the time of the alleged offense.
Do you know how many of them are approved in the state currently?
I'm not sure our current numbers. There are some that are approved who don't reside in Mississippi. They do telehealth evaluations. I think we have around 20 right now, maybe, but not all of them reside in Mississippi.
And so that's 20 psychologists and psychiatrists that are have meet the qualifications for the mental department of health to do the evaluations.
Yes, that meet the qualifications and have applied to do those.
Since we're a bit behind, I'm going to put her on 1 1/4 speed so we can try and catch up a little bit.
Do you belong to any sort of national or state level committees, any type of groups regarding psychologists?
Yes, I'm a member of the American Psychological Association. I'm also a member of the American Psychology and Law Society, which focuses on forensic psychology. I am a member of the Mississippi Psychological Association, and I'm also the president-elect for the Mississippi Psychological Association.
And I know we talked about the fact that you perform these types of evaluations for both, most of the time for the court, but also sometimes for the party that asks. How many times would you say that you have evaluated someone either for competency or sanity?
For competency, probably around 1,500 times. For sanity, probably around 500 times.
And have you testified in courts as an expert, as a forensic psychologist previously?
Yes, I have.
And how often would you say you've done that?
Probably about, I don't know exactly, about 45 times.
And you've actually been recognized by this particular court as a forensic psychologist expert, right?
Yes, I have.
Your Honor, at this time, we would ask that the witness be tendered as an expert witness in forensic psychology.
No objection, Your Honor. That's the waiver. CV's already been entered by stipulation.
All right, she'll be accepted as an expert in the field of forensic psychology.
Dr. Guglielmo, if you could tell the ladies and gentlemen the difference in like a treating physician or therapist and a forensic psychologist.
So it's a pretty different situation. I mentioned before, whenever you are treating someone, whenever you're the clinician, either a psychiatrist or psychologist, therapist, you're more of an advocate for the client, the person that you're treating, and you are treating and assessing them based on what they're telling you, usually for the most part. A lot of times, treating clinicians don't have much information or records outside of what the client tells them. So they just go off of what they see in front of them and what the client tells them. In doing forensic evaluations, the person that you're actually evaluating and talking to and assessing is not your client. As I mentioned before, it's the court or potentially a lawyer. It could also be one of the parents if there's like a child custody dispute and you're doing that type of evaluation, but typically it's a lawyer or the court. And in that case, you are not an advocate for the person that you're evaluating. You are supposed to be a neutral, objective evaluator who forms opinions based on the information that you have, and you offer those to the court. So there's no guarantee that it will be helpful or not to either side or to the court. It also, when you're a forensic evaluator, it's not confidential because you have to share the information that you gather with the court in a report, or you may end up testifying. I always warn people of that also. So it's also different in that doing a forensic evaluation, because there's legal issues involved, you rely on more than just the person's self-report. It's really important to have collateral sources of information. So you are always trying to corroborate what someone tells you to see if there's evidence in the records to support what they're telling you. Other people say the same thing? You often interview friends or family, maybe even an employer of the person that you're evaluating. So it's not as clear that you're just taking what the person tells you as the truth. You're wanting to look for corroborating evidence and find where all the data is kind of pointing you. What direction is it all suggesting?
And you spoke earlier, Dr. Guglielmo, about competence and maybe somebody's sanity. If you could kind of describe for us what competency is first.
Competency in general can be applied to various different things. It's situation specific. And what it essentially means is that someone has the ability to do something. So it could be competence to make legal decisions or competence to be over your own medical care, financial situation, things like that. In the realm of criminal cases, competence is typically referred to for competence to stand trial or to proceed with their legal situation. And so that means, does a person have the ability to understand their charges, to understand the basics about the court system and how that works, to be able to appreciate the adversarial nature of the legal system, and that they're able to assist their attorney in their defense. So competence really has to do with someone's mental functioning presently in the current moment. Sanity, or mental state at the time of an alleged offense, has to do with how someone was doing mentally at the time of an offense sometime in the past. So it's a retrospective evaluation where you're trying to figure out whether someone was so mentally ill that it impaired their ability to know the nature, quality, or wrongfulness of their alleged acts.
And I want to talk to you a little bit about that. Is there a
Gustavo wants to know, why is the prosecution calling all the mental health professionals if the defense is the one claiming insanity? The defense did call an expert who was very highly qualified, in my opinion. The prosecution is on their rebuttal, and they called two of the treating providers, which I think were very helpful to the defense, actually. And now they have another expert witness who must have evaluated her for the state, or she's a state expert. But experts cost money. Money. The state has a lot more money than the defendant does. Just one reason. Thank you, Donnie Not Wahlberg. Thank you, Dennis the Menace, Musafa's original son, who says, illegitimate son. I dug around. It seems like Carly attended the Rankin County Learning Center. I don't know. There seems to be some people say the Newport Academy. But thank you for that so very much.
certain standard in the state of Mississippi that forensic psychiatrists and psychologists have to follow when rendering opinions about sanity?
Yes.
Could you tell the ladies and gentlemen about that? I think you sort of
Yes.
described that, but just want you to talk a little bit more about that.
Yes, the standards is what we often call the McNaughton standard, because that's the criminal case that the standard developed out of. The person who was the defendant was Daniel McNaughton. And so the McNaughton standard is what we refer to as a cognitive test. That means that it's just based on someone's knowledge about something. So it's, do they know the nature and quality? That essentially means, do they understand the basic facts about what they did? Then understanding the wrongfulness is, did they understand that what they were doing was illegal? So some states have different standards.
Wait, did they understand the nature and quality of what they did, or about what they are about to do?
So some states include whether someone had the ability to control their impulses or whether they appreciated the wrongfulness. But in Mississippi, it's just a knowledge of what they were doing and if it was wrong.
So I want to be clear, you said something about other states allow whether somebody appreciated what they did was right or wrong. Can you describe for us what you meant by that?
Yes. So knowledge is really just understanding the basic facts about something. Appreciating is having a more in-depth understanding to where you can understand the societal and moral implications behind it and reasoning for it. So for example, someone might know that killing someone is wrong, that is illegal, but they may not really understand why it's wrong to do that. They know that it's bad, they know they're not supposed to, but they really don't understand why. So that would be more the appreciation, where they don't understand the reasoning behind why it's wrong.
And Mississippi doesn't allow us to talk about the appreciation of someone, right?
It doesn't include that in the standard.
I would be objecting to all of this. This is all legal conclusions. This is all legal testimony. She's not a legal expert. She's a forensic psychology expert. But okay.
I want to talk to you about the defendant, Carly Gregg. How is it that you became, or did you have the opportunity to work on an evaluation involving Carly Gregg?
I did.
And how is it that you became involved in that case?
You contacted me to see if I would be available to do an evaluation on Ms. Gregg's competence to stand trial and sanity.
And was it your understanding that you were being court ordered for that?
It was.
And is that how you went about your evaluation?
Yes, it is.
And in fact, we talked a little bit about how that's different, but when you're court ordered to do it, you said you return that report to the courts and the defense attorneys, right?
Yes, actually in Mississippi, I submit my report to the circuit clerk, and then the circuit clerk distributes it to the judge, defense attorney, and prosecution.
Does the prosecution have any ability to edit the report that you prepare?
No,
Does the prosecution actually really have any input into what you put into your report?
no.
And sometimes those reports actually come back and say that the defendant is incompetent to go forward, right?
Correct.
And sometimes you will render an opinion that the defendant is in fact insane.
Correct.
I want to talk to you about this particular case, Dr. Giuliano. Did you prepare a report regarding your findings?
I did.
And are the opinions that you formulated in that report, are those based upon a reasonable degree of medical certainty?
To a reasonable degree of psychological certainty, because I'm not a medical doctor, so we use psychological certainty for psychologists.
Thank you for that clarification. And what types of items did you review before rendering your opinion in this case?
I reviewed some court orders involving this case. I reviewed some of the discovery materials. I also had some treatment records, not all of the ones that have been talked about so far by other experts. I had the Magnolia counseling records, so Ms. Kirk's records from the therapy. I also had precise clinical neurosciences records from the medication that she was being prescribed. I had a few records from the jail from her current incarceration related to some crisis contacts, but I did not have any records regarding the medication that she was being prescribed in jail. Then I also spoke with Ms. Newman about her concerns regarding the case, and I spoke to Ms. Todd, the defense attorney, about any concerns she had regarding the case.
Did you interview anybody besides the defendant in this case?
No, I attempted to interview her stepfather, but he had asked to have his attorney present, which I said was okay, and he was going to call me back where we could set up a time to do that, but he never returned my call.
Why is it important to try to
Stepfather wanted his attorney present before he would speak to this forensic evaluator. Just a thought.
talk to family members before you conduct your evaluation?
I do that because I'm trying to see if there's anything that they say that that will give me an idea of what to follow up on, or there may be something that isn't in the records that they're aware of. And sometimes they can give you a direction to go with your questioning. I do a pretty broad evaluation, but if there are any significant concerns or specific concerns, I want to make sure that I know about them so I can ask about them when I interview the defendant.
And Dr. Giuliano, you just testified about some of the things that you reviewed, that you had conversations with both my office and the defense. Is that information, facts, and data that you typically rely on in conducting your mental health evaluations?
Yes, it is.
And is that information that is pretty regular for a forensic psychologist to consider when forming their opinions with regards to competency or sanity?
Yes.
Did you actually have the opportunity to speak with Ms. Gregg?
Yes, I did.
Was that interview recorded?
It was.
Do you record all your interviews?
I record most of them. There's a few times that I haven't for the federal courts because the attorneys have not wanted me to.
And why is it that you record those interviews?
I record them in case I need to refer back to my notes. I take notes while I'm interviewing someone, but I like to be as accurate as possible. And I really think that quotes are helpful for either a court or a jury, for either the judge or the jury, whoever's making the decision, to see what people actually say. So I record it for my benefit, and then I also record it in case someone wants to get the recording so they can listen to it. I try to have transparency in my evaluations. I'm not trying to do anything that I wouldn't want recorded. So it's to help just confirm what I'm reporting in my report.
When you're conducting one of these evaluations, Dr. Giuliano, is it your role to favor one side or the other?
No, as a forensic evaluator, your goal is to be as objective and unbiased and neutral as possible.
How often, when you're doing these evaluations, do you actually have mental health records from the day before a crime was committed?
Very rarely.
And how often do you get the opportunity to have a video where part of the crime is committed on the video to consider?
Not It's not unheard of, but it's not in the majority of cases.
I want to talk to you about the interview that you did at the defendant. Who was present during that evaluation?
It was myself, Miss Gregg, and Miss Todd.
And is it common in your practice for attorneys to be present during the evaluations?
I wouldn't say that it's uncommon. It's not, it doesn't happen in the majority of cases, but it's not unusual.
How often, when you have attorneys sit in, is it common for them to make comments during the evaluation?
Most attorneys don't say much during the evaluation unless the defendant asks them a question. I always let both the defendant and the attorney know at the beginning that if the defendant wants to consult with their attorney during the evaluation, we can stop and they can consult in private, or the defendant can even ask their attorney for guidance at any point without us also stopping the interview. So it happens, but most of the time when it happens, it's the defendant who initiates the consult with the attorney in the moment.
I'm going to say that it is completely not uncommon for an attorney to sit in on an IME, which is what this is, an independent medical exam. It is not uncommon at all. And add in the fact that this girl is 15 years old, not uncommon. I would never let my client in a case like this go to an IME without me being there.
And in your training and experience and all the evaluations that you perform, is it unusual for an attorney to be asking their client multiple questions instead of you during an evaluation?
Yes, I would say that's unusual.
Dr. Grigliano, I want to talk to you about the specific findings in your evaluation. Can you tell us when you conducted that evaluation and sort of walk us through what happened?
We met in a room at the detention center, and it was for several hours. I think we were probably meeting for about 5 hours, but we had several brief breaks in that time to where the interview was a little over 4 hours, and we had a break for lunch also. But essentially, it was me asking the majority of the questions to Miss Gregg, and Miss Todd interjected at some points, but that was pretty much it.
Were there things that Ms. Todd shared with you that were not provided to you in discovery?
Yes.
Is that typical in cases when you have evaluations?
It's not unheard of. Miss Todd shared some things with me on the phone. I talked to her before I met with Miss Gregg to do the interview. So she had shared some things with me on the phone that I was not aware of at that point. And that's one of the reasons that I call attorneys, is to see if they have any information that may be helpful.
And when they give you that information, you then try to follow up, get some sort of confirmation about those statements or what that information was?
Yes.
What, if anything, did Ms. Gregg tell you during your evaluation about the use of illegal drugs?
She told me that she was smoking marijuana through a vape pen, and she denied any other illicit or illegal substance use.
What did she tell you about abusing any other prescription medication?
She didn't answer that question.
And was that important to you?
It's a regular question that I ask when doing an evaluation. Both illegal drugs and prescription drugs, or even over-the-counter medications, can have impacts on someone's mental health or in their functioning. So I routinely ask those questions.
And if someone were to have been on a prescription drug at the time of the crime, it would have been important for you to be able to explore that a little bit further, right?
I would definitely want to know if they were on medications at the time, or if they were taking anything that wasn't prescribed to them.
And if somebody wasn't truthful or didn't provide you an answer about that, that would impair your ability to make a decision about anything regarding medication. Is that correct?
It might not impair my ability. I'm limited in what I can say about medications. I don't prescribe medications. So I'm limited in what I can say about that, but it could limit things such as, it might be a consideration that someone's actions, feelings, behaviors could have potentially been due to a drug or medication. And so if you don't know that they were using that, then you wouldn't know that that's a potential factor.
I want to back up just a little bit. The defendant told you that she'd been using marijuana. You have the opportunity to review prior medical records in this case, did you see anywhere in her prior records where she had reported the use of marijuana?
I believe she had reported it to the jail maybe after she was arrested.
Prior to March 19th of 2024, had she told any of her treaters that she was using marijuana?
From the records that I reviewed, she had not.
From the records that you reviewed prior to March the 19th, 2024, had she ever reported to anyone that she was having voices in her head?
No, she did not.
Prior to March 19th of 2024, in the records you reviewed, had she reported to anyone that she was having lapses in time?
She did not.
And did you find anything that was provided to you by either side to corroborate that Ms. Gregg was having lapses in time?
Ms. Todd told me during our telephone conversation that Ms. Gregg's stepfather had mentioned that Ms. Gregg was having lapses in time and kind of spacing out. And so I asked Ms. Gregg about that during my interview of her.
But you weren't able to corroborate that with him?
No, I wasn't able to speak with Mr. Smiley.
I want to talk to you about the use of marijuana. In your experience, can the use of drugs alone cause some sort of psychosis?
It can.
And what about marijuana or
It can.
THC alone?
It can. We actually,
It can.
we thought previously there was a common belief that marijuana was fairly benign, but there are higher levels of THC in most marijuana now, or a lot of marijuana now. And so with the more potent marijuana, it is possible that people can experience symptoms of psychosis just from marijuana use.
When we're talking about symptoms of psychosis,
Interesting. Symptoms of psychosis just from marijuana use. She works for the state of Mississippi. She's hired by the state of Mississippi. She was smoking vape out of a pen, marijuana out of a vape pen.
can you describe for us what you mean by that?
That could be hallucinations, such as seeing things or hearing things that aren't really there and that other people don't see. It could be delusional beliefs, which are beliefs that are untrue, but the person staunchly believes that regardless of the facts or evidence presented to them that dispute those beliefs. It could also be mood symptoms like an emotional flattening to where they don't seem to have the normal range of emotions that most people experience. It could even be slowed thinking or slowed body movements.
During your interview with Ms. Gregg, did you talk to her about some things that might have been bothering her at the current time?
Yes, I did.
Could you tell us a little bit about that?
Yes, may I refer to my?
Absolutely.
What about when you combine the
I
THC
always ask
with
people that I'm evaluating.
Zoloft and discontinuing Zoloft abruptly, cold turkey? What happens then?
If you had to pick the one thing that was bothering you the most lately, what would that be? Because it's a pretty open-ended question, and it can kind of give you a good idea of what is, on that person's mind maybe the most. And Miss Gregg reported that she was bothered that she knew school was getting ready to start up or had just started back, and she missed school because she said she really enjoyed school, and that had been
Really? And RVA? None of those effects happen with a vape, with a THC vape? Tell me where you glean your expertise on that. Are you just trolling for fun? Did you want me to stop the entire stream for that?
the main focus of her life. She also discussed feelings of sadness, difficulty sleeping. She reported having mood swings.
What did she say about her mood swings?
She said that they could occur minute by minute or could happen over the course of weeks or days or months. She said, when I asked her to provide some additional clarification, she said, quote, "I'll be really happy 1 minute, then I'll be desolate the next," close quote. So she was describing, it seemed to me, pretty quickly fluctuating mood states that appeared at least somewhat dependent on her situation and what was going on with her in her life.
Dr. Leone, you were in the courtroom during the testimony earlier where somebody had mentioned that Ms. Gregg's father potentially had bipolar disorder. Can you describe for ladies and gentlemen what bipolar disorder, I think it's type 2, is?
Yes, there's two different types. I'm not sure which one Mr. Gregg has been diagnosed with. Type 1 involves episodes of mania, which you guys had heard about previously. It's whenever someone has the really high emotional experiences, they have a lot of energy, they may feel like they're on top of the world, really happy, feel invincible, have trouble focusing. They may start a whole bunch of tasks but never finish anything. They can be more irritable. And it's so severe that it impairs their everyday functioning. Then bipolar 2 disorder is kind of a less extreme version of mania that we refer to as hypomania, where they're elevated more than what is normal, but it's not quite to what we consider a manic episode.
And when you're talking about a hypomanic or an episode in bipolar, is that consistent with somebody whose mood can change minute to minute?
No.
Could you describe for us why not?
Yes, for bipolar disorder, it's something that isn't based on someone's situation. They really have no control over their emotions. It's not due to something good happening in their life or something bad that's happened in their life. And for a diagnosis of bipolar disorder, they have to experience either the manic episode for 1 week, where from every day, more days than not, that they're in this hyper aroused state. For hypomania, they have to experience it for at least 4 days in a row. And so that's not something where you would see fluctuations within the same day or hours.
In your evaluation with Carly and your review of the medical records, was it ever disclosed that she had these periods of time that were 4 days or more?
She didn't specify an exact number of days. As I mentioned before, she said, it could be hours, days, weeks.
Chelsea, experts are allowed to sit in and listen to testimony. Just to clear that up, they are allowed to. The experts have an exception to that rule, but it is ordinarily the rule that any witnesses who are going to testify or still under subpoena cannot be in the courtroom. Experts can. And Kathy, yes, thank you for the matcha lattes. I did get them. I was going to address those later when we take a break, but thank you very much for 3 matcha lattes. Appreciate you.
You spoke with Ms. Gregg about mood swings, and then she described for you at some point during your interview, I'm very detached. And I think you asked her to elaborate on that. Do you recall what Ms. Gregg told you regarding feeling detached?
Yes. So I was asking her questions that can sometimes be commonly found in people who have experienced traumatic experiences. So symptoms that sometimes indicate someone may have post-traumatic stress disorder. And we were talking about anxiety also, and how she didn't feel as bothered as she thought she should have felt by being in jail. And so I was asking her more about that, and Ms. Todd offered that Ms. Gregg appeared to be detached, and that Ms. Todd thought that might have been due to Ms. Gregg being in solitary confinement. She's been housed by herself in the jail since she's a minor, so she has little interaction with other people other than the guards when they interact with her.
Right.
And so I asked Carly about that, and she said, I'm very detached.
She's been in solitary confinement 23 hours a day until today. And still, I'm continuing for 6 months.
And she said, and when I asked her to describe that a little further, she said, quote, I think when my mom would get on me, I would kind of slip away and not be in the room. I just kind of feel like it wasn't real. I think that's how I am now because all this doesn't feel real. I mean, logically it is. It just doesn't feel that way. Close quote.
And then you went on, Dr. Gugliana, to ask her about blackouts. Can you tell ladies and gentlemen what y'all's conversation about blackouts was?
Yes.
For reference, I think that's on the same page we were just looking at, same paragraph.
Okay. I had asked her if she ever experienced a blackout, and she said that's kind of what happened with the incident, the alleged offense. She discussed further about the blackout, saying that she would just kind of space out and I believe she said in particular whenever, like if her mom was yelling at her, or she was in trouble with her mom or something like that.
Did she ever use the words derealized?
She did not.
What about the word disassociation or disassociated?
No, she did not use those words.
Did she reveal to you that she was having intrusive memories regarding the crimes committed in this case?
Yes, she did.
Could you tell ladies and gentlemen about that?
Yeah, so intrusive memories are just memories that someone is doing something else. They're not purposely thinking about something, and the memories just pop into their head. And once they get in their head and once they're thinking about them, it's really hard to stop thinking about them. It's hard to let go of those memories. And so I don't think at that point that I asked her for details about the intrusive memories regarding the offenses, because I had not yet determined whether she was competent to stand trial, and talking about that could have potentially revealed incriminating information. So I was waiting until later to ask that, and we never ended up circling back to that.
And Dr. Giuliani, was there anything about your conversation where somebody said something about feeling queasy when they were thinking about the event?
Yes.
Tell me about that, if you would.
Carly reported that sometimes when she thought about the alleged offenses that she would feel queasy.
And what else did she say about being paranoid?
She described having thoughts that bad things were going to happen, such as that someone would jump on her in the jail or things like that. And in my experience and opinion, that's more consistent with anxiety than delusional paranoia. Whenever
what?
people kind of have those.
Wait, what? Hold on. She thought somebody was going to jump on her in jail? Wait, what? Hold on. Yeah, look what it did to Rick Allen in Delphi. You're right, Miss T. And she's 14.
And what else did she say about being paranoid?
She described having thoughts that bad things were going to happen, such as that someone would jump on her in the jail or things like that. And in my experience and opinion, that's more consistent with anxiety than delusional paranoia. Whenever people kind of have those thoughts where they just worry about all these things that could potentially happen, that is symptomatic. You know, they often say that I'm paranoid that these things are going to happen, but they're not using it in the clinical sense of paranoia. And it's not what I would think of in the clinical sense as paranoia, as like psychotic paranoia.
Oh, but she was also under, when she got into the jail, that's when they started putting her on antipsychotic medications, right? But she was still exhibiting what you're calling anxiety, that she was going to get jumped in jail?
Back, Dr. Giuliani, the word queasy, and you talked about that Carly said she felt queasy when thinking about the event. Can you elaborate on what that meant?
I didn't ask her, but I was assuming that it meant sick to her stomach.
About the crimes that have been committed?
About something in relation to them. I didn't ask for any specifics.
At some point, Dr. Giuliani, did you have a discussion with Carly about whether or not she was hearing voices?
Yes, I did.
And what did she say about the voices?
She said that she had been hearing one voice, a male voice, since she was young. I think she said maybe around like 5 or 6 years old, which is unusual. And she said that she heard the voice every day and that it was always kind of there in the background, but she could usually ignore it and tune it out.
You said that it was unusual that somebody would start hearing a voice at 5 or 6. Can you tell us why?
Yeah, that's not really consistent with a psychotic disorder. Typically, people start having symptoms of psychosis for women in their early to mid 20s. For men, it's late teens, early 20s. It's very unusual for a young child, to have what are actually hallucinations. And it's possible that it wasn't what we would clinically consider a hallucination. It could be, you know, as a kid, it could be something like their own inner thoughts or their inner dialogue, and they don't recognize that as what that is.
She described.
Or it could have been that she was severely abused by her biological father, who was doing drugs in front of her constantly and beating her. And she, started hearing voices because maybe she did become psychotic very early on. Is it possible? Are we just going to rule it out because it's uncommon?
those voices that she was hearing every single day?
Yes.
Is that common in people in that age group?
No.
Is it impossible?
What did she say about whether or not these voices ever told her to do anything?
She said the voices never told her to do anything. She said that they made snide comments about other people and just really rude comments, kind of talking down about other people. I specifically asked her if the voices ever told her or said anything about her mom or her stepdad, and she said no.
You were present in the courtroom yesterday during Dr. Clark's testimony, right?
Yes.
And you heard mention that Carly had disclosed to an employee through Vital Court that in fact her mom, she heard voices that told her to harm her mom.
Yes, that's what Dr. Clark said.
She smiled when she said that. She heard voices to harm her mom, and then she gave a big smile to the jury. I wasn't born with Thorne says, is it possible Daddy was sharing his drugs? Well, we do know that he was blowing smoke in her face. I mean, we don't know what kind of smoke. Could have been like crack smoke, pot smoke. We don't really know. Is it possible that she could have gotten into the drugs as a very young child? I don't know. Maybe. Let's go to the chat again and thank Radine Dempsey for her very generous $50 super chat. Who says the law fascinates me. The way you unpack it and commentate is unbiased and fair, done with compassion. Here I am a student and you are a fabulous teacher. Thank you. No, thank you, Radine Dempsey. Thank you for your kindness and generosity. Amy says, please know how much people appreciate you. Thank you so much. I brighten your day. Thank you so much, Amy, for tuning in from Canada. Elizabeth Ann says, Carly was screaming out for help. So why now? When this tragedy happens, these professionals are ready to speak up and label Carly. Also, why was there a loaded gun accessible in her home? A little bit louder for people in the back, Elizabeth Ann. Why was there a loaded gun accessible in her home? Her mother was well aware of her issues because her mother was the one taking her to all of these therapists for years and years and years and years and years. Lawyer's daughter says it's outrageous that the attorneys were at the evaluation. I disagree, but we can agree to disagree. This trial makes you want to use the cursing words. Lawyer's daughter. Some vape pens have synthetic weed, spice. Yes, Kimmy. And she was getting them from a friend, so God only knows what was in them. Anybody hear about that case in California? There was a woman who went on a date with some guy. It was like their first date. She met him on an app or something. And she took one hit out of a bong, something she didn't know what it was. She stabbed him 100 times, and she was found not guilty due to marijuana-induced psychosis. That's a real case. Look it up. Raquel says the prosecution is clearly winning their case because they are calling all of the mental health experts as witnesses the defense refused to call to support their insanity claim. Well, thank you for the 10. You're entitled to your opinion. I disagree with you. I don't think we know who's winning because it's up to a jury to decide. I think that the experts that the state has decided to call have been helpful to the defense. That's my opinion.
Disclosed to an employee through Vital Court that in fact her mom, she heard voices that told her to harm her mom.
Yes, that's what Dr. Clark said.
So there's records saying Carly said, voices told me to hurt mom, but that's not what she reported to you.
Correct.
Dr. Guglielmo, as part of your evaluation regarding competency, one of the things you consider is the defendant's ability to recall facts. Could you tell the ladies and gentlemen why that's important?
That is a requirement specifically for Mississippi. Most other states don't have that as part of their competence to stand trial requirement. There's not a clear definition of what is specifically meant by that in the standard. The general interpretation that I have for it is that it means that someone can recall basic information about their case. If they have a discussion with their attorney, are they able to remember what they talked about? What do they remember about the alleged offenses? If they don't have a good memory or don't remember the alleged offenses, are they able to go over the evidence and remember the evidence enough to be able to help their attorney prepare their defense?
And in this case, what did you find regarding Ms. Gregg's ability to remember relevant facts about the alleged offense?
It was my opinion that she had the ability to recall relevant facts. We talked about the month leading up to the alleged offenses and what all was going on with her then. And her report was fairly consistent with the records that I had available. She also did not demonstrate any current memory deficits that would have been concerning. So I didn't talk to her about that day in particular because I didn't end up evaluating her sanity at the time of the alleged offense. So I don't know exactly what all she recalls from that particular day.
With regards to your evaluation, did you in fact find a forensic opinion regarding Carly's ability to proceed to trial and competency?
Yes, it was my opinion that she had the ability to do so.
And is that to a reasonable degree of psychological certainty?
Competency is a
And just to
completely
kind of
different
go through those
standard.
factors with us, the ability to understand the nature of the proceedings against her.
Yes.
And then what else is that?
The ability to rationally communicate with her attorney about her case, the ability to recall relevant facts, and the ability to testify in her own defense if she chose to do so.
And in fact, you found that Carly was competent.
That was my opinion. I don't decide that. That's up to the court to decide.
And in this particular case, Dr. Gugliano, did you send your report to the clerk's office like you do when you're court ordered?
This has nothing, she's already been deemed competent to stand trial. I'm curious about this too, Michael Martin. Why are they bringing it up again? It's a completely different standard from whether or not she falls within the Mid-Naughton rule.
I did.
No further questions, Your Honor.
Lunch is here and it's set up and ready for y'all, so we're going to take a recess at least 12:30. Remember not to discuss anything about the case at this point. Everyone, just whenever you're done, around 12:30 or thereafter, y'all's lunch. Knock on.
All right, we can fast forward right through this lunch break, my friends.
That's right.
You're on before you bring the jury back in.
Okay.
She doesn't have to take out.
All right, I hear you.
Your Honor, just now, the defense received exculpatory evidence from one of the minors, BG, whose phone had been turned over to law enforcement. And law enforcement downloaded contents of his phone. However, these text messages were not provided to us until BG himself provided them to us earlier today. This was a phone that was taken into custody by Zach Cotton on March 19th. If you look at the state's number, document 283 is actually his arrest, the search warrant for that phone. Now, while they did provide us text messages from the day of March 19th, they did not provide us any of the other text messages.
What? This is huge. If you're not paying attention, come back. Come back, everyone. Come back. Apparently, one of the minor witnesses has just turned over exculpatory evidence to the defense because law enforcement had downloaded this minor kid's phone, and maybe the state didn't turn over all of the evidence, and they just got it now because the minor witness came to the defense firm and gave them text messages. I'm going to rewind it in case you're just coming back to your screen. There may be a Brady violation here. Guys, remember what happened in the Alec Baldwin trial? Remember how that case was just thrown out because of what the prosecutor decided to turn over and not turn over, and because of what the prosecutor decided was discoverable, and how they hid it under a different case number? Well, seems like we might have a little bit of that now here, so come on back. I'm going to rewind it so you can hear it from the top. This is immediately after the lunch break. We're not that far behind now. We fast forwarded through the lunch break, so hang on. Dewey's going to take his belt off. Listen up, my friends, listen up.
State ready? Yes, sir. Fence ready.
Your Honor, before we bring the jury back in, there's an issue that we need to take out.
All right, I hear you.
Your Honor, just, just now, the defense received exculpatory evidence from one of the minors, BG, whose phone had been turned over to law enforcement. And law enforcement downloaded contents of his phone. However, these text messages were not provided to us until BG himself provided them to us earlier today. This was a phone that was taken into custody by Zach Cotton on March 19th. If you look at the state's face number document 283 is actually his arrest, the search warrant for that phone. Now, while they did provide us text messages from the day of March 19th, they did not provide us any of the other text messages. Bennett found these, I'm sorry, BG found these text
Oh, thank you for reminding me. I'm going to turn it down. It's a little too sped up. I want you to hear it in regular time. Okay, sorry. Thank you for reminding me.
messages on his phone and texted them to myself earlier today. I printed them out on the lunch break, and according to both the United States Supreme Court case law, Brady v. Maryland, Mississippi, King v. State, and also Arizona v. Virginia, which is a U.S. Supreme Court state, the failure of law enforcement to disclose exculpatory evidence is imputed to the state, and such disclosure mandates either a continuance until the defense has had time to review this documentation or dismissal of the charges themselves with the failure to provide exculpatory evidence in discovery.
Oh, Dewey is not going to like this. She's not in front of a microphone, so I can't boost the volume. I'm just going to speak away from the mic, turn it up on your end, put on your earbuds, do whatever it is that you have to do. Watch the closed captions. This could be a really big Brady violation, and you know, you've seen Dewey if you've been watching this with me. Dewey doesn't play. If you're just tuning back in, one of the minor witnesses, I think she's saying BG are the initials, had his phone. Zach Cotton, one of the law enforcement officers that we saw, had a search warrant for this minor's phone. They downloaded his phone or her phone. They have an entire copy of it. Apparently, they cherry picked what they sent to the defense because just before lunch or during lunch, this minor sent this defense attorney all of the messages that are exculpatory to Carly in this attorney's opinion. They want Brady violation. They want dismissal. Let's see. No, BG is not the boyfriend. Boyfriend's name is Thad with a T. No, the jury's not in there. She said before the jury comes back in. Let's see what he's got to say.
Yes, Your Honor, I would like to mark on Friday.
All right, I'll be marked Friday purposes only.
So we look at it, get that copy right now.
I mean, I have a response in general without looking at them.
Hang on. Take a look at them. What, where they marked?
She is, you could hear it in her voice. She's so mad. Would be too. She's so mad.
The date is on the top text message. The one in general that we believe goes to exculpatory evidence is on this page. So it would be this page.
PG is in blue, Carly is the black.
Versus do it back. Is that the first text message?
Yes.
All right. So the defendant says, do it back. Mr. Bennett Germany says, I don't know what that is. What's going on? She responds, I don't know. I called Anthony because I wanted to talk to him. And then I saw him and I couldn't breathe. And I couldn't say anything because I didn't know what to say. And I can't remember anything that happened today. I zoned out for most of it and I don't know what's wrong with me. That's
Yes, Your
shown
Honor.
as the exculpatory part.
Yes, Your Honor. And that this text thread is dated as of November 22nd of 2023.
All right, anything further from the defendant
Not-
by way of motion?
No, Your Honor, just that the U.S. Supreme Court and also the Mississippi State Supreme
Court is clear about the failure of the fact that it was in the possession of law enforcement. Law enforcement downloaded the contents of this phone, had it by search warrant and failed to produce it, and that the failure, and according to the U.S. Supreme Court in Arizona v. Youngblood, the failure of law enforcement is imputed to the failure of the state for.
Go on, girl. Go on, girl. Her name is
About the state, or do you need a few moments?
her name is Bridget Todd, the defense attorney. Bridget Todd. She reminds me of a young Priscilla Presley.
First of all, I don't believe that text message.
Let's step up to that
Yeah.
podium.
I may have to go upstairs at some point and get a signed piece of paper from Miss Todd, but I think that I have it here. First, let me address the fact that this is not, in fact, exculpatory material. This is a text message between Bennett, Germany, and the defendant from back in November. Bennett, Germany took the stand. He could have provided this at any point. He actually, in fact, spoke to the defense attorneys previously. This is not new information that they had. It's not exculpatory information. However, in order for it to be
That she said she had a major blackout all the way back in November. Because isn't that what it said? Now you're gonna pull the Lally Jennifer McCabe? He could have said this on the stand. He could have just volunteered this.
a Brady violation, the state would in fact not have had to produce the material that they had. On June the 4th, 2024, the state of Mississippi provided to the defense attorneys one jump drive containing digital evidence media files, witness interviews of minor friends, the indictment, discovery bait stamps 1 through 349, supplemental discovery bait stamps 350, 351, third Snapchat report 352, 356, 2 CDs labeled Heath Smiley hospital interview and Deputy Allison Dufour body cam, and 1 hard drive containing phone dumps. Your Honor, they were in fact provided the phone extraction from Bennett, Germany's phone. It is not the state's fault that they did not review those messages. Everything that was on Bennett's phone that was taken from law enforcement was produced to the defense attorney on June the 4th, 2024. Since there had been issues with the state of Mississippi and the defense attorneys claiming that they had not in fact received items, the state went ahead and had them sign something stating that they had received discovery, and also the entire jump drive, now not the external hard drive, but the jump drive that was provided that had the media and electronic data on it, was screenshotted. Ms. Todd signed off on April the 20th, 2024, that she had received all those items, including through bait stamps number 798. When Mr. Camp reached out to me the day before the defense attorneys had provided their expert discovery, I believe it's by email. I can go back and look, Your Honor. I believe responding to him around 5 o'clock, he said something to the effect of, where are the text messages between the kids? And my response was, well, there's 2 places. There's screenshots that you guys were provided, and then there's messages within the actual phone extractions. Your Honor, they had this material. They knew this material existed, and for them to try to claim now that they were not provided that information is disingenuous. And again, this witness took the stand. If they knew this, if he knew this, if they had this information, they met with him previously, why on earth would they be producing it now? We do not believe this is exculpatory. This is something that happened back in November. We're here because the state has charged Carly Gregg with murdering her mother on March the 19th, 2024. We are here because the state has charged Carly Gregg with attempting to murder her stepfather, Heath Smiley, on March the 19th, 2024. And we are here because the state has charged Carly Gregg with tampering with physical evidence for removing the surveillance footage that captured a portion of the incident and hid it in the refrigerator.
Okay, girl, stop performing for the camera. Here's the thing. If this text exchange ain't on that jump drive that you turned over, and I'm not making fun of the accent because I love the accent. I'm just trying to perfect the accent, you know. If this text thread between BG and the defendant is not contained therein on the jump drive that y'all turned over, that's a problem. So I think the judge is going to want to see that jump drive. That's all I'm saying. So whatever it is, you're going to have to deal with it. If it's not on the jump drive, you have a problem. And I think they probably checked the jump drive before they made this motion. I'm just saying.
Refrigerator. There is nothing about this text message that would indicate that it is anything other than messages between the defendant and one of her friends who on the stand said he was her best friend. This has not been authenticated. I don't know, Your Honor, without going and putting the phone extraction into my computer, whether or not this message is actually there. But if it is, they've had it since June.
Hold on a second. In a second, I'm going to give you a chance to reply. All right. What documentation do you have to prove that you turned this over to the defense? I believe you said there was a jump drive that contained the phone extract, and I'm familiar with phone extractions, that there's no way to extract part of a phone on Celebrate.
That's right, Your Honor.
Okay. So did you show me what you got to prove that you turned over a jump drive?
Of course,
And if you need a few minutes to go grab your paperwork, you
I
go.
do not, Judge.
Show it to counsel opposite.
We've had this issue come up previously, so now we have the defense attorney sign saying they picked up material.
All right. Do you have a copy of that we can mark for identification?
This is the only one I have, Your Honor. I can rip it out of the file and make a copy if necessary.
Oh, Dewey's not happy. Dewey's getting upset. Dewey's getting upset. That's right, Dr. Sue. Right. The text messages are.
You showed it to counsel opposite, correct? All right. Mark it for identification purposes for the state.
Your Honor, for the record, that bears Ms. Todd's signature and date.
Okay. Let's mark it so I can see it.
I wonder if she'll get up on the stand and cross-examine herself. This attorney.
All right. And what you're saying is this jump drive contained digital discovery. Is that correct?
Your Honor, there was a jump drive that the defense brought to our office. That jump drive contains the digital discovery, the physical file, the PDFs, the 2 CDs that we had in our file, as well as we had an external hard drive that had these phone extractions on them. They were put onto the jump drive that Ms. Todd picked up on June the 4th, 2024, as indicated by a hard drive containing phone dumps. Your Honor, there are multiple emails between myself and Ms. Todd that if I need to, I can run upstairs and print off where I've said, let me know if you can't open a file. Let me know if you don't have something. I said, in fact, hey, I screenshotted 800 pages and scanned it in. Let me know if a single file doesn't open. Mr. Camp and Ms. Todd were attached to all those messages. At no point did they ever say, hey, we don't have Bennett's phone extraction. Again, just because they don't know how to access something, they didn't ask our office for something, or they didn't take the time to review that material, Judge, does not put that burden on the state.
Bless your heart. Bless your heart. Isn't that the old FU of the South? Bless your heart, sweetie. I don't think she said she couldn't open your files. I think what she said was these particular text messages were not contained within what you turned over and what Zach Cotton used his search warrant to download. That these were excluded, which, you know, is a Brady violation and a big problem for you. I don't think she said she couldn't open it.
Is there anything else the state wants to move in for the court to look at?
Your Honor, I'd like an opportunity to go upstairs and print all those emails I've talked about, if that would assist the court in any way.
Can you do it within 10 minutes?
I believe so.
All right, we'll be in recess 10 minutes.
Damn.
In fact,
I'm going to
Mayor,
give you a chance to reply, but I want to see her. It's going to go motion, response, reply, I rule, we're done.
Wow, he's going to rule today? Oh,
No,
bless his
not gonna
heart.
see
I
her
mean,
documents.
what's the positive
Complete
version of
state
bless your heart?
response. That way you can have a reply. We're not going to have a reply, response, reply. It's going to be motion, response, reply, I rule, and the rest of it's up to the appellate.
Get the jump drive.
All right, y'all got 10 minutes.
Your Honor, I believe that I could probably just make a copy of all of this and that would entail my emails back and forth with Ms. Todd regarding discovery. I kept them because I assumed that there at some point would be some sort of argument that we hadn't produced something. But I do not have a copy of this. This is just the one copy I kept for my
Well, I
file.
saw Mr. McDivitt stand up back there. He can make himself useful and cut down on the jury's time.
Mr. McDivitt. Mr. McDivitt, make yourself useful.
Problem abusing lawyers and their staff. So
Who's
got the
Mr.
email,
McDivitt?
The email, Mr. McDivitt, you go copy it.
I think that should be everything. I'm gonna make sure.
Mr. Magnificent, the closed captions say.
And please bear in mind, I got a jury waiting.
Please bear in mind, they're only making $25 a day. So, we don't want to waste their time. Get Mr. McDivitt to do this because we are not wasting this juror's time. Oh, you know it. You know it. Bridget Todd, Priscilla Presley reincarnate has her the jump drive in. She's got it up there. I think. Okay, listen to this.
Okay. Well, can me to distraction to us going on ahead. And let me ask this. While he's making copies, would there be some objection to us going on ahead and hearing her testimony? I mean, you're asking me to dismiss the charges, basically, Ms. Todd, correct?
Yeah.
Okay. Well, if I don't decide to dismiss the charges, we're going to hear Ms. Gugliano's testimony anyway. So rather than wasting the jury's time, I'm going to bring the jury in, let you cross-examine her, let them redirect, and then I can take another break and maybe copies will be done by then. I'll hear objections to that procedure by the state.
No objection.
Objections to that procedure by the defense. All right, let's bring in the jury.
Yeah, just pull up the flash drive. Why?
Ms. Newman, get your notes. Have a seat. All right. People get a little tired. If you get tired at any point in time, just stand up, okay? Stand up, try to shake off the afternoon sleepies. All right. Dr. Gugliano, do you understand you're still under oath and your answers are still sworn answers?
Yes, Your Honor.
Did you discuss your testimony with anyone during the break?
No, I didn't.
All right, you may proceed cross-examination.
All right, ma'am. L.
Good afternoon, Dr.
Elle says, I don't know why people are defending someone who killed their mother. We watched the video. We did. We know she killed her mother. But we have this thing in the United States of America. It's called Constitution. And if the prosecution withholds any evidence from the defense, it's called a Brady violation and charges get dismissed. So we're all about procedure here. Procedure, the Constitution, right to a fair trial. So it's what we do here. It's a legal-based
Good
panel.
afternoon.
If you recall during your direct examination, Ms. Newman asked you about information you received from me. Is it correct in my understanding that you called me
Yes,
and I provided information upon your request?
yes, you did.
And during an evaluation, when you're evaluating a minor or any person, who's in control of that evaluation?
I am.
And if you felt for any reason that your evaluation was being hindered, either by something with the location or anything else, what would you do?
I would try to take steps if I could to correct it.
Dr. G, you mentioned on direct examination with Ms. Newman that there was an occasion in which I interjected or interrupted during your evaluation of Carly.
Yes,
And was that because there was a time or two in which I was aware that Carly was trying to answer a question for you that she didn't know the answer to?
there were a few times where you interjected to tell Carly not to answer if she didn't know, or to just say she did not know. And then there were times that you interjected to prompt Carly.
To make sure you had all the information, correct?
I can't say what your intentions were. I'm just
Okay,
saying
no.
you
Yeah.
prompted her by giving her, a word or something like that, or mentioning, remember this.
And Dr. G, you were originally there to do an evaluation on Carly's.
Let me just tell you how much I admire Bridget Todd's ability to get right back up and without missing a beat, continuing questioning with this witness when she is so angry that she's got smoke coming out of her ears.
Competency to stand trial and to determine whether or not she was competent at the time of the incident on March 19th. Is that correct?
Yes, her competence at the time to stand trial and her sanity at the time of the alleged offenses.
And can you, explain, but in the course of your evaluation, you ended up just evaluating whether or not Carly was competent to stand trial, correct?
That's correct.
And that's very different than whether or not she was actually competent at the time of the incident, correct?
Yes.
And you have testified for this court once before at a competency hearing. Do you recall that?
In this specific case? Or?
Yes, in this
yes.
case. Yes. And do you recall your testimony in that case that you informed the court that you stopped your evaluation because you became aware that medication might be an issue in Carly's competency at the time on March 19th, and you felt like there was someone else who could evaluate that?
Yes, it was my opinion that it appeared we had started talking, as I mentioned before, about what was going on with Ms. Gregg in the month leading up to the alleged offenses, and she mentioned her psychiatric medications and how she stopped one medication and started another a week before the alleged offenses, and that she had some reactions to those medications. So I recommended that a psychiatrist, a forensic psychiatrist, do the evaluation because I could not address whether any side effects or withdrawal symptoms may have been present due to medication, since that's not a specialty area of mine.
Thank you. I tender the witness, Your Honor.
Dr. Giuliano, in fact, you did try to question Ms. Gregg about whether or not she abused prescription medication, didn't you?
I did.
And she refused to provide an answer.
She declined to answer the question.
And are you able to go forward with any evaluation about medication when somebody fails to provide you information about it? Their abuse of medication.
If their abuse, no. No, if you're asking specifically about abuse, no, but there are other questions that I would have asked later in the interview about medications if I was evaluating her sanity.
And I believe you shared earlier that you did in fact render an opinion regarding her competency and her ability to recall facts, and that was that she is competent. Is that correct?
Yes, it was my opinion that she was competent to recall facts in relation to being competent to stand trial. I'm not saying how much she may or may not be able to recall of the alleged offenses.
No further questions, Your Honor.
May this witness be finally excused by the state?
Yes, sir.
By the defense?
Yes, Your Honor.
All right, y'all approach. You can stand down.
Thank you.
Stand down. Y'all approach. Oh, this is getting good. I know they're on break right now because I'm watching Law and Crime on my. Ooh, they're coming back.
20, maybe 30, and I apologize. This is my fault, okay? So I know it's in and out, but nonetheless, just take a breather. Give us about 30 minutes, all right? Everyone remain seated while the jury
All right.
exits.
Well, what time was that, Dewey? Dewey K? Do you ever know that you're my hero? This was not on my bingo card today either, Debbie.
The emails will be back for them. I'm going to take about a 10-minute recess, and hopefully the emails will be back for them, all right?
What do the emails matter?
All right.
I don't think the emails matter. I wanna
We'll be in recess till 1:05.
I wanna see the cellular phone extraction by Celebrat that was turned over to the defense, and I wanna know if those particular messages are actually on there. You know what I'm saying? That's what I wanna know. And now we on real time and they're not back yet, so we get to chat. All we care about is the jump drive. I don't care about that. But what I do want to do, since they're still on break, is I want to rewind back to when Miss Todd got all up in a tizzy, and I want to hear. I think it's the judge that read the messages, right? So let's hear the judge read those text messages that the defense say were cherry picked and not turned over.
Is that the first text message?
Here we go. If somebody could.
Back. Is that the first text message?
Somebody could remind me who BG is. Apparently, the miner's name is Bennett, Germany. Is BG the one that came over to look at the body? Or is BG is not the boyfriend, we know that. All right, here we go. Here are the messages.
Versus do it back. Is that the first text message?
Yes.
Defendant says, do it back. Mr. Bennett Germany says, I don't know what that is. What's going on? She responds, I don't know. I called Anthony because I wanted to talk to him. And then I saw him and I couldn't breathe. And I couldn't say anything because I didn't know what to say. And I can't remember anything that happened today. I zoned out for most of it and I don't know what's wrong with me. That's
Yes, Your
shown
Honor.
as the exculpatory part.
Yes, Your Honor. And that this text thread is dated as of November 22nd of 2023.
November 22nd of 2023. Who's Anthony? I have questions. Who's Anthony? I'm whispering because their volume is low, my volume is loud, everyone's complaining. I don't want to blow your ears out. Defendant says to BG, Bennett, do it back. BG says, I don't know what that is. What do you mean? Or something. And then Carly says, I don't know. I went to talk to Anthony today and I don't know what happened. I zoned out and I don't remember anything. All right. Well, I'm going to hear that again so I can transcribe it better.
Exculpatory part.
Yes, Your Honor. And that this text thread is dated as of November.
What that is, what's going on? She responds, I don't know. I called Anthony because I wanted to talk to him. And then I saw him and I couldn't breathe. And I couldn't say anything because I didn't know what to say. And I can't remember anything that happened today. I zoned out for most of it and I don't know what's wrong with me.
Can't remember anything that happened today. I zoned out for most of it and I don't know what's wrong with me.
That's
Yes, Your
shown
Honor.
as the exculpatory part.
Yes, Your Honor. And that this text thread is dated as of November 22nd of 2023.
All right. Anything further from the defendant?
Not-
By way of motion.
No, Your Honor, just that the U.S. Supreme Court and also the Mississippi State Supreme Court is clear about the failure of the fact that it was in the possession of law enforcement downloaded the contents of this phone, had it by search warrant and failed to produce it, and that the failure, and according to the U.S. Supreme Court in Arizona v. Youngblood, the failure of law enforcement is imputed to the failure of the state for discovery purposes.
Mm-hmm.
Response by the state, or do you need a few moments?
Oh, no, we heard your response. I'm not listening to that again. Bless your heart. All right. They're still on break. The sole issue right now, the sole issue is whether or not the prosecution turned these text messages over to the defense. That is the sole issue. Nothing else matters. Doesn't matter whether they were exculpatory, doesn't matter whether the state thought they were irrelevant, doesn't matter. The state had a search warrant for this kid's phone. They claimed to have turned over an entire extraction of the phone to the defense. Defense says no, they didn't turn this part over because this part was just given to us by this witness, BG, right now this morning. That is the sole issue. I'm going to go back and see if I can find BG's testimony. Let's see. I've got the testimony of BW. That's BW's testimony. So BW is the one who was in the backyard and saw right. BW is the one who saw the body, went into the backyard and heard 3 shots inside the house. So, and who actually said that he or she saw saw Heath coming home and didn't warn him, didn't call out. This is BW, and this is the one who also provided the vapes to Carly. and saw her drink the hand sanitizer. Now, there's another one, TG. I think that's Thad. That's the one who was the first boyfriend. That was TG, because that's the one who came to the house, and then Heath said, she doesn't live here or something. And then Carly told TG that she was being held down by her mother in the back room. So who's BG? The BGs have entered the chat. Yeah, I think this prosecutor's in deep water as well. Cam, thank you. I saw your question earlier and I did not address it. Says, I know nothing about the facts, but was she 50? She was 14 at the time of the killing. And they're stating she's bipolar. That's what the experts say. Bipolar 2. And some prior abuse is involved. Yes, yes, yes. Law Junkies, thanks for the 5. We appreciate you, Melanie. Thank you. In my opinion, Carly was failed by adults. Now they all want to blame her. Shame. Oh, bigger shame. This could be another Carrie Morrissey situation. Just like as such we saw in New Mexico in the Alec Baldwin trial. Dennis the Menace, thanks for the Canadian 5. Mistrial, this is ridiculous. The judge is flabbergasted. And you know, if you've been watching this case with me and you watch some of the pretrial with me, that this judge is bending over backwards to give Carly a fair trial. He has done everything. He has let the expert in, even though the disclosure of the expert was late. And he has bent over backwards to give this girl a fair trial. I don't think he's going to stop now. Thanks, Ms. Mojo. Mrs. Mojo Rising. Here's a fun story. When we were in, I don't know, I want to say high school, we loved the Doors so much that I had a friend who would make Jim Morrison a birthday cake every year, and we would have birthday cake in the cafeteria for Jim Morrison. Fun fact. Thank you, Mama She, who says, loving you so much today, Melanie. Loving you so much right back. Don't worry, we're on real time. Judge took a little 10-minute time out. Thank you, Angie, for becoming a member. Lawyer's daughter says, oops, Carly's attorney at the evaluation, not the state. I was confused. Yes, Carly's attorney went to the state evaluation. So, you know, sometimes we call it an IME, like an independent medical exam. And I always advise if I couldn't go with my clients, I would tell them to bring someone with them as a witness. But I'm talking about other different kinds of cases like car accidents and stuff like that. Because the defense was always entitled to an independent medical exam of the plaintiff. I am not a criminal defense attorney. Somebody said, I see the defense attorney and you coming out. No, but maybe in another life I could be, right? As a plaintiff's lawyer. Still am, but I'm just choosing to spend my time with you instead of having my soul sucked out of my brain by litigation. Are we in Canton, Sister Miss the Menace? Canton. Dr. Sue says the text messages are troubling and show she was losing time, which the state should want to have heard seeking justice, right? Yeah, and also, haven't we seen some other shenanigans by law enforcement? You know, I mean, listen, at the time, I didn't really think it was so much shenanigans. We watched the Karen retrial. You want to hear about shenanigans? Go watch that trial. You know, turning off the body cam, covering the camera on the body cam because he says he was talking about personnel issues that had nothing to do with the case when Carly's getting, you know, out of the car, like in the process of arriving at the scene with Carly. We've seen a little bit of it in this trial so far. We didn't know this was going to happen today. This is a huge surprise. Huge, huge. So let me go back into my little screenshots here that I have of this case and see if I can find any testimony from BG. Because I don't think I have it. All right. They're back. Sounds not up yet, though. Once again, the law and crime volume is very low. The court TV volume is worse. Please turn up the volume on your end.
Court to review. Mark them all text and number.
It's also a little out of focus right now. It's not us.
For
It's
the record, while we were out, the state went upstairs and grabbed a copy of our external hard drive that had the phone extractions on them. We opened that extraction. It was dated April the 30th. It included Bennett Germany's cell phone. We found the messages that Ms. Todd showed the court are in fact on that external hard drive found within the phone extraction that was turned over to them on June the 4th. Ms. Todd is currently in the process. She initially told me she did not have Cellbrite on that file. I showed her on her jump drive where she had it, and she's currently in the process of opening up Bennett Germany's cell phone extraction that was produced on June the 4th.
Your Honor, I have it open right now, if I can respond.
Hold on, time out. Where's the stuff you wanted to mark for ID? Is there any further response from the state?
Well, Your Honor, the fact that the witness took the stand already.
Okay,
Uh,
so let's finish up the response.
yeah, Your Honor.
Again, motion, response, reply, I rule.
Yes,
Okay?
sir. Your Honor. They were provided the information. This witness has
Honey.
taken the stand already.
just because they're on your hard drive doesn't mean you copied them onto your jump drive.
He could have been asked anything that they wanted to about these text messages. Their motion was that it was exculpatory and that it wasn't turned over. In fact, it was turned over. Your Honor, that I don't know any other way to say that they have it.
Okay. All right, you see. Reply by the defense.
Yes, Your Honor. If you will recall at our hearing on June 4th of 2023, which I have a transcript of, at that day, this court told the defense the state to provide all discovery to the state by 5 o'clock that day. The court then asked me if I, in fact, on page 65 of that, 66 of that transcript, the court says, Ms. Todd, do you have an external hard drive you can turn over to the state? And I said, yes, Your Honor, I do. And it said, you owe that to them by 4 o'clock today. And at that point, Your Honor, I did provide an external hard drive to the state before 4 p.m. that day. The state, I think Catherine was just a little mistaken when she said the state gave me these files in digital on the thumb drive. They weren't on the thumb drive. They were on a hard drive, and on the hard drive, it contained specific screenshots from March 19th with Bennett. And then in a different section of it, it contained like a summary on the external hard drive of like, sort of looks like this, of text messages. They're not in chronological order. There doesn't really even seem to be a date order, but I did type in one of the words from Bennett's text message that I gave you on March 28th, which was zoned out, and it's not pulling anything up.
Do you know how to use the Cellbrite extraction? Do you know how to use the Cellbrite tool, Ms. Todd?
Yes, Your Honor.
So you looked for it in the reader.
Yes, in fact, it even says here, select the current words, and when Ms. Newman typed it in on her computer, she typed in zone, and it pulled up that particular text message, but it's not pulling it up on this one.
Or maybe assist her and see if it's in fact on her.
Yeah, assist her. William Shatner is our judge. Yeah, if it's an image, I don't know if you can search that way.
It's there, Your Honor.
Oh, it's
Did you find
there.
it, Ms. Todd?
Yes, Your Honor, it did provide it.
So you did in fact receive it.
Yes, Your Honor.
Man,
All right. Ms. Todd, I'm going to say this. When you accuse a prosecutor of a Brady violation, if she had in fact committed a Brady violation, it should be terminated. That's a very serious allegation. Now, as far as Brady versus Maryland, the This is the court's ruling. First, the court finds that the defendant did receive it. As such, there is no Brady violation. Second of all, the first prong is that the state possessed evidence favorable to the defendant, including impeachment evidence. In fact, what I've read in this does contain impeachment evidence, but it impeaches Mr. Bennett Germany and your client. This talks about drug usage back to November of 2023, when their testimony is she didn't begin using drugs in any form till January.
What did it say about drugs?
Second, that the defendant does not possess the evidence, nor could she obtain it with any reasonable diligence. As this court, in fact, the defendant did have it, and obtaining it with any reasonable diligence, as I recall, Mr. Bennett Germany testified that he was her best friend and that he got on a bike and rode several miles to come see her on the day she said she needed help. I think Mr. Bennett Germany has been more than available to Mr. Gregg. Third prong is that the prosecution suppressed favorable evidence. In fact, they turned it over. And finally, that had the evidence been disclosed to the defense, a reasonable probability exists that the outcome of the proceedings would have been different. If I'm being frank, this reads more like she has some crush on some boy named Anthony, and there's a talk of a whole bunch of use of taking drugs and sleeping pills. I don't see where that would create a reasonable probability of a different outcome. And finally, the court would note that the state has no duty to search out and discover all possible exculpatory evidence. For those reasons, the motion to dismiss the case for a Brady violation will be denied.
Well, yeah, because they had it.
All right.
Boy, that's embarrassing.
I'll give these back to the court reporter.
But I don't think that it's I didn't hear anything about drugs in those text messages. I heard it like, I don't know what's happening to me.
All right. Anything further from the state before we bring in the jury?
No, sir.
From the defense?
Yeah, it's another ineffective
All
counsel.
right, Brady.
Another ineffective counsel argument. Yeah, they don't have a Madam Court reporter, do they? Is this Mississippi Friends? Do they how do they record there's no court reporter? Well, wasted the court's time, but it wasn't really that much time. And it was kind of exciting while we got to wait for it to happen. But yeah, that's pretty embarrassing that they did have it.
Next witness on the front row, please.
Agreed.
Oh, it was already here. I'm sorry.
All right, we're on real time now. Ain't nothing we can do. Cam, you haven't been here for the whole trial. There's been a lot of stuff that happened that would lead to a possible ineffective assistance of counsel claim. There's been a lot of stuff, a lot of stuff. Now go back to YSC and read. Yeah, Besson. I don't know. I don't know what you're saying, Mama G. My SC and again, loving you so much today, Miss Melanie, ma'am. Thank you, Mama G. Thank you. Oh, the roller coaster of live trials, huh?
All right. Thank y'all for bearing with me. I apologize. That was my fault. But I think we're ready to proceed now. Okay.
Oh, he
State may
blamed
call us
himself.
next witness.
State calls Dr. Jason Pickett.
That was nice that he blamed himself instead of blaming Bridget, Todd, Ms. Todd, attorney, counselor Todd. And this is Dr. Pickett. There's been a lot of talk about Dr. Pickett pre-trial. All right, I have to refresh this browser here because it's going to make me insane. It's their camera work. It's not us.
directly into it. Make sure you speak loud enough that lady on the back row can hear you, okay? Yes, sir. You understand your down to earth, your answers, your sworn answers on the penalty of perjury. I do, Your Honor. All right, you may proceed.
Dr. Pickett, if you would introduce yourself, please.
Hey, my name is Jason Pickett, Pickett. I am a board certified psychiatrist. I am a board certified emergency physician and a board certified forensic psychiatrist.
So I want to break that down one at a time. Tell us about you are a board certified psychiatrist, what that means.
That means I did a residency in psychiatry. I did it at the University of Virginia, and I treat patients with mental illness, anxiety, depression, OCD, PTSD. I work at the North Mississippi State Hospital where I see patients who've been committed to the state hospital. Most of my patients have a serious mental illness, which is typically schizophrenia, bipolar disorder, schizoaffective disorder, things like that.
As a emergency medicine physician, can you describe for us what that is?
Yes, as an emergency physician, I work in the emergency department and I treat emergencies. So stroke, heart attack, car wrecks, psychosis, acute, altered mental state. Patients are brought in by police, paramedics, family, so whatever can walk in the front door.
And we heard from Dr. Gugliano earlier about what a forensic psychologist does, but what is it that a forensic
I'm sorry, Raquel Gonzalez. First of all caps is against the rules, number one. Number two, are you telling me what to do on my own channel? You gonna come into my house and tell me what to do? Telling me to apologize? For what? For commentating about what was going on during that little thing? That if in fact it was a Brady violation, it was gonna be a problem for the prosecution? Who should I apologize to, Raquel? You? For your one-way ticket to Block Island? I'm really sorry. Na na, everyone all together. Na 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 na, na 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 na. Hey hey hey, goodbye.
psychiatrist does?
So a forensic psychiatrist, we do a lot of the things that a forensic psychologist does, but we also have the expert experience from residency dealing with and prescribing medications. So we're better qualified to consider medications and how they may benefit or harm somebody related to, in a forensic realm, it's related to maybe a crime or competency to stand trial, sanity at the time of their mental state at the time of the offense and such. So.
I want to talk about.
All right,
kind of
I am
back-
not making fun of anybody's accent. I'm also an actress, so I'm protecting my own accents and I'm practicing. I said that earlier. Bless your heart. For the love of everything that is traveling, Mary.
Before you got your certification and talk about if you could give us the
Speed
benefit
'em
of your
up.
educational history.
Yeah, so I went to Mississippi College and have a bachelor's from there, a master's degree from there. Then I went to the University of Mississippi Medical Center for medical school. Then I stayed at the University of Mississippi Medical Center where I did a 3-year emergency medicine residency, completed that, and immediately after finishing that, I went to Virginia and started a second residency in psychiatry, completed that, worked as an emergency physician throughout that training, periodically here and there as much as I could. And then I did a 1-year fellowship after completing the psychiatry residency in forensic psychiatry where I stayed in Virginia. And that included 2 days a week, I would go to the state hospital in Virginia where I would see patients pertaining to competency and sanity. And then 2 days I was at the ILPPP, it's the Institute of Law, Psychiatry, and Public Policy, where there's a lot of forensic psychologists and we work on forensic cases together. And then 1 day a week I would go down to the women's prison and see patients there as typically general psychiatrists, but it's in a correctional setting. So.
And when you're doing this fellowship, you're actually already licensed to practice medicine.
Yeah, to some degree. I have my MD. You get that when you graduate medical school. So I had that throughout my ER residency and my psychiatry residency and my forensic fellowship. And I was moonlighting as an ER doctor while I'm doing the second residency and fellowship just to pay some bills. But so yeah, I was able to practice medicine throughout all that.
Do you have to take a test or get any kind of certification before you can be a forensic psychiatrist?
Yes, you have to do a 1-year fellowship, which you have to apply for. In the state of Virginia, they only take one applicant a year. And fortunately, I was blessed enough to receive that position, which was an honor. And I was very thankful for my training there. Then after completing that, you have to take a board certification, which is expensive and takes a lot of time and money, but I did it and passed, and I'm happy.
And where is it that you're licensed?
We would accept him as an expert in general psychiatry, forensic psychiatry, and emergency
Medicine.
medicine. We got it.
All right, he'll be admitted as an expert in the area of general psychiatry, psychiatry, and emergency medicine. You can continue with your questioning about the witness's qualifications and commission.
Yes, sir. Dr. Pickett, I do want to ask about this. Prior to being involved in this case, have you had the opportunity to perform mental evaluations of defendants?
Yes. In my fellowship, I had on the forensic unit at the state hospital, by definition with the forensics, most of them have some kind of criminal or some kind of crime related to their mental health. And so I would evaluate their competency to stand trial to see, do they understand? Do they meet all the qualifications and such? So yes.
And we heard Dr. Gugliano talk about there's a list in the state of Mississippi of forensic either psychologists or psychiatrists that are certified to perform these types of evaluations through the Department of Health. Do you know, are you one of those?
Yes, I am.
And how many forensic psychiatrists are there in the state of Mississippi that have gone through the qualification to perform the mental evaluations through the Department of Health?
I don't know how many have gone through the process, because you do have to apply and go through those credentials. They, in my opinion, would be qualified if they wanted to do the process. I don't know how many did the process, but there's only about, I think, 6 in the state of Mississippi. And as far as forensic psychiatrists go, not all of them are practicing. And many of the forensic psychologists are actually out of state. Some of them are out of state that we have. And the list is not very long.
When you are asked to do in your previous evaluations, when you're asked to determine whether somebody is either mentally competent or insane for trial purposes, who usually hires you, or who are you doing that on behalf of?
To date, I'd say 99% has been the defense. This is my first case being retained for the prosecution. But I do want to make it clear that I remember when we first talked, regardless of whoever brings me into the case, my opinion is my own, and I take great pride and responsibility in that. And regardless of who gets me involved, I let them know from the beginning that my report may fall on your side or it may not, and that's that.
And when you were
Did he
retained by the
say
state,
he was originally hired by the defense? JP, the reason I give attention to posts like that is because I don't want people to think that that's acceptable behavior on my channel. It's just not. I'm not going to tolerate it. And I want people to know that. So, not to ruin your mood or anything, but it ruins my mood to have to deal with this BS all day long. Okay, because I've already been here for 4 hours and 4:20. Doesn't it figure? And I think he just said he was originally hired by the defense. Hang on.
To date, I'd say 99% has been the defense. This is my first case being retained for the prosecution.
Okay, the prosecution did retain her.
Regardless of whoever.
Him.
Take great pride and responsibility in the beginning that my report may fall on your side or it may not, and that's that.
and when you were retained by the state, we agreed to that, right?
We did.
Can you explain, and I know you were present for Dr. Clark's testimony and that you were in the courtroom for Dr. Gugliano's testimony. I just want to make sure that we're talking about the same insanity standard. Can you describe for the ladies and gentlemen what the McNaughton standard is in the state of Mississippi?
Sure. So the McNaughton standard for insanity, and it does vary from state to state. In Mississippi, it is named after Daniel McNaughton, a guy in 1843 who he thought he was killing the prime minister, and he actually killed like a secretary, and he was found insane. And so at that time, they came up with a law, again, this was 1843, I believe, where you have to have a threshold mental illness just to consider insanity. If you want to move forward, you have to have at least a mental illness. Once you have that mental illness. That's like your ticket. That's like you cannot pass go without that ticket. So you get that diagnosis, and then we can consider the other prongs of this standard. And for McNaughton, it is, did the individual understand the nature and the quality of what they were doing at the time of the offense? That's one. The next one is, did the individual understand the wrongfulness of what they were doing? And so you may have a mental illness, schizophrenia, bipolar disorder, PTSD, whatever it is, but that does not equal insanity by the McNaughton standard. You have to meet the other prongs.
I want to talk about those prongs, Dr. Pickett. You said to know the nature and quality of the acts you were doing. Can you kind of break that down and explain that for us?
Yeah. So nature, to understand is, from my understanding, is a relatively low bar. It's a knowledge. You know what you're doing. It's a fact-based knowledge. An appreciation, in my opinion, would be a higher standard of you. I think, as Dr. Gugliano testified to earlier, you would also understand the social implications and the ramifications. It's a higher standard. But in Mississippi, according to the Mississippi Rules 12 of criminal procedures, which talks about the standard and such, there's simply an understanding. Did this individual know what they were doing? Did they understand the nature? For example, understanding the nature. Let's say somebody is really psychotic. They are out of their mind. They are squeezing a lemon. Or they think they're squeezing a lemon. And they're squeezing, and then in reality, instead of squeezing a lemon, they're choking somebody to death. They would not, in that instance, understand or have an appreciation or an understanding of the nature and quality of what they're doing. They think they're squeezing a lemon, when in reality, they're choking somebody to death. Or, yeah, so that's basically that.
And as far as the second part
When they
of
think that they're
prong,
squeezing a lemon, but they're really choking someone to death? Okay. There's a join link in the channel description. Try that. Sometimes it's weird if you're on an iPhone, or it depends on what device you're on, but there's a link in the chat in the description. Thank you for wanting to join.
did they know right from wrong? Did they know wrongfulness? I think we all kind of are taught as children right from wrong, but can you describe for us in a legal stance what that means?
Yeah, so in Mississippi, the second prong is, did they know, have an understanding of the wrongfulness of their acts? And in Mississippi, it's a legal wrongfulness, just simply knowing that it's illegal, not even necessarily morally wrong. In other states, it's a moral, like, yes, I know it's illegal to do that, but it might not be morally wrong. I have to, let's say, yes, I know murder is illegal, but I have to kill this alien to save America. So they wouldn't understand the nature because they're psychotic and delusional, and they wouldn't understand the wrongfulness morally because they think it's an alien and they have to kill this alien to save America. So morally, they might not think that was wrong in that example. But in the state of Mississippi, it's simply a knowing legally that it is wrong.
That's confusing for me.
So just to clarify, even if they didn't morally know it was wrong to kill that alien, they thought it was an alien. In Mississippi, you still don't get to insanity.
Correct.
In this particular
So
case,
you don't get to insanity for killing an alien? Or you don't get to insanity because you thought you were killing an alien, but it was really a person? I don't know. Are you lost? Do you think the jury's lost? They can't take notes. So
who was the defendant?
Miss Carly Madison Gregg.
And did you have the opportunity to interview Miss Carly Madison Gregg?
I did.
What other information? Let me take a step back, Dr. Pickett. I apologize. Did you perform an evaluation and prepare a report in this case?
I did.
And did you render opinions regarding Carly Madison Gregg in that report?
I did. I met with Miss Carly Gregg on August 30th for about 4.5 hours here with Attorney Todd, and I rendered a decision that was based on my interview with Carly, my extensive review
Here's the problem
of
with
a
that, sir.
lot of
Doctor,
discovery.
doctors don't render decisions. You see, the judge renders decisions, also called orders. What you render, doctor, is an opinion, not a decision. It's not up to you. This is your opinion, not your decision. And it's very interesting how two different doctors can meet with Carly for like the same amount of time, 4 hours, and come to two totally different opinions. And that's why we have a jury. They are the finders of fact. They need to weigh the evidence and they will make the decision. This is your opinion, doctor. Just take that back a sentence.
Extensive review of a lot of discovery. My training, education, experience, and knowledge. I pulled on all of that to surmise a opinion.
And was that opinion to a reasonable degree of medical certainty?
Now, hold on. I think we didn't go back far enough. Or it must have caught up to itself or something. Hold on.
I did it at the University of Virginia,
Yep.
and prison, and see patients there.
On his testimony, I just want to make sure that we're talking about the same insanity standard. Can you?
McNaughton, it is 12 of criminal procedures. Did they know Mississippi? It's simply Carly, my extensive review, my half hour, met with Miss Carly.
That report.
I did. I met with Miss Carly Gregg on August 30th for about 4.5 hours here with Attorney Todd, and I rendered a decision that was based on my interview with Carly, my extensive review of a lot of discovery, my training, education, experience, and knowledge. I pulled on all of that to surmise a opinion.
And was that opinion to a reasonable degree of medical certainty?
Yes, it was.
And the items that you're talking about that you reviewed, the interview with the defendant, the mountain of discovery, talks with my office. Did you also talk with Ms. Todd?
Yes, to some degree. I talked to her, I think, mostly during the evaluation and occasionally via email correspondence.
In relying on those things, is that something that a similar situated forensic psychiatrist would rely upon in rendering his opinions?
Yes.
So I want to talk to you about, well, I want to talk to you first. Let's talk about what your opinion is regarding Carly Gregg's sanity, and then I want to back up to how we got there.
Okay.
So what was your ultimate opinion as to whether or not Carly Gregg was insane at the time of the murder, attempted murder, and tampering with physical evidence on March the 19th, 2024?
I'm happy to discuss my opinion, but I do want to say the ultimate opinion is for the fact finders to decide, and I would just offer my opinion. So I do not want to speak to the ultimate decision, but I just want to lay out my opinion based on everything that I have researched and written and read and done. So my opinion is that Carly does not meet Mississippi's standard for insanity at the time of the offense, and that she knew the nature, quality, and wrongfulness of her actions during that day.
So, Dr. Pickett, I want to take you back to the things that you review. You talked about a mountain of discovery. We've seen in the courtroom, we've seen some videos from that day. Did you have the opportunity to review those?
Yes, I did.
Did you consider those in rendering your opinion?
Yes. When you say those, I've seen the garage video footage. I've seen the Wise video camera footage from the dining room. I've seen body camera from the officers. I reviewed several of those. So I have seen a lot of video.
I want to take you back to your interview of Carly Gregg. When did you say that happened?
August 30th of
And
2024.
who was present during that interview?
Me, Attorney Todd, and Miss Carly Gregg.
In your practice, is it common for a attorney or a defense attorney to be present during your evaluation?
It's not common. Most of the time I do my evaluations for the defense. And so most of the time they don't come and they know that I'm there most of the time. But no, they can be there. It's not standard that they are, but they can. And it's not a problem if they are.
In this particular case, in your report, you noted that Ms. Todd was present, but there was something that stood out to you about the participation in this evaluation. Can you tell the ladies and gentlemen about that?
Yes. So at the beginning of the evaluation, Attorney Todd told me that, hey, there's some things that Carly doesn't like to talk about, so I will have to prompt her. And I told her, that's fine, especially in adolescence and a 15-year-old. When I see patients outside here, parents are often involved. That's not unheard of. They have to prompt them. That's totally okay. As the evaluation went on, though, it seemed to be significantly more than just simple prompting. It seemed to become very leading questions, close-ended questions, interjecting particular things and redirecting the conversation at specific times. And in my report, which is 85 pages, I do list examples of this, and I can go through that if that's desired. But it did seem excessive, and it seemed like I was being led somewhere in some of the examples.
And what was your opinion as to why you were being led?
I really don't want to speculate as to why a defense attorney might, interject so much. It did seem calculated to me, and like there may be some secondary gain in trying to fool me into believing something. In my experience, most of the time when patients are experiencing these things, they do not really need a lot of prompting. Most of the time, if they're suffering with severe mental illness, auditory hallucinations, these scary dissociative spells, they will volunteer that information usually and be able to tell me very vividly and without prompting what they're suffering with.
And just to be clear, Dr. Pickett, it was not your intention to pick on Attorney Todd, right?
No.
You simply noted that in your report because you found it unusual.
Yes.
I want to talk to you about, during your evaluation and your review of the discovery materials, did you ever find any evidence of drug use by Carly?
Yes. There's a lot of mention from her friends, and which, I try not to put too much weight into that because that can be hearsay, opinion, text messages here and there about substances, but there was a lot of it, which made me think there could be more involved here with substances. And it seems like that was the trigger or the impetus for the conversation on the 19th between her and her mother. So I do think substance abuse is relevant.
Did you also review the results of a drug screen of Ms. Gregg?
I did.
Could you tell us what a little bit about that?
Yes. There was a drug screen that was obtained, I believe, at the juvenile center after she was detained, and it tested positive for cannabinoids.
Did you have the opportunity to review the vital core records also?
I got some records from Region 8 afterwards. I did not get the vital records afterwards. Only it may have been in discovery, but by that time, I think I had already written my report. And what was in the records, medical records, mental health records after the fact, to me is highly skeptical. And so I don't necessarily put a lot of weight on what was said after the fact, given the very large suspected secondary gain.
Dr. Pickett, if there were another drug screen in the vital core records that showed the presence of marijuana, what would that indicate to you?
It would indicate that she had used marijuana at some point in the recent history of that drug test.
How recent?
I want to talk to you about some of the other things, Dr. Pickett, that you relied on in your evaluation of Carly Gregg. May I approach the witness, Ron? Exhibit 11, and it does not appear these pages are numbered. So what's previously been marked as Defendant's Exhibit 11, and it does not appear these pages are numbered. So I just kind of want to go through them in order.
Okay.
Does that look like something that you reviewed previously?
Yes.
If you could tell, ladies and gentlemen, what's on the very first page of one of the journals and or sketchbooks or scratch pads from Ms. Gregg's group?
It says water, fire, earth, air. Water, fire, earth, air. Water, fire, earth, air. Fire is circled, and it says, I choose fire. It is powerful, beautiful, and deadly. These are the traits I desire, so I choose fire! Exclamation mark.
And did you consider that whenever you were rendering your ultimate opinion?
I take everything into consideration that I have, that I can. When I look at this in these journals, there's a lot of things in these journals. And I took the time to look through them. And some of them are concerning. Some of them, I question the truthfulness of it. Is it more theatrical? Is it truthful? I think it's hard to know, but I try to use my judgment as I'm reading it in the context. This one seems to me that she writes down in her journal that she desires powerful, beautiful, and deadly.
Okay, your interpretation
what were
of what
some
she means by water, fire, earth, and air. Anybody into astrology? Aren't those also like the astrology signs are broken down into water signs, air signs, earth signs? She's not an arsonist. I don't know. I think journal entries like that could be incredibly subjective.
of the other journal entries that stood out to you, Dr. Pickett?
Can I look at my report, please?
Sure.
Okay.
Yeah, the 4 elements, right? Kate says it's a
So
quote.
one of the journals, I think this is the Brown journal. It says in the beginning,
If he's gonna refer back, can I have another, can you just tell us what page he's referring to?
this would be, I'm sorry, this says entry January, it would be the first, I think it's the first one on January 2023, 2024, the Brown.
Yeah, if you can tell me what page.
They're not bait stamped. That's what I said. It's hard to tell because they're not bait stamped.
I think, where'd you say?
Approach, yeah.
Avatar, like the movie.
He's on page 20 of his report.
I know one of y'all is, so it says in the first entry of this journal, I know one of y'all is going to read this eventually, which I guess I have no control over. So to me, the very first entry of this journal, she acknowledges that there's going to be an audience. Somebody's going to read this journal. And she suggests that she has no control over that. And so as I think about that, I ask myself, is this a personal journal where somebody puts things that they are really trying to keep secret? Or is this a budding, articulate author that describes things for theatrical reasons? And so as I go on, there's other things that make me say that. For instance, she talks about various movie reviews. One of them was Pinocchio, the still life. It's a new one that came out, and she talks about her favorite scenes were when the bomb was dropped on the church that killed Carlo. Mussolini, and Mussolini, he's like, he was an imperialist that was associated with Hitler, believed in xenophobia and imperialism. And so I believe signed a pact with Hitler at some point. And so her favorite parts of the movie were the war crimes, Carlo getting killed, and then there's other things where she talks about Harley Quinn, which is some of this stuff is childish, but it shows us into her mind. And so she's right. Harley Quinn is
Childish. She's dude, she's 13, 14 when she's writing this journal. And when you say childish, what do you mean? 5-year-olds watch Harley Quinn?
the Joker's girlfriend, and she's crazed and psychotic and does these violent crimes. Then one instance in her journal, there's a little pin mark where she says it looks like you just poked the paper. And then she writes beside it, look what I did right here. I stabbed my journal like it was Tom Riddle's. Tom Riddle is from Harry Potter series, and he turns into Lord Voldemort, and he's evil. And so in her journal, she talked about
She's
Harley
smiling.
Quinn, war crimes, Tom Riddle. There was another page where I can find where she says, what do I believe? And she writes these tenets down, and one of them says, it's okay to be evil. There is no God. And if I can have a minute, can find others.
There is no God. I guess, is that something you might not want to say? In Mississippi, religion has come up quite a bit during this trial. It was brought out that her bio dad is a Jehovah's Witness. And in fact, the therapist who testified earlier said that she told Carly during therapy that she was a Christian, just so Carly would know that. Lady Mook, this is my favorite meme of the day. It says describing things for theatrical reasons is exactly what this guy's doing. Right? Or maybe she knows that someone will be an a-hole and read her personal journal. And her mother was, looking around in her room. Some might call it snooping. Right? I don't think it necessarily means that she was going to, commit this act and wanted people to read it like a manifesto. I don't know.
Yeah. Thank you. So this one in the journal also, what do I believe? There is no God, heaven and hell are fake, love is important, you don't need family, writing your own destiny with a check mark beside it, loving yourself, having friends is important, don't belong to anything, never be alone, go to your place of comfort often, sometimes you must blend in, but never forget it's okay to be evil, sometimes you must jump into the dark to truly see the light, privacy is not loneliness, death is inevitable.
Well, it is. Death is inevitable. It's her
What are other
journal.
portions
So
of the journal that you found concerning?
it's acceptable.
Another
it's
part where she talks about her reported auditory hallucinations. She says on March 12th, 2024, this is on page 21 in my report, she mentions enjoying books about crazy people. And then she adds that she had a psychotic break because the
Why is he using air quotes? He's using air quotes. This guy already has confirmation bias. Like, he does not want to believe her. Did you see the air quotes? Hold on. If you come back and look at your screen. 85-page report.
On March 12th, 2024, this is on page 21 in my report.
And this
she
is
mentions enjoying books about
exactly 1 week before the shooting.
About crazy people. And then she adds that she had a psychotic break because the incident quite silly. And she goes on to say, I actually spoke with one of the voices in my head. Well, I didn't hear them until earlier today, but only then. My particular friends and I were practically screaming bloodthirstily and ravenously. Thank God physical confrontation was not fruitively possible. I sound crazy. And then she continues on. In other sections of her journal, she talks about all the dishonesty.
The dishonesty with what, Dr. Pickett?
I believe she was referencing to after the iPod that she was using as a burner phone had been found in early January. She wrote in her journal at some point, I'm kind of relieved. Thanks, because of all the dishonesty. I'm glad it's just over with, so to speak, was my impression.
Your
So
impression.
there were a
Are there
lot
other
of things.
things?
So it's wait,
Yes, sir.
it's your impression, so that means it's subjective, right, Doc?
There were also text messages that I had seen between her and friends that were concerning. When I'm trying to understand somebody's psychiatric mental state, all of this is important. Text messages with friends, conversations with friends, parents, what's going on at school, what's going on at home, drug use, medical history, psychiatric history, all of this is important. And so there's a lot of detail here. And so as I was looking through text messages, one of them she says to, this is on page 22, she's talking to Thad on February 7th, 2024. She says, "You don't understand how fucking psycho I was that day. I almost murdered my parents." And so as I am preparing to come and evaluate her, given the context of what's going on, I take extreme time to go through the mountain of text messages between teenagers, diaries, journals. Some of it seems theatrical and to almost entertain a would-be reader, and some of it is very concerning.
Dr. Pickett, were there also some, I want to come back to the text messages in just a minute. Were there also some
JD, sweetheart,
notes
watch
that
your
you
language.
looked at of Carly's about gaslighting?
There was a folder that was found, and it does, it goes into a lot of detail about emotional manipulation and gaslighting. And it says at the top, emotional manipulation, gaslighting, and it would define kind of what that is and the setup and how you set this up, how you do it. And then, at the end of it, it signs off with a valediction that says, "Take advantage, happy hurting."
There were also
Take advantage, happy hurting. Yeah, let's try and be real creative with our language in the chat. I had to just delete something, JD, that you wrote just because YouTube uses AI to scan the chat. If they don't like the words, they shadow ban. It's a thing. I want to hear that again.
Valediction that says, "Take advantage, happy hurting."
there were also I guess what had been labeled as a dream journal. Do you remember looking through anything where she described some of her dreams?
I do remember one of her writings where she talks about her dreams and kind of leaves the reader with like a cliffhanger of, I had something along the lines, I'm paraphrasing, of, "I had a really good dream last night. I hope I have another one tonight. Should I write my dreams down?" In other words, to like share them with whoever might read it in the future.
Why is he mocking her? I feel like he's mocking her. I feel like he's mocking her journal, and I don't like it. And I don't like it. I don't know that the jury's gonna like it either. I don't know what the makeup of the jury is. Men, women, I don't know the demographic. The courtroom is basically empty. There's really I don't have any boots on the ground in the courtroom. So I don't know how this is gonna go over with them.
Recall also seeing Dr. Pickett something where she said back in April in one of her notebooks, "I have depression and anger issues, but no one gives a shit."
Yeah, I think she used the word rage.
Yeah. Before I move on, I think there was another one. There was actually something that was produced in discovery, and
Nobody
you were
cared.
present when Dr. Clark testified. It was like a piece of paper that was in green, like a green marker handwriting. As your understanding and from the testimony yesterday from Dr. Clark, that Carly denied ever writing that or knowing who wrote that. Is that right?
I don't know that I asked her specifically about that page during our evaluation.
Have you reviewed his report?
I have.
And he asked her about that.
He did it?
And then
Oh, I believe he did.
when you were present when he testified yesterday about that.
Yes.
Something just happened with the law and crime stream, and it made him look like he was like, hold on, I gotta see that again. Watch.
During our evaluation.
Have you reviewed his report?
I have.
And he asked her about that.
He did it?
And then
Oh, I believe he did.
when you were present when he testified yesterday
Yes.
about that.
Yes.
The ghosts are in the chat.
What did Carly say in one of her journals or notebooks about innocence?
There was a quote in one of the areas that said, I think I'm on page 46. It says, life's greatest illusion, innocence.
That's true.
So Dr. Pickett, you talked about some of the text messages that you reviewed. Were those messages from the day of the incident, March the 19th, 2024?
Yes, some of them were. I reviewed text messages for a long time, various people, but yes, I did review text messages from the time, very close to the time of the offense.
So I want to walk you through that. So the messages that you reviewed, can you kind of tell the ladies and gentlemen about why that was important in rendering your ultimate opinion?
Yes. So the text messages at the time of the offense are a window into her mind at that time. And having her words that close to the time of the offense is a pretty good window into her mind and what she was thinking and how she was doing at that time, in my opinion.
And I asked Dr. Gugliano, I believe you're present in the courtroom, it's not very common that we actually have like medical records from a defendant the day before they commit a violent crime, is it?
In experience, I'll have medical records related to somebody who's had a crime, but having somebody do a exam the day before is pretty unusual, rare, not the typical norm. If I have that, I'm very thankful for it.
There's a glitch in the matrix.
I want to talk, when we get to your what you relied upon on the day of the incident, I want to talk a little bit more about the text messages and things too. I want to call your attention to something in your report where you talked about that Carly's responses seemed almost textbook perfect. Tell us what you meant by that.
Well, when I would ask her to tell me about some of her reported dissociative spells, she would give me the cliche answer of, well, I just felt like I was outside my body, like I was right here. She kind of did that hand motion like that and said, it's like a dream, like I was just watching myself. And that was another example was when we were talking about racing thoughts. I asked her can you elaborate on that? Tell me more about your racing thoughts. I think she said it's like the ocean. And sometimes from experience, people who may not actually have a diagnosis will have trouble going beyond the simple textbook cliche answers. Whereas when I see people who legitimately suffer from schizophrenia, bipolar disorder, or even I've seen a few rare that actually had a dissociative disorder. It is rare. They usually can vividly describe these things to me. And oftentimes I see them objectively. They can't hide it. Sometimes they don't even have insight into it. And when somebody comes to me to the state hospital, I mean, it's hard to give an impression of racing thoughts, but these patients, they go from 0 to 100 and their thoughts one after another, boom, 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 boom. And they may or may not connect, and their pressured speech, it's hard to get them to stop. It's very obvious when they're to that degree. If they're psychotic, it's even more obvious. In my opinion, you don't have to be a psychiatrist to recognize some of these things. Their cousin or their mother or their brother will say, Johnny's not doing good, doc, and they'll drop him off in the ER or they'll drop him off at the state hospital. Well, they'll get committed and come to the state hospital, but it'll be very obvious.
Dr. Pickett,
So it wasn't real obvious to you, and so therefore she must have been faking? Am I overreacting to this? Is this the Trooper Paul of the Carly Gregg trial? I would never want this gentleman, doctor, evaluating anyone in my family.
at some point in your report, you talked about the DSM-5-TR. And we heard Dr. Clark talk a little bit about the DSM-5 yesterday. Can you tell us what the difference in the 5 and the TR is?
Every few years, the American Psychiatric Association councils get together and revise, do a text revision. So they update the DSM-5 criteria with various things and criteria. And so every few years, there'll be a new revision come out. And the DSM-5-TR is the latest version and the one that I depended on while I rendered my opinion.
Yes, remember, she was put on antipsychotics when she got into jail, which was in March. He didn't see her until like 2 weeks ago. Well, August 30th, 3 weeks ago. She's on heavy duty antipsychotics now. Does he mention that?
Part of your report talks about Carly's thought process, that it was linear, logical, I think reality-based and goal-directed. Could you explain to us what you mean by that?
So linear, so as a psychiatrist, our physical exam is a lot of observation. Kind of start at the head, eye contact, their blink rate, are they slow? Their speech rate, their speech content. We get in.
He was just imitating her blinking. Okay, because we've noticed that she does blink a lot. Maybe that is a side effect from the antipsychotics that they've forced her to take in prison, jail. I'm going to get taken back to normal speed now because I did have him on normal speed. So, I mean, I did have him sped up. Let's just watch him imitate her blinking.
Their speech rate, their speech content. We get into their thought content, their thought process. Is it linear, A, B, C, D? Ideas seem to connect, or is it, very disorganized and they don't connect? And so linear means we're having a conversation. It's going from A to B, and they connect. Logical means it's reasonable and it's real. It makes sense. You understand. Reality based is it's not delusional. So somebody that I see at the state hospital who's psychotic, they may come in with delusions and they'll say, the FBI's after me. And I know it because I saw a gas can at the gas station. And I knew that gas can was a sign that the FBI's following me.
They should have hired you in the Boulder shooter case because that's what he was saying. The FBI was following him. He's using insanity as a defense too. So are you telling people who now want to fake insanity that that's what they should say? That the FBI is after them because they saw a gas can? Well done. Off clap for Dr. Pickett.
Or they'll come in and they'll talk about revelations and the black horses and the white horses and the orange horses and the 6-point stars. I mean, it is very disorganized. It's hard to give you an example, but when you see it, it's pretty obvious.
And also, you work at the state mental hospital. You work with the worst of the worst, I'm going to assume. Right?
We've heard testimony. Dr. Clark described a manic state and a hypomanic state. During the course of your evaluation with Carly, did it ever appear that she was having any sort of manic state?
Not during my exam, certainly not.
In your review of the medical records, did it ever appear that Carly had reported any type of manic state?
No. I reviewed, I think the therapy notes started with Annette Bryant back in 2015. At least those were the oldest that I had to look at. I looked through those, did not see any mention of dissociation, no mention of auditory hallucinations, no mention of mania or hypomania. So that was from 2015 to 2019. Then I reviewed the LPC Kirk, the counselor, her charts from January of 2024 through March of 2024, the day before the event. There was no mention of auditory hallucinations, dissociative spells, hypomania or mania, or disorganized thoughts, or anything consistent with psychosis. And then I reviewed the mental health nurse practitioner Lieber. I read all of her notes, January, February, March, and none of those mentioned it either. I also found some medical records from UMMC. I think she would have been about 11 years old. There's a Dr. Vaughn and another doctor. Those were well child visits, but a lot of times, commonly, if a general practitioner recognizes that somebody has bipolar or schizophrenia or whatever, they'll put it in there. And I didn't see anything in those either.
Did you see anything about the fact that she was cutting? So you looked at some records from 2019, and then you looked at some records from 2024. Did you look at anything in the 5 years between 2019 and 2024? Did you know that she was cutting since she was like 11? Making me mad, Dr. Pickett.
I want to come back to the talk about disassociation, but I want to talk a little bit about Dr. Clark said that Mr. Gregg, Carly's dad, had been diagnosed with bipolar. Did you see medical records that had him listed as a diagnosis of bipolar?
I saw very sparse records that listed him as bipolar.
Based off your training and experience, if someone also suffers from a substance abuse addiction, would it be hard to diagnose them as being bipolar?
It is hard. It's not impossible. But can I elaborate about
Please.
his notes? So I reviewed and I asked for any records, any psychological records pertaining to Mr. Gregg's mental health. And the only thing I got were the 3 records from Dr. Hardy. And there was some mention of his bipolar disorder in some of the therapy notes, like I believe LPC Kirk's, but that was secondhand that had been given to her from Ashley. The only ones I could see to confirm, supposedly confirm, is from a Dr. Hardy. And so as an emergency doctor, as a psychiatrist, anytime a patient is brought to me, whether they're in the ER, or whether they're in the state hospital, I do my best to go back and review these diagnoses because I do not like to just simply accept them, because it is common for people to be misdiagnosed with some mental illnesses, especially if they abuse substances heavily, which, according to my review, Mr. Kevin Gregg was well known for his substance abuse and for many years.
Oh.
And I talk about that in my report.
So you talked about this in your report. So in your opinion, having never met Kevin Gregg, you don't believe that he was really bipolar. Therefore, it couldn't have been a genetic component for Carly. You believe that Kevin Gregg really is just a drug addict. And so is Carly. And she's really not mentally ill. She's just a drug addict.
If you want me to go into that.
Sure.
So let me see if I can.
Wow. Right. Now he's saying the father was misdiagnosed. He's
So,
really just a drug addict.
so there's tweets from Mr. Kevin Gregg on March 6, 2012, DMT, psilocybin.
Oh, there's tweets. We're going to hear some tweets. Tweets have entered the chat from Kevin Gregg's tweets. Now his tweets are coming in what? This is really like glitchy, but it's law and crime. It's not us or you.
So
Sorry.
there's tweets from Mr. Kevin Gregg on March 6, 2012, DMT, psilocybin, lysergic acid, diethylamide 25, that's LSD, mescaline, which comes from
It's mescaline.
cactus, I believe. It's a hallucinogen. MDMA, which is ecstasy, good when used responsibly. Salvia, opium, coca, which are like plant natural things that you can make opium and cocaine out of, good naturals. He says that in 2012. And then he continues on. I mean, there's like 50 or almost 50 tweets. He tweets at Obama, legalize marijuana. You're ignoring this huge campaign because there's no funding. Bomb the Middle East with cannabis. They'll think they'll want to fight or eat.
Stop. In 2012, when Carly would have been, how old? Let's see if she's 15 now. 3. This guy is talking about DMT, LSD, purple microdons, and how they're fantastic. What kind of an effect do you think that would have had on the 3 or 4-year-old kid who had to visit this guy? I wonder if he was dosing her at an early age just to see what would happen. In my mind, and I'm not a doctor, I'm just a lawyer with over 30 years experience. I'm going, this girl was 3, 4 years old. She has to go visit him. He's touting the amazing effects of LSD and hallucinogens. What was he feeding her? Maybe. Holy crap. Holy crap.
And he goes on.
Yes.
Actually,
Amy?
in her journal that I read, it has 334 entries in it approximately that I read through.
Oh. Long Crime did it again. And there's another meme for you guys. I don't know if Jason's in the chat. He loves to make memes. Watch. Hold on. Oh, wait. He's not on the screen. Wait, what? You got to see this. Come back to the screen for a second.
That I read. It has 334 entries in it approximately that I read through.
It's like Woody Woodpecker. Right. Think about what Ashley did to try to protect her child, and no one protected Carly. Do you think that reading these tweets from her bio dad, who's a nut job, whack job, drug addict, bipolar, crazy person who abused her, do you think this is going to help the prosecution? He very well could have been microdosing her or worse. I'm horrified. I am horrified. I am outraged. Oh, we have that I am outraged emoji. Let's use it.
134 entries. So Ashley, she wrote in her journal of 334 entries a lot about her problem issues with Kevin.
Okay, now we're going to hear about the mom's journal. This is Ashley's journal, okay? Let's get a load of what Ashley's got to say in her journal.
And she basically described him as, to paraphrase, abused a lot of drugs, had a lot of mood lability, up and down, substances, and he was an awful father to Carly. He was verbally, emotionally, and even occasionally physically abusive to Carly and Ashley. I believe there's one incident she talks about in there where Carly had a black eye from her.
Oh, wait, he just kind of breezed through that, didn't he? But I'm going to put him on real speed so we can watch him breeze through the physical abuse of Carly. Because, no big whoop. That couldn't have affected her at all, right? Nothing to see here. Y'all. Wow.
Abusive to an awful father to up and down, substances, and he was an awful father to Carly. He was verbally, emotionally, and even occasionally physically abusive to Carly and Ashley. I believe there's one incident she talks about in there where Carly had a black eye from her, and it was assumed it was from Kevin. Kevin's parents had mentioned his temper and were real kind of awkward around her after the incident related to it. But it goes on to talk about Kevin wants pain medicines. Janet will get pain medicine and give it to him. It just goes on and on and on about that.
Just goes on and on and on about that. And you didn't think that was relevant, doctor? Am I hypersensitive to this because of the work that I've done with survivors? Or is he completely minimizing all of this? You can tell me if I'm being hypersensitive.
I want to talk a little bit about bipolar because it's my understanding that that's one of the diagnoses that Dr. Clark gave to Carly Gregg. Can you talk about whether or not you believe that Carly Gregg actually has either bipolar 1 or bipolar 2?
Okay. Yes, I can. Can I finish my thought about
yes,
the
I
dad,
apologize.
Kevin?
Yes,
There's
yes.
one more important thing, and I'll drop it. When I was talking to Carly during the evaluation about her biological father, Kevin Gregg, I mentioned benzodiazepines. I was talking about drug use. Did she have? Can we talk about that? And I mentioned benzodiazepines, and she said she knows what benzodiazepines are. And I said, okay. And she explained, I know what benzos are. My dad took them. My dad had this drug cabinet. It was this cabinet full of drugs. Like he had prescription pills from like everybody. Again, then I went on. I said, and I'm on page 12. I said,
page 12 of 85.
Talking about LSD and hallucinogens and mushrooms. I brought those up. She said, again, that's my dad. He took all of that, but I did not. He once bragged to me about taking 10 caps of dried mushrooms, which apparently is a lot because most people only take 2, I think, because that's what he once told me. And so it was emphasized from everybody, Ashley's journal, Carly, and then as I was even watching the body cam footage, I think it's of Deputy Zetterholm, some of the other family, Ashley's parents, I think Bob and Vicky were there talking to the office of the deputy and had mentioned Kevin and started talking about some of his drug use. I think he mentioned marijuana in the video. And so it seemed.
Holy. Is it not possible, doctor, that Kevin Gregg, the biodad of Carly, who bragged to her, by the way, about eating 10 mushroom caps, because apparently that's a lot. Most people only take 2, he told Carly. Is it impossible that he might have been bipolar and a drug addict? Because I'm not going to generalize here, but I'm going to say sometimes people with mental health issues or severe trauma try to mask that pain or escape from that reality by taking drugs. So what you're saying is all this stuff that you read in Ashley's diary or journal, all his tweets, all that everybody said to you about his drug use led you to believe No way Carly's bipolar because he's not really bipolar. He's just a drug addict. Okay.
By all accounts, going back as far as 2012, with his tweets saying this stuff, family describing him as this, and Ashley even mentioned that he would get Janet to give him pills. To me, it made the diagnosis very skeptical of Mr. Gregg to have bipolar disorder. The very limited and sparse records from Dr. Hardy made it very questionable. And then lastly, Dr. Hardy, who supposedly are the records that support this diagnosis, saw him 3 times, totaling 1 hour. And he ultimately prescribed, along with other things, Adderall, Ambien, and Klonopin, which are 3 highly addictive, highly abused neurostimulator and neurosedatives to a person that, by all accounts, everybody knows him as somebody who habitually uses drugs. And to me, prescribing 3 controlled substances to a known person who uses drugs is not what a responsible physician would do if they knew the truth about an individual's substance abuse. And lastly, if you have bipolar disorder, I would hesitate to put you on Adderall, because if anything's going to push you into maybe a manic state or a hypomanic state in bipolar 2, Adderall is a lot more likely to do it than an SSRI.
Okay. So you refuse to
So-
believe the medical
I
records
wanna
that say
talk-
that he was bipolar, but you believe whatever hearsay you're reading about him being prescribed Adderall, Ambien, and Klonopin, and there we go. There's the Ambien. Ambien had entered the chat. Carly said she had found some old sleeping pills and she was taking some old sleeping pills. Nobody ever really sort of tried to investigate what pills those were. And I said earlier today, I think, 'cause all these days were blending together, Ambien can cause severe hallucinations. I know this from firsthand experience. When I was in the hospital, one of the times that I gave birth, they gave me Ambien and I like was seeing things like it was horrible. I would never take it again. And a lot of you in the chat had said stuff about Ambien. And Carly even told him that her father had a huge medicine cabinet full of pills. How easy would it have been for her to take some Ambien? Who knows what else she took out of that medicine cabinet? Sir, you have single-handedly, in my opinion, acquitted Carly Gregg, or at least found her to be insane because of the severe. Now, after his testimony, her childhood to me is even more clear about the horrors that she went through. She murdered her mother, but there's a lot more to this story. I don't think she needs to go to adult prison. I think she needs to get the mental help that she needs. And I don't think she should be back on the street, but there's a lot more to this story. And thank you, sir, for filling it in for us today.
talk to you about the bipolar diagnosis, and then we'll come back to a SSRI, which nurse practitioner Lieber told us a little bit about this morning. So the bipolar, Dr. Clark testified that Carly had these desolate, I believe, I don't recall his exact word for using that, but very specific times of mania, kind of discrete, thank you. Some ups and downs, discrete periods of ups and downs. In the medical world, what does that mean?
So the DSM-5-TR has specific criteria for bipolar disorder. What makes that? We all have a mood. Let's say this is neutral. And there's a zone that is considered normal variation, where we can go up, we can have a good day, we can have a bad day. We can have a good day, we can have a bad day. People with depression Unipolar, that's one pole. Bipolar means there's two poles. They're opposite ends. Unipolar depression, they have the downs, and it goes below that normal area, way down here, where they start to have depressed mood, loss of interest. We call it anhedonia. They don't enjoy the things they used to enjoy.
All right,
Maybe feeling
long
some
crime. You got to
guilt,
step up
hopeless-
your glitch game, my friends.
worthlessness, concentration difficulties, appetite issues, psychomotor slowing, which is like a sloth. Like they don't want to get out of bed. They don't go shower. They don't bathe. They don't brush their teeth. They're so depressed. They don't cut their toenails. I could tell you some stories. Or
I could tell you some
they go the other
stories
end.
about
They're
people who don't cut their
manic.
toenails. Sir, you're not here to tell stories about other people who, in your opinion, are more mentally ill than Carly Gregg. Wow.
And they have too much energy. They are restless. They have pressured thoughts. Their thoughts are racing. They may start one task, but they can't finish it. They may be very easily distractible. Little noises, some things will distract them. They may have a grandiose view of themselves.
Kind of like
They may
you.
have flight of ideas, so their ideas are
I said
bouncing
it.
all around. It's really hard for them to go A, B, C, D, E. There can be activity increase where they don't want to sit still. They're restless. They're moving around. There can be sleep disturbances, and there can be very talkative, pressured speech. And so those are the differences. You have the unipolar depression, you're down here, or in bipolar, you not only have the depressive periods, but you have the manic periods. In bipolar 1, you have mania. It's the most severe form. It can be so severe that you even develop psychotic symptoms. So you're so manic, pressured speech, racing thoughts, restlessness, not sleeping. And interestingly, these patients who don't sleep, they feel great. They may have only gotten 1 or 2 hours of sleep last night, but they feel really good. They're not tired after that. And so you oscillate between these two periods. For bipolar 1, mania, really high, it's 7 days of a persistently elevated mood, all day, every day, to the point that it interferes with you socially, occupationally, or interpersonally. It is obvious to people around you, and it is causing significant troubles for you, one way or another. But you feel great. You're not sleeping, racing thoughts, pressured speech. That's 7 days for bipolar 1. Then you go down, you will oscillate. Eventually, you'll come down, and you may be depressed for 2 weeks or 2 months. It doesn't know.
The
And then you'll come
glitches
back
are
at some point. You'll have another manic episode.
amazing.
You'll go up and down, up and down. That's bipolar 1. Bipolar 2 is called hypomania. It's a little less than mania. I've seen patients and treated patients who have this, and they can live pretty functional lives. I can remember specific patients that they had more energy, a little bit more talkative than usual, wasn't sleeping as much. They'd had periods of depression, and they qualify for bipolar 2, but they were functional individuals. They were not, it wasn't to the point where they're psychotic, usually, from my experience, at least in hypomania. And you can live a pretty good life, and especially if you're put on medications, can help. Typically a mood stabilizer.
So Dr. Clark diagnosed Carly as being bipolar 2. Do you agree with that diagnosis based off your evaluation and review of all of her medical records?
No, I do not.
And why is that?
Well, politely and respectfully to Dr. Clark, providers can review different things, and we can draw different conclusions. Looking at our reports, my sources are about 8 pages long. I stopped once I got to about 100 because I couldn't keep listing my sources that I reviewed. It was exhaustive. And when I looked at his report, it doesn't, at least that he wrote, I didn't see that he reviewed that much. And so I suspect that we came to different conclusions because we may have reviewed different material. My opinion is that, based on reading his report, that some of his opinion of diagnosing Carly with bipolar disorder was that he took Dr. Hardy's notes for face value. And when I read Dr. Hardy's records, importantly, he never said, Kevin has bipolar disorder, and I reviewed the records from his recent hospitalization, or he has bipolar disorder because he met these criteria. He essentially just says he has bipolar disorder, and he used to drink and maybe do a little bit of drugs, but doesn't do any of that now. And so I really, only having 3 visits for 1 hour with no collateral records, minimizing his substance abuse, and then prescribing him the controlled substances he did, I just wonder, did he have all the facts? And if Kevin doesn't legitimately have bipolar disorder, well, then Carly, it's a lot less likely that she would. And then I go back and I look at.
So you just disregarded another doctor's records. Okay.
Annette Bryant's records from 2015 to 2019 when she's young. There was no mention of manic episodes or hypomania. Then I look at LPC Kirk's records from January through March. There was no mention of hypomania or mania. Then I look at nurse practitioner Lieber's medical records, and there's no mention of hypomania. And then I looked at the UMMC records with the well child visit, and there was no mention. And so, given all of that, and given the fact that Carly acknowledged using marijuana, and there's discussion of when that started, text message conversations between her and I think Thad, he talks. It's not a text message. I think it's a really, really long Snapchat message. I mean, the Snapchat message was this long. It was pages and pages of a Snapchat. So he talks about, thank God she stopped using marijuana, all these substances. He mentions that around Christmas. So she would have been doing it at that time. So long story short, given all of that, I highly doubt and do not believe that Carly has bipolar disorder.
Oh, so
Walk me
you,
through,
so you think that she was telling the truth when she said she stopped taking drugs, but she tested positive for cannabinoids when she was brought into juvie after her arrest. So
the second diagnosis that Dr. Clark gave to Carly was based on her, it says, several-year history of auditory hallucinations occurring quite frequently. Dr. Pickett, I want to know, in your review of the records, was there anything to indicate before Carly was arrested on March the 19th, 2024, that there were any auditory hallucinations?
I believe in her journal, she did write one time about the voices, as I spoke to earlier, about hearing them ravenously, and thank goodness, physical confrontation was not realistic. So yes, she did mention it there. I was highly skeptical of that because it seems more theatrical and making light of something that, as I've seen patients who really suffer from this, they are haunted by it.
pot, meat kettle, bless your heart. Her journal entries just seem theatrical. Out hearing voices, I didn't really believe she did.
And making light of something that, as I've seen patients who really suffer from this, they are haunted by it. It is torturous to them, and they do not describe it as quite silly, and they do not make.
How old are those patients that you're treating in the state mental hospital, doctor? Have they been hearing these voices for something like 50 years to the point where they are completely driven insane and now they're in a straitjacket in your state hospital? Or are they 14 years old and making light of it because they don't understand? I need a vomit bucket.
Trivialize it.
Listen
Really
to that
suffer
again.
from this. They are haunted by it,
Patients
and
who
making
really
light of
suffer.
something that confrontation was not realistic. So yes, she did mention it there. I was highly skeptical of that because it seems more theatrical and making light of something that, as I've seen patients who really suffer from this, they are haunted by it. It is torturous to them, and they do not describe it as quite silly, and they do not trivialize it.
You're
Her
trivializing
present
it.
courtroom, and Dr. Gugliano testified earlier, right?
Yes.
And she said it was actually quite rare for someone, Carly had reported hearing these voices all the way back to 5 or 6 years old, and it was quite rare for a child that young to experience voices. Is that your opinion as well?
Yes, it is.
And what about the fact that she was claiming that she started hearing these voices every single day from a young 5 or 6 years old?
From my experience, talking with patients who have schizophrenia and have auditory hallucinations, they're not usually continuous all day, every day. They're usually here or there, occasionally they're command. At one point during my evaluation, I did not write this in my report, but it's somewhere in the audio, I'm sure. We're talking about the voices, and she was asked, I hope it's on the audio, it may have been during a break, but I do remember she said, I think Attorney Todd asked her, did you listen to that voice? And she said, no, it's a voice in your head. You don't listen to that. And I couldn't find it, but I remember it now. It was there. And that to me says, when I see people who have schizophrenia and they're disorganized and they hear these voices, you're more likely to do what they say if you recognize the voice. If it's like, yes, my dead grandmother, and you trust the voice and you've been hearing it for a long time, then you might actually listen to it. But interestingly, when we were talking during that, she said, it's a voice in your head. You don't listen to that. And I thought, that makes sense.
I want to take just a little step back to the bipolar. Dr. Pickett, we talked about that there were no periods of 7 days or more for bipolar 1 mania. And I believe the testimony is that for hypomania, you're looking at like a 4-day period. Was there anything that was provided to you, either through Carly's evaluation or prior medical history, that showed that she had had a 4-day period of hypomania?
Not that I could definitively find in anybody's medical records. And what she described to me more on the day of the evaluation was up and down throughout the day, and that it was highly susceptible or related to whatever was going on in her life at that time. It was highly related to her circumstances. At one point, I think when I'm asking her this, I'm kind of pushing her. I'm kind of probing, like, all right, now tell me more about that. And I can find it in my report if I can. But I asked her that, and she kind of gave me all the answers. At one point, she said, like, it could be this, could be hours, it could be days, it could be weeks, which sometimes people will do if they don't know the right answer. If I'm asking them, or they're not legitimately having them, they will give me all the answers as if they're hedging. And so I'm skeptical of that. But ultimately, I mean, it was a 4.5-hour interview. So, I mean, evaluation. So she's kind of said it different ways at different times. The main thing that I picked up from her was that it was up and down within one day, like a roller coaster, and highly susceptible to what was going on around her, which is not consistent with bipolar disorder.
And I think
Oh,
we heard
but is it
testimony from
consistent with mania? What the actual F? And he's on 1.5 speed, yeah, because I can't stand listening to him. And I also want to catch up with real time.
earlier that she had been diagnosed with more something akin to like situational responses, and that's why she was given a depression diagnosis.
Yeah. My understanding from reviewing their records is even Annette Bryant, the first therapist that saw her, mentioned anxiety and adjustment disorder. So she was acknowledged that she's anxious and she's having trouble adjusting to something, her life circumstances. And then I think LPC Kirk also said adjustment disorder with mixed anxiety and depressed mood. And then I think nurse practitioner Lieber said adjustment disorder, and she said single episode of a major depressive episode.
Indicating that this was not a manic or hypermanic situation.
No, if anything, it would have been the opposite. She would have been depressed and down on that spectrum, not up.
Dr. Clark also diagnosed Carly with a other specified feeding or eating disorder. I don't know that that would have much relevance in Sanity, but have you ever seen where an eating disorder calls someone to commit murder?
Wait,
No.
you don't think it would have any relevance with regard to insanity? Can eating disorder be a symptom of other mental illness? Are we here for your opinions? I am so disturbed. I don't think I've been this disturbed since Ashley Benefield. Thank you, Danielle. Thank you. In the Ashley Benefield trial, we watched the minimization and the re-victimization of domestic violence survivor victims. And here we are watching the re-victimization and the minimization of childhood mental health. Welcome to Mississippi.
Without diving into it too far, I mean, there were notes in the record. I don't know that that would have
Listen,
a other specified feeding or eating disorder. I don't know that that would have much relevance in Sanity, but have you ever seen where an eating disorder calls someone to commit murder?
No, I've not.
she thinks it's funny.
Without diving into it too far, I mean, there were notes in the records where Carly had either binged or restricted her eating at some point.
Yeah. I think even we talked about, I believe, that I know Ashley, certainly, Carly told me that Ashley had issues with food and would purge. I believe that I've heard that Carly may have at some point purged. I can't remember who told me that or whether that's true or not, but I think, like her mother, there were some issues with food and restriction of that. I didn't think particularly pertinent to Sanity. I didn't necessarily dive into that in depth. And my thoughts were, if she's taking a medicine and she's vomiting, if anything, it's going to be less medication in her system, not more.
Sir, I'm getting hangry right now and I just might kill you. So saying that an eating disorder might not, make somebody murder somebody is not really. I mean, I thought I'd heard it all. The chat is moving so quickly that there's so many good comments that I can't even pull up because y'all are on it.
Depending on when she vomits and when she takes the pill, but it's not going to be more medicine in her system. So I didn't put a whole lot of weight on it.
So you brought up medicine, Dr. Pickett. I want to talk about that now. And we mentioned the SSRIs earlier. It's been the testimony that Carly was, back in January, put on 25 milligrams of Zoloft. And that she didn't feel like it was doing anything, and then was up to 50 milligrams of Zoloft. Is that what you found to be true in the medical records you reviewed?
Yes.
And then we heard from nurse practitioner Olivia Lieber this morning that she told Carly, I want you to kind of taper off the Zoloft while also taking the Lexapro. Based off your evaluation with Carly and Dr. Clark's evaluation, is that what Carly did with the medication?
No, according to what she told me, no. I think I was told that she stopped the Zoloft cold turkey abruptly on the 12th, the same day she was prescribed the Lexapro, and she started the Lexapro.
Wait, why did he correct himself from saying cold turkey? Because that's what it is. Cold turkey. Why did he just correct himself? Listen.
and Dr. Clark's evaluation, is that what Carly did with the medication?
No, according to what she told me, no. I think I was told that she stopped the Zoloft cold turkey abruptly on the 12th, the same day she was prescribed the Lexapro, and she started the Lexapro, 5 milligrams.
And is Lexapro, we heard earlier that Zoloft is an SSRI. Can you tell us again what that SSRI stands for?
Selective serotonin reuptake inhibitor.
Is Lexapro also a SSRI?
Yes, it is.
And so that would affect serotonin levels of the brain.
Yes. That process takes time, though. Typically, you would expect 4 to 6 weeks before you see symptoms. According to UpToDate, which is a worldwide database, it is the doctor's Bible if there is one. It's backed by multi-million-dollar clinical trials, pharmaceutical trials. It is one of, I like it, and I depend on it a lot. It says 2 weeks. Maybe you might see something at 2
Oh,
weeks.
bless your heart, Becky.
And
Bless your heart. I'm
if I
not making
can-
fun of anybody's accent. So I'm going to say this a little bit louder for people in the back. I'm practicing my accents, my dialects, so that I don't have to hire a dialect coach because I'm also an actress. Okay. So if you're going to come in here to my house, Becky knew, and call me ignorant, we're going to give you a one-way pass to Block Island. Bye-bye. Everyone say goodbye to Becky. I'm done. I'm done with this, you guys. I'm done. You come into my house and you call me ignorant? Did you just tune in 5 seconds ago? I'm done. Bye-bye.
Can I get into Lexapro?
Yes, please. And I'm sorry, before you do that, Dr. Pickett, 2 weeks. Do you mean it would take 2 weeks for side effects to show up, or it takes 2 weeks for the medication to kind of get in your system?
So side effects can happen more quickly than the benefits. I tell patients that all the time. I'll say, look, I'll give you this SSRI, and you may have experienced some side effects before we get to the benefits, but you got to recognize that that's going to happen because serotonin is not just in your brain, it's also in your gut. So a lot of times there's GI symptoms, upset stomach, diarrhea. It's involved in sex, and so there's decreased libido, difficulty having an orgasm, things like that. I don't know how pertinent that is, but anyways, the side effects can come before. Typically, it's not drastic side effects that make you lose your mind or become psychotic, but it's headache, diarrhea, sexual side effects typically with SSRIs. As far as the Lexapro, so according to UpToDate, the typical dose for an adolescent between 12 and 17 years old is 10 milligrams. That's the starting dose. Maximum dose is 20 milligrams. She was started on 5 milligrams, which is half of the starting dose. And if she was prescribed it on the 12th and the offense happened on the 19th, that'd be 7 days. Depending on when she was taking her prescription would depend on if she gets 6 or 7 doses. Without getting too technical here, what's called pharmacokinetics, it gets into how, when you take a medicine, it doesn't just go in your stomach and 100% of it gets put into your body instantly. It takes time to kind of build up in your system. And so depending on what's called the half-life of a medication, which I looked it up for Lexapro, is 19 hours. It takes 5 half-lives of a medication to get up to about 99% in your bloodstream. So 19-hour half-life times 5 doses would be about 4 days. So it would have taken about 4 days for the 5 milligrams, which is half of the starting dose, to get up to 100% in her bloodstream at that. And then the bioavailability. So it's another thing of any drug you take, bioavailability. How much of it is available to your biological system? I looked it up for Lexapro, it's 80%. So even when you take this pill, it goes into your stomach, it gets absorbed through the GI tract, it goes through the liver through what's called first pass phenomenon, and your liver tries to say, what is this? And try to decontaminate it kind of thing if it's a toxin. So about 80% gets absorbed. So if she was on 5 milligrams, which is half the starting dose, it would have taken 4 days to reach a steady state.
If you had to look it up, what does that tell you?
I think she would have only had 6 or 7 doses in her system. And it was prescribed at 5 milligrams, but because of the bioavailability only being 80%, she probably would have been getting about 4 milligrams. Either way, even if we say it was the 5 milligrams, that's still a quarter of the maximum dose. And if somebody was going to be pushed into a drug-induced hypomania, and again, people in hypomania still can appreciate right and wrong from my experience, it would have been more likely to have happened if she had stayed on the Zoloft. If she had been on Zoloft plus Lexapro, there would have been more SSRI in her system. And if she was purging, there's even less. So it's a very low dose, a very short amount of time. I do not believe she has bipolar disorder. And so it really does not make sense to me that such a low dose pushed her into a state where she could not appreciate the nature, understand the nature, quality, and wrongfulness of her actions. And then when I got into the footage that I watched myself and the text messages, those affirmed my belief.
And I do want to talk about the footage and the text messages. I wanted to cover everything that Dr. Clark gave his testimony about first. I believe he stated that he could not relate Carly's use of Lexapro to have caused her to commit these crimes. Would you agree with Lexapro did not cause her to commit murder?
Yeah, I agree with that.
He stated that Carly was in active psychosis at the time of the crime. And I'm assuming that that meant some combination of these things. What's your opinion on whether she was in active psychosis?
I do not believe she was in psychosis at the time of the offense. Based on my review of the video, her actions, these text messages, and before how she was reported to have been before, and how I observed her to be based on video footage afterwards. Psychosis, in my experience, it does not just turn on and off. Mania, hypomania does not just turn on and off. If a patient comes to the state hospital and they're committed there and they're manic, which is worse than hypomania, it doesn't just turn off. And psychosis doesn't either. They will be delusional, disorganized in their thinking, and very illogical until we start them on a medication that can help. And maybe it helps. It doesn't always. Sometimes it doesn't, even though we try.
So now I want to talk about, he diagnosed Carly as having disassociation. And we heard from Dr. Clark kind of what his explanation of that is, but I want you to please educate me on kind of what disassociation means.
So disassociation, and I'm not the nation's leading expert on dissociation. I am a board certified psychiatrist and we get trained in it. I do not see it a whole lot in my practice. It is relatively rare from my understanding. I think the literature is relatively sparse on it. I think we're realizing that it's more common than we thought, and there's more growing literature on it, but it's still not a widely accepted common explanation for violence, especially it can be associated with violence. And I read one of the articles that Dr. Clark had mentioned, and in that report, it talks about that.
I think that's on page 50.
Thank you.
Oh, sorry, that's on the SSRI.
I'm not sure if that's the article.
All right, we're going into slow
It'll take
mode.
me a minute to find it.
We'll look back. I apologize. I think that one was about the SSRIs.
Yeah, that one's SSRIs and violence, if I can.
Your diagnosis regarding the possibility of disassociation starts on page 52 of your report.
Gotcha, thank you. While I was on the subject of the SSRIs and violence, some of the literature actually suggests that it's lower levels of serotonin that are commonly associated with aggressive behaviors. And they go into animal studies with monkeys and how it's the lower levels of serotonin that are more
Must be on
associated
real
with
time.
violence. And then as far as the dissociation, I believe the literature talks about, like, if you're in a dissociative state and you can't control yourself, you may accidentally hurt an unintended target. You're cleaning your gun and you have a dissociative spell and there's somebody in the house and you accidentally pull the trigger and it shoots them in the leg. Maybe. Unlikely, maybe. It's possible. But having a dissociative spell and then doing a lot of specific things, going and retrieving a gun or an item, an object from a specific location that requires memory, hand-eye coordination, going to get that, that's, in my opinion, inconsistent with a dissociative spell. Yes, if you're in a dissociative spell, you may accidentally, unintentionally hurt a random person.
Sarah, you're in. Sarah and Schwankenhara. I just sent you a wrench. Enjoy. And thank you.
But I do not believe there's a lot of literature out there that supports you have a dissociative spell and you go and hunt down a particular target. I just don't believe that.
I'm sorry, Dr. Pickett, I didn't mean to cut you off.
I wanted to continue on a little bit about the dissociation if I can. Or you
Yes,
can.
please.
So when I was considering the dissociative spell, one of the books that I was using to read and talk about is on page 53, The Principles and Practice of Forensic Psychiatry, 2nd edition. It says, quote, on page 643, it says, quote, malingered amnesia is also seen frequently in forensic settings, as well as being the arguably most common manifestation of malingering in specific clinical situations such as homicide. And the literature goes on to talk about how we as providers have an obligation to consider malingering when there's a huge secondary gain of having decreased culpability by being able to blame it on that. And so I took all of that into consideration. Continuing on, when I was considering the dissociative stuff, Carly never mentioned these spells to any of her providers over decades. You know, her trauma that she experienced. So the DSM talks about this, the DSM-5-TR talks about this. The chapters related to trauma, PTSD, stuff like that, and dissociative disorders are put right next to each other intentionally to show their relationship. In my understanding, at a basic level, there are some dissociative disorders that you dissociate uncontrollably, with no prompts, with no stimuli. Dissociative identity disorder, which used to be called multiple personality disorder. the dissociative fugue that Dr. Clark talked about, where these patients will just randomly and in a very general, unintentional way get up and travel somewhere. But it's random. It's disorganized. They don't know where they're going. They're not in control of their faculties. They just end up in Dallas, Texas, and who am I? Where am I? Where's my credit cards? That it's an unintentional thing. And so as I was looking through this, Carly never mentioned it to any of her previous providers. Ashley, who was very involved, never mentioned it. She did mention some zoning out, I believe, and Heath did call me, and we did not get out of this, but he did say she had some periods of kind of forgetting things, having to use a calendar to remember some things, which was unusual what he said. Also, voluntary intoxication. If she's smoking marijuana to, I don't know how often, at some point, I think she even may have drank Germex per like one of her colleagues that said that. I don't know if that's true or just hearsay, but if there were some substances that she may have been abusing, it's hard to say. Was that related to substances, which she acknowledges the marijuana, or was that a real dissociative spell?
And Dr. Pickett, I'm sorry to interrupt you. There was actually a point where Carly related either in her journal or to a provider that she had smoked marijuana on the 16th of March, and she had something come over her body that she had never felt before. Do you remember seeing that?
I don't recall seeing that. I may have missed it. I did want to say, I remember my thought is that none of the dissociative spells, because trauma and dissociative spells are so closely related, she saw Annette Bryant monthly for years, from 2015 to 2019, when she was really young. And that was closer to the proximate trauma, the abuse from her dad, the death of her sister prematurely. And so I would have expected, if she were legitimately having dissociative spells, I would have expected them to have been closer to the proximate trauma. Doesn't necessarily have to be, but typically I would have expected that. Also, dissociative spells I've never experienced one, but from the few people that I've talked to that say they have, they're not pleasant, and they're scary, and you're not in control of your body. I just find it very hard to believe that an adolescent who was experiencing these, that was so close to her mother, who was very involved in her life, would not have mentioned it. That's hard for me to believe.
Wow, doctor. And I use the term loosely here because he's really making me mad. Foxy Forward, great question. Is there a reason the defense hasn't really objected to any of this rambling testimony from this doctor? I can't wait to see the cross. There's so much fodder. The more he talks, the more he's revealing his biases. He just says that he doesn't even think an adolescent could even have a dissociative, what did he say? Experiencing a dissociative, I'm losing my train of thought because right, this can't be real life joy. Hold on. Listen.
Necessarily have to be, but
I've never had
typically,
one.
I would have expected that. Also, dissociative spells
Dissociative
I've
spells.
never experienced one, but from the few people that I've talked to that say they have,
The few.
they're
He's
not pleasant.
He's only talked to. He's only talked to a few that have had dissociative spells. In all the people that he's treated in the state hospital, the state mental hospital, where all the craziest of the crazies live, he's only talked to a few people that have had them. And those people that he's talked to, he doesn't even say they're patients, just people.
And they're scary, and you're not in control of your body. I just find it very hard to believe that an adolescent who was experiencing these, that was so close to her mother, who was very involved in her life, would not have mentioned it. That's hard for me to believe. And then lastly,
hard for me to believe.
The malingering and the secondary gain, just the convenience of, I don't remember anything from when I took the dogs out to when I woke up in the sewer. But, in block is what it's called, in block dissociative spells, where it's a big finite period. Those are rare. As Dr. Clark said, the patchy dissociation is more common. And so to say that you don't remember anything from these periods, given all of this, is just really hard for me to believe.
Really hard for him to believe. He's a
here yesterday when
psychiatrist. If you just were gifted a membership from Yuri's math teacher, who gifted 10 memberships, thank Yuri's math teacher. Yuri's math teacher is a very kind and generous benefactor of this channel. He's always there when I'm having a day, and it's a day. Thanks, Yuri's math teacher. Maureen Gunn, thank you so much for your super sticker. And Stace, thanks for your super sticker. Sarah in shock and horror, who has now joined the mod fam. Thanks for the 20. Says, whoa, this chat's the upside down today. Many dirty martinis tonight. I love you too. Welcome. Send me an email today at some point, please, so we can get you onboarded. Susan Agnello, thanks for the 20. Thanks for proving that there are still people like you who care for justice and what is right. Unfortunately, I've experienced firsthand how broken the medical system is. I'm so sorry. Susan, thank you for your super chat. Cat's Pajamas says the experts can agree and disagree in opinion. It happens all the time in disciplines, but for him to trash the other expert is lowbrow, in my opinion. Thanks for qualifying that it's your opinion. Appreciate you. Chantal, another Canadian in the chat. This guy keeps on talking about the DSM 5TR. Well, the DSM 5TR has a term called dual diagnosis, which is a mental health diagnosis with a substance abuse disorder. Thank you, Chantal. Lawyer's daughter says, not hypersensitive testimony seems scripted, in my opinion. David wants to know if killing lanternflies qualifies as killing aliens to save America. I think so. We are supposed to kill those ugly looking things, right? Thank you. Thank you. Thank you, a Bruni Saint, for tuning in from Australia, who likes how bad attitude cannot get away with their rudeness in this chat. Thank you for appreciating it. And thank you, Chantal, for just ordering your pink It Strains Credulity hoodie. Can you please make one that says, for the love of the traveling Mary, please? I'll try. It's like when I get, when I'm bored and I go on Canva and make new designs, I don't have time when I'm doing a live trial, but I will try. All right. Back to the good doctor.
Dr. Clark testified, right?
Yes, ma'am.
And I think he talked about that that it's more common, that it's patchy, and Ms. Todd kind of attempted to clear that up, and he was saying that still wouldn't change, even if she remembered certain things, that wouldn't change his diagnosis. But Carly had reported to him in his evaluation that she was having, and I don't think flashbacks is the right word, but that she was hearing gunshots in her dreams, that she was having, she told Dr. Giuliano that she was queasy thinking about the incident. Is that in line with somebody who does not remember an event happening?
If she were having patchy amnesia, I could say maybe. But if you're reporting in block amnesia from a period, I would find it very hard to believe that you have those symptoms related to an incident that you don't remember.
I want to ask this too. This may seem like a silly question. You've used the word malingering a couple times. For somebody that's not a psychiatrist or even in the medical field, is malingering just kind of faking?
In very basic terms, they're similar. It's deceptive. It's lying for a secondary gain. You have a reason. Maybe you have a reason to lie, and you do, or you exaggerate your symptoms for a secondary gain. That's what malingering is.
And in this case, you considered that Carly, now talking about these dissociative spells, is in fact her malingering because she has a secondary gain.
In my opinion, that's a very high probability, yes.
And Dr. Clark actually testified yesterday that there are times, quite frequently, that people that commit the crime of murder claim that they were in a dissociative state because they have huge secondary gains.
Yeah. According to some of the literature I quoted, yes, that's very common. It's one of the most common.
I want to talk a little bit more about this disassociation. We know from all the testimony of her providers and the medical records that there was no history of this noted in any of her records prior to March 19. Did Carly report to you that she had any additional spells of disassociation after March 19?
Yes, while we were talking, I cited in my report the time, I asked her, I said, have any of these spells, and I'm paraphrasing, have any of these spells where you do not remember things or dissociative spells, have any of those happened since the incident? And she said, yes, actually, I'm having one right now as we were doing the evaluation. And that was a 4.5-hour evaluation in which I did many tests that tested her intelligence and ability to complete tasks and recall and spatial awareness and language and all these things. And she said she was having one then. And she also said, well, back Tuesday in court, I had one. And Attorney Todd agreed with her and said, yes, I can see it on your face. And so when I asked Carly about these spells, she said they happened every time her mother yelled at her. But she did say that she seemed to remember those incidents, was my impression. And yet this one, she said she did not remember it. That's my understanding from talking with her. And so it was very inconsistent. And there's one thing I do think is important. I think we need to distinguish between zoning out and inattention, which happens to all of us, and dissociative spells. as I was saying earlier, there's some disorders that you legitimately have where you don't have control over and you dissociate. And what you do during that period, we can talk about and discuss. But there's disorders that it happens sporadically, and then there's kind of peritraumatic dissociative spells. And what Carly seemed to be describing to me were peritraumatic dissociative spells. When her mother would yell at her, she would dissociate because that triggered her. That's a trauma in her eyes. The DSM-5-TR gives examples of a prisoner of war who's being tortured, and their body cannot take it anymore. And so their brain essentially hits, for lack of a better word, the ejection button. And the brain says, I cannot take this anymore. I'm under so much stress. I'm out here. And it dissociates. Or another example that the DSM-5-TR gives is human sex trafficking, somebody who's being repeatedly raped over and over. Their bodies cannot take the trauma that they are experiencing anymore, and their brain hits the ejection button, which, to my knowledge, the brain does not do this half-heartedly. It leaves the body in a very vulnerable state, being dissociated. You are vulnerable to everything around you. If you cannot control your body, you're vulnerable to predators, attack, anything. The brain, it doesn't make sense that the brain would do this half-heartedly. Again, there are disorders where it happens sporadically and you cannot control them. Dissociative identity disorder, the dissociative fugue, the dissociative amnesia, but the peritraumatic.
But only if you're a prisoner of war or you've been repeatedly raped, apparently.
Dissociative spells, to my understanding,
How do you know she wasn't?
you are being traumatized, and therefore your brain hits the ejection button. But you do not dissociate and then go traumatize other people, is my understanding. And that's from my training, my research things that I've read about this, preparing, and the articles, and my training and knowledge and experience and seeing patients.
Dr. Pickett, I want to put you to page 31 of your report quickly when you were talking about your conversation with Carly regarding her dissociative spells. Was there a time that she actually said, like, she called it derealization?
I believe so, yes.
And what is, I mean, is that a medical term?
Yes, it is.
In treating any of your other patients, have they ever used the term, I was derealized?
No.
Do they call it themselves before getting a diagnosis, I've disassociated?
No.
And prior to your evaluation with Carly, she actually had not received any diagnoses of disassociation.
Correct.
But in fact, the defense told you that was going to be their argument for insanity, right?
Yes.
Tell me about,
one of it.
Tell me about that, because that was on the day of your evaluation before, I think 5 or 6 days before we got their expert report.
I'm traumatized.
Can you clarify exactly which part so I make sure I'm following you?
Yeah, so in your interview, you asked about making sure that you kind of covered all the right things. You kind of wanted to know what is it, why is it that you're claiming Carly was insane?
Yeah, I do remember that. At one point, and it is on the audio, you can hear, I think Carly may have stepped away just to go to the bathroom, and I asked Attorney Todd, I said, hey, I want to make sure I cover the right stuff. Can you tell me, can you clarify exactly what, as far as insanity? And she said that, I think she said the medications worsened an underlying unrecognized diagnosis. And I said, okay, all right, I'm just making sure I'm following. And that was, I think Dr. Clark had done his evaluation the day before.
And do you recall what Carly said as she walked back into the room for the evaluation?
I cannot remember.
Would it refresh your memory? She said something about, like, what mental condition do I have?
I'd have to listen to the audio. I can't remember.
But at that point, she had not been diagnosed by any physician or psychiatrist with disassociation.
Not that I was able to find in reviewing the medical records, psychiatric records.
When you asked Carly to describe the events of March the 19th, how did she describe her mom's demeanor when she found out about the vape pens and the burner phones?
I think, if my memory serves me correctly, she described her as frustrated and they didn't talk on the ride home. She was upset and her mom searched her backpack and they didn't talk on the ride home. And
so Carly acknowledged that mom was very upset about finding out these things. So you asked Carly to describe for you kind of what she could remember from that day, March the 19th, 2024. If you would walk us through what she told you.
I remember her telling me that she hadn't slept well the night before, went to school that morning, was irritable, cussed out a friend, went through the rest of her day. I believe she was doing okay. And then she went to, I remember her explaining that she remembered going from her room, down the hall, up the stairs, and to her mother's room. And then when she got there.
And to be clear, I'm sorry to interrupt you, she's talking about after school still,
After school, yes, because her mother was a teacher. And after that, it seemed like, according to what I've gathered, that her mother was upset and searched her backpack. They drove home. They did not talk, and they were upset.
And then did Carly tell you she remembers letting the dogs outside?
Yep. She told me that she remembers letting the dogs out, and then she doesn't remember anything from then until when she awoke in the sewer.
And when you asked her about the sewer, do you recall her saying, "I knew I did something wrong because I wouldn't have been running away"?
I remember her saying something along the lines of that she said that she did something wrong to the police officer because it seemed like the logical thing to do, was kind of how she described it.
And then she said something to the effect of, when he asked her if you're the girl that shot, she said, "Yeah." And that's what she's talking about because it was the logical thing to do.
I believe so, yes.
In your audio recording, you're talking to her about that time, about after she came out of the sewer and when we know, Tony Shack, we watched the video of that yesterday, takes her into custody. And she said something to the effect of, "I thought Heath was dead." Do you remember her saying that?
I remember watching the deputy's audio, his video camera, and she asked about Heath. And then the officer, the deputy, mentioned the mother. But then yesterday in his testimony, he said it wasn't the mother, it was just Heath. And that's that.
What, if anything, do you remember about Carly describing for you seeing Bennett and his mom on the scene?
Yes, I believe in my audio it talks about how she was worried. She remember seeing Bennett and Bennett's mother and was worried that they would hate her.
And did she tell you why she thought they would hate her at that moment?
She didn't elaborate that. I had my presumptions, but I did not force her to say why.
Because based upon what she told you, she only remembered letting the dogs out and coming to in the sewer, right?
Right.
So they'd be mad at her about something to do with letting the dogs out?
I don't know.
Dr. Pickett, I want to talk to you a little more about your opinion regarding the McNaughton standard in this case, right? So we, unfortunately, people had to see these videos where Carly goes into a room, we hear 3 gunshots, and then she comes out. I want you to walk me through the reasons that you believe that she had specific intent to commit these crimes and that she knew right from wrong at the time.
Okay. Well, backing up a little bit, just knowing the context from what I was told or from what I gathered from reviewing discovery was that Bennett and a friend were really concerned about her substance abuse. That's what I saw in text messages with discovery, reading that. So they approached her mom, and Carly went there after school. They rode home, but did not talk. This is per Carly. She was frustrated. Ashley was frustrated, per Carly. And then when they get home, I start in the garage video footage. I see Carly, what looks like she kind of jerks the door open, looks frustrated. Then they go inside and they're at the kitchen. They put everything down and they make eye contact. And Carly looks her in the eyes and kind of rolls her neck like this, which is kind of, to me, seems like a tense situation. They're not talking. And then Ashley goes straight to Carly's side of the house, presumably Carly's room. So knowing the context, seeing that, it seems like a tense situation where Ashley being as involved, and her, according to Carly, one of her greatest fears was that Carly would one day turn into her dad, who constantly used substances
No,
and had a
who
lot of
was
mood lability.
bipolar.
And
that's what the mother said. She was worried that Carly would inherit his bipolar disorder, not his drug addiction.
her greatest fears was that Carly would one day turn into her dad, who constantly used substances and had a lot of mood lability. And so Mom, Ashley, seems to go straight to Carly's room or Carly's side of the house. I don't know that it was her room. And Carly can be seen on the Wise video footage kind of moving back and forth, touching her face, touching her hair. Seems a little frustrated, anxious. And so I go through all that video, I watch it, and then after Carly walks back in the house. So at one point you see in the video, Carly takes the dogs out. Ashley comes back. She kind of looks through the window. At one point she has what looks like a little black cylinder shaped small object in her hand. I don't know what it is. I presume, based on the context and knowing what about it, that it is
Objection.
maybe a vape pen. I don't know for sure. And so then Ashley goes back towards, I think, her room and then Carly's room or area, side of the house. Carly comes in the house. And at this time, Ashley is on Carly's side of the house. Carly kind of comes up to the entryway. She's leaning forward. She's got both of her hands, not in fists. I don't want to say fists, but down by her side. She's leaning forward. She pauses as if she's thinking something, and then slowly turns towards her room. And then she quickly, briskly walks directly across the screen from Carly's side of the house to Ashley's side of the house. So given the context and seeing her walk so briskly, seemingly purposefully, directly to where the object is that could kill her mother or kill somebody, to me shows an intact memory. It shows an intact motor function. It shows coordination, and it suggests a specific intent. She did not walk to the kitchen and grab a banana. She did not walk in a disorganized state of mind. She did not walk to the living room and grab a remote control in a confused, dissociative spell.
What about singing to the dogs? What about that? What about singing to the dogs and texting from her mom's phone to the stepdad? Honey, are you almost home? What about that?
She walked directly to where the sole object that could kill her mother was, and she retrieved it. To me, that says that this person shows a very specific intent on what they plan to do. And that suggests that she understands the nature and the quality of what she's about to do. That's why she went specifically to where the gun was, not to the kitchen or to anywhere else. Continuing on, and it gets even more convincing to me as I watch the video. At 16, 14, 15 on that video, she peeks around the corner and she's hiding something, concealing something behind her back. To me, this shows a spatial awareness. So Ashley could have moved. Ashley could have moved to the kitchen. You've got to look around and see, because if that person has moved, your intended target has moved, you don't want to just walk straight across to your room with this object. They could intervene. They could see you. They could stop you. Instead, in a very methodical manner, she peeks around the corner with the object behind her back. To me, that shows spatial awareness. And these are high functioning executive skills that your brain has to, different areas, the frontal lobe, the parietal lobe, the occipital lobe, all of these different areas of the brain have to do this for you to do such intricate things.
Okay, but if she went and got a banana, then you would believe that she was psychotic. That's what he's saying. If she only went and got a banana, then completely would believe she was in a psychotic break.
This was done, in my opinion, as a forensic psychiatrist reviewing this video, to locate the intended victim, to ensure Ashley had not moved so that she could not intervene, and so that she could, and she did it in a very, just her head around the corner, hiding the object. That suggests, that's almost predatory, in my opinion. That is looking, that is intentional, that's not accidental, that's not dissociative, that's not psychotic. Then after she does that, she clears the kitchen, she sidesteps with the object still behind her back, and this object is still directly where the wise camera cannot see it. And it's an awkward sidestep. And I wouldn't expect somebody to do that unless they were intentionally trying to conceal or avoid detection from the surveillance camera. And that to me suggests strongly that she appreciated the nature, quality, and wrongfulness of what she was doing at that time. Then she goes into her bed, her side of the house, I presume her room, and we hear the gunshots. And then we hear some screams. And as I know from reviewing the autopsy pictures, there were at least 2 shots in Ashley's head. That takes that marksmanship of landing those shots on a relatively small target that if you shoot it once, I presume with gravity and whatnot, it might move. So to stay on it and shoot it again shows a high level of brain functioning. Motor centers, the cerebellum with coordination, the occipital lobe with the visual centers. This is a high level of functioning. So then,
I can't with this guy. Starflower, thank you so much. Says, this poor child, her father uses drugs to escape mental illness. The doctor evaluated her on medication. He needs help more than Carly, and I'm sure she needs therapy, medicine, and attachment to someone. Yeah. Just for those of you who are new here or new to the channel or new to the trial, it's not a matter of whether or not she shot her mother. She did. We know that. She murdered her mother. The question is, where does she go from here? Does she go into prison and we throw away the key because we think she can't be really rehabilitated for, 2 life sentences because she's being tried as an adult? Or does she go to get some mental help in a mental hospital? I don't think anybody here is saying that she should get out of jail and go roam free on the streets.
continuing on, then Carly comes, a little time passes, Carly comes into the dining area and she gets Ashley's phone. I believe it's Ashley's phone from what I've been told. And there's a passcode on it and she unlocks it, which that to me shows that she has some degree of intact memory, hand-eye coordination, and that this was calculated and specific. You have to type in a specific code to unlock the phone. It's not a disorganized, unintentional, random numbers. It's a specific code. And then she texts Heath, her stepfather, which is a specific target. It's not a disorganized, confused, psychotic, random numbers. It's Heath's phone that she dials. And then she texts him and says, "You almost home, comma, honey, question mark." In my report, I used some very strong language just to describe this one aspect. I used the word diabolical. And I stand by that word.
Diabolical.
I do not believe Carly is a diabolical person. I do not believe she's an evil person. I believe all of us have the potential for good and evil, and in us, it's human nature. As a psychiatrist, I study human nature, anger, lust, greed. These are things I study. And so we all have the potential to do that. But when Carly on that day went and unlocked the phone, texted a specific target, her stepfather, who she told me was more of a father figure to her than Kevin was, and said, "When are you almost home, honey?" Using that honey is an enduring term. I might use it for my family, a loved one. I wouldn't use it for a stranger. When she did that to me, that was very specific and diabolical. And that to me is not consistent with a dissociative spell. That is not consistent with psychosis.
Diabolical. She's diabolical. Yeah, she wrote the word diabolical down. He did.
That is not consistent with mania, and it's definitely not consistent with hypomania. To me, that was deceitful. And so the fact that she did it from Ashley's phone instead of her own phone, I asked myself, why would she do that? If I don't know the norms of their family, I don't know if it's normal for Carly to text Heath and say, hey, when are you going to be home?
I feel like he's giving a
That
sermon.
might have, if that's not normal, that might have been a warning or like something wrong. Why are you texting me? You know, why are you texting me when I'm going to be home? So to me, the fact that she did it from Ashley's phone, posing as her mother who's in the other room dead or dying, really suggests a specific intent, that she understood the nature, the quality of what she was doing, and I would suggest even the wrongfulness by she didn't use her own phone because she didn't want to raise alarm, in my opinion. Then at one point in that video, right about that same time, she lets out this like hymn. Look, the camera's right there. She knows the camera's there. She sidestepped earlier with the gun behind her back, which tells me she is aware that that camera is there. When she came back into the dining room, she had something behind her back that she laid on the stool. She kept it on the stool behind her. At one point, the dog walks behind her. She kind of looks behind to make sure there's not going to fall off in front of the camera. So all of that suggests to me that she was very aware of the camera. And I think that she was trying to, for lack of better words, play cool and just, she's interested in music. She plays the guitar. She plays the mandolin. She built a mandolin with her grandfather. She's a musical person. And I think she naturally let out this hymn as almost a play cool. I know the camera's on me, but it was not disorganized. It was not in some weird, disorganized fashion. It was not weird language. It was not a demonic voice. It was not, it was a short hymn. And I think she was trying to play cool. And I think it, to me, that was callous. And so I also think it was related to some nervous adrenaline. Like she's very, and she lets out this hymn.
But it couldn't be
Continuing
dissociative.
on, as I watched the video,
It couldn't be dissociative, right?
at one point she goes back after that. She goes back to her room or her side of the house. I don't know there's room. And the dogs are in the dining room and they make some noise. And she yells out, Heath, Heath, Heath. That was a very specific name. That was not a disorganized name. It was not a random stranger. It was not in some strange voice. It was very controlled, not like a pressured mania, disorganized or psychotic and disorganized. To me, that shows that she knew exactly who was going to come home. It was not disorganized. It was not illogical. It was logical. And I believe after that, she recognized the dogs keep making noise. I've got to go. I got to get rid of them because I don't know if Heath's coming home. Heath, is that you? Because she is in the room with her dead mother. That to me suggests that she strongly understood the nature and the quality of what she was doing at that time. That's why she called out his name. That's why she let the dogs out, because they were making noise. She doesn't know, is that the dogs making that noise or is that Heath coming in? So she lets the dogs out. And this conveniently puts her right beside the camera footage that then turns off and is later found hidden behind some water bottles in the refrigerator. I presume it's hidden. There were water bottles and it was behind it in the corner. To me, that strongly suggests somebody who's trying to hide evidence and avoid detection because they appreciated the wrongfulness of what they were doing. A psychotic person who's disorganized and doesn't know who they are or what just happened or where they're at, I do not believe would put the camera, take it down and put it in the refrigerator behind water bottles. This also, when she came back out, gives her a second opportunity in front of the camera to play cool. And she said to the dog, she kind of whistles and she says to the dogs, "It's okay. It's okay."
Wait, why play
And
cool in front
I
of the
have dogs
camera? Why not
myself, and
why not just ditch the camera before you do the shooting? If you know the camera's there, why not smash it to bits? Right? If what you were doing was intentional and you knew it was wrong, why wouldn't you get rid of the camera before you go shoot and kill your mother? If you're so diabolical.
thought, why would I tell my dogs it's okay unless it wasn't okay? Unless even seemingly the dogs might have appreciated that it wasn't okay. I'm not a dog psychiatrist, but some
No,
things
you're
seem to
not.
transcend species. And at this point, I saw dogs were down, their ears were down, they were running around, and she lets them out, and she even comforts them and says, "It's okay, it's okay," and whistles. And to me, that was kind of self-incriminating. It's a small thing, but a guilty conscience. If you're aware of what you've done, you might try and comfort the dogs and say, "It's okay, it's okay." Then, so that's from the video footage. Then I get into the text messages. Do you want me to continue on?
Yes, please.
So with SK Riley, she texts and says,
When are they going to
Carly
take a
says,
break?
"I need help," which tells me she understood the situation to some degree. Then she capitalizes it, emphasizing, "I need help," which tells me she's serious. She knows, she understands the nature and the quality of what just happened.
Absolutely.
Then she replies, "I can't tell you."
Absolutely. I think Ethan Crumbly belongs in a mental hospital. 100%. I don't think this is gender bias at all. Not for me, it's not. Ethan Crumbly had some really deep-seated mental issues. And remember that his mother and father are both in jail because he got access to a loaded weapon. Why can we use that as a shield and a sword? If Ashley and Heath didn't have a loaded .357 Magnum in plain sight and underneath a little shelf underneath their bed, Ashley might still be alive today. Why are we, how can we, to me, it's not gender bias at all. I 100% think Crumbly was, and still is, incredibly disturbed.
Which again tells me she understood the wrongfulness, because why couldn't she tell one of her best friends unless she couldn't tell her because she understood that it was wrong? And then she said, I'm not going to KMS. That stands for kill myself or anything. She even appreciated that her friend was concerned that she was going to harm herself. And she recognized that and was able to tell her friend and comfort her friend, I'm not going to kill myself. That showed me a awareness of her situation and even an appreciation of her friend's concern. Continuing on, she referenced, "I'm glad you met Raymond." So I found out through discovery and things and talking, and that Raymond, I believe, is a boyfriend of Sarah's or a friend or a lover or something.
Lover?
And she references this Raymond.
Lover?
And
At
SK
14?
Riley even thanked her for that. To me, if you're in a dissociative spell where you are so out of your mind and so psychotic that you don't understand the nature, quality of what you're doing, I find it very hard to believe that you would be able to recall a relationship that your friend has with somebody and reference that to them.
Your Honor, may we approach for just a second?
Please approach. Please, for the love of everything that is holy, please put this. Yeah, it did turn into a filibuster, Sarah. There's a filibuster happening.
Dr. Pickett, other than the Sarah Kate Rayleigh text messages, were there other messages that indicated to you, because the jury has heard some of those messages from Sarah Catherine Rayleigh and Bennett Germany, were there other messages or other things that you relied upon in determining that she did in fact know right from wrong on that day?
There's other text messages. There's one with Bennett and there's one with Thad. And then there's also some things from Brooks' statement that I read that were, but see, that's her statement, but these are actually Carly's words at the time. And so I think they're important because to me, they speak volumes about her understanding of the nature and the quality at the time. So I know those witnesses have spoken, but the text messages do speak to her understanding of the nature and the quality of what was going on.
Oh my
And
gosh.
included in some of
Adam Lally's resignation. How funny is it that your screen name came true? Except he didn't really resign. He kind of got replaced by a mob lawyer, but that's fantastic. You were on the cutting edge of knowing.
those messages, I think Sarah Catherine read out something to the effect of, last message was, "I'll tell you tomorrow if I see you." Did you consider that one?
Yeah. That to me suggested that she had a more than an understanding, even an appreciation that there might be some consequences coming my way for this, and I may not see you tomorrow.
And similarly, when she told Thad, excuse my language, I've fucked up.
Yep.
I mean, that would indicate that she knew that she had done something wrong.
In my opinion, yes.
She was able to tell Bennett what her address was and where she was. Is that your understanding of the text messages between them as well?
Yes, which I did not believe that would be consistent with a dissociative spell or somebody who was disorganized or psychotic, or even having a dissociative amnesia, that they would be able to recall their address and state it in a text message, which again requires the language centers of the brain, the visual centers, the hand-eye coordination, and the recall memory to do that.
And then I believe that you referenced in your report some of the messages with Thad, and the jury's had the benefit of hearing him testify, but he actually offered to call 911, and at some point she tells him, "No, you can't do that."
Yeah. To me, that would strongly suggest that she understood the nature and quality of what happened, and that she understood the wrongfulness, because if he were to call 911 and paramedics show up, then she would be seen with a dead body there. And
I want to talk about Brooks' statement just a little bit regarding Carly's shooting and attempting to kill Heath. What particularly about Brooks' statement led you to believe that Carly knew right from wrong and had specific intent for that crime?
yes, I will. I do want to clarify that the video footage. And
I just want to add something. I just want to add something to my testimony. I just want to keep on rambling and giving my colloquy and my dissertation and my monologue. Let me wait. Can I go back to my monologue and add a line? Because I want to say something else.
Off of my observations of all this. When we get into Brooks' statements, that is my opinion based on somebody else's statement. So it has to be taken with a grain of salt there. But if what Brooks says is true, suppose reportedly, per her statement, Carly asked her, "Are you squeamish around dead bodies?" Which certainly, if that is true, suggests that Carly understood at the time the nature and the quality of what she had done, and even that somebody else may have different feelings about it, which shows a higher level of appreciation that I can not only know my feelings, but I can understand how you might feel. And then, do you want me to continue on as far as
Yes,
Brooks?
please.
Reportedly, if what Brooks says is true,
Tom, you're
Carly,
at this point
sure.
you're just kind of spamming the chat, and I kind of let it go like 10 times already. We get it. You've said the same thing 400 times. We know where you stand on this. You think Carly should be locked up in an adult prison, and we should throw the key away, and she should just stay there until she dies. We get it. We hear what you're saying. Okay. I'm assuming that you want some attention because you keep saying the same thing over and over and over again. We get it.
Brooke not to worry about the cameras, that they'd already been taken care of. And so that would suggest to me that Carly understood the wrongfulness of what she had done, and therefore was trying to avoid detection.
And then she also made some comment to Brooke about I put 3 in my mom, and I got 3 more waiting for my stepdad when he gets home.
If that is true, that would strongly suggest that Carly, at the time of the offense, understood the nature, quality, and wrongfulness of what she had done.
I want to back up just a little bit to Dr. Clark's diagnoses of Carly. I diagnosed her as being bipolar, schizophrenic tendencies, dissociation, and eating disorder. So we've gone through, Dr. Pickett, how you, other than the eating disorder, you do not agree with his diagnoses. But for argument's sake, let's say that all of his diagnoses are proper, that Carly did suffer from bipolar, some form or symptoms of a schizophrenic-like situation and possibly a dissociation. That does not mean that she is insane, correct?
Correct. As I was explaining earlier, having a threshold diagnosis is just your ticket to even consider insanity. Without a diagnosis, you cannot even consider the other prongs of the standard. You have to have that just to even be considered. That in and of itself does not equal insanity, in my opinion, from what I know based on the state standard. I have, from experience, I have patients who have schizophrenia and bipolar disorder, and they know when we talk, hey, all right, you're going home soon, you know you don't need to do this or that, you take your medicine, they know right from wrong. Just because they have the diagnosis does not mean they're insane. I do have my diagnoses.
Yes, I was about to ask you if you could tell ladies and gentlemen kind of what you diagnosed Carly with and then kind of your overall conclusion regarding those diagnoses and how that might have affected her on that day.
Yes. So I, based on record review, she was diagnosed with adjustment disorder with mixed anxiety and depressed mood and a single major depressive episode. I agree with those based on the records and what I've reviewed at the time. I think those were reasonable. I also, in addition, felt like she met criteria for generalized anxiety disorder, which includes according to the DSM-5-TR, excessive anxiety or worry occurring more days than not for at least 6 months. The individual finds it difficult to control, and they have at least 3 of the following symptoms: restlessness or feeling keyed up or on edge. So they're antsy, they're on edge, they feel restless, being easily fatigued. I did not think that would apply. Difficulty concentrating or mind going blank. I feel like that could apply to her zoning out. Her irritability, it says, muscle tension and sleep disturbances. And then it says, these cannot be better attributed to a substance or another mental disorder. So for generalized anxiety disorder, she seemed on edge. That's one of the reasons she explained to me that she smoked marijuana was if she was going to have she couldn't sleep at night, or if she was going to have a bad day that day, she didn't want to have a nervous breakdown at school, she might smoke marijuana to help with her anxiety and nervousness.
The
mind going blank.
Dude, did you even investigate?
That
It wasn't marijuana. She wasn't smoking marijuana. It was a THC pen. We don't know what the hell was in it because it was bootleg and she got it from a friend. So there goes prong 1 of your diagnosis.
Explain her zoning out. In psychiatry, we kind of try to find diagnoses that explain most of the symptoms, and the generalized anxiety disorder is pervasive. I mean, it goes back to when she was a child talking with Annette Bryant about adjustment and anxiety and the issues she was having with her dad. So on edge, hence she used marijuana, mind going blank, the zoning out spells, irritability, and the sleep disturbances. All of those are included in generalized anxiety disorder. So I felt like, based on the DSM-5-TR, she met criteria for that, and it would explain a lot of her symptoms. Also, cluster B traits. So people are typically hesitant to diagnose a personality disorder in an adolescent because the brain is still developing. There's hormones involved, and it can be stigmatizing, and it takes time to really get to know that person. They have to have a pervasive pattern. I looked through years and years and years of records, decade of record, back to 2011.
Decades.
2011 to
She's 14.
2024. So yeah, over a decade. I felt like that gave me the ability to look at things over a long period of time. Again, I'm not going to diagnose her with a personality disorder, but she does show some emerging cluster B traits. In personality disorders, which are common, there's different clusters that get grouped together based on different things. She shows some what's called cluster B, which includes borderline personality, antisocial personality, narcissistic personality, and histrionic personality. I think her narcissistic personality shows, especially when she talks to her therapist about, I get tired of these students who they just, they sleep through this good teaching, and it's in a derogatory tone. When she talked about this voice that's condescending towards other people, it did not come across to me as a legitimate auditory hallucination, but more so maybe some narcissistic traits and condescension towards
She's
others.
a narcissist.
In her journal, she talks about, well,
Wait,
when you
did he
read this
really?
one day,
I have to go back
maybe
because I zoned out. I was having a dissociative state when he was talking, when they went over his CV or his pedigree, but did he just finish his residency in 2023?
Make the nuclear bomb. Not that I plan to, but she saw herself as this child genius that she described in her.
He's calling her a narcissist.
School records, which I agree with. She might be. You need intellectual testing to formally prove that, but her grades certainly suggest that she's very talented and gifted. But the cluster B traits, the most important one is the borderline. So borderline personality and bipolar disorder commonly get confused. Commonly.
This is a cluster.
Both of them have the mood lability, the ups, the downs, the ups, the downs. Both of them have that, but they have a different cadence. And bipolar disorder, like I said earlier, bipolar 1, 7 days, bipolar 2, 4 days, and then depressed for 2 weeks. Importantly, in borderline personality, your mood lability can be minute to minute, hour to hour, and it's often related to the circumstances around you. And it's often seen in people who've, some of these personality disorders are often seen in people who have experienced childhood trauma. Borderline personality disorder also traits shows cutting or self-harm. Relationships are also usually very intense with your friends. I love them. I can't live without them. And in her journal.
Wait, is this the first time that he's addressing cutting? Hold on.
Around you. And it's often seen in people who've, some of these personality disorders are often seen in people who have experienced childhood trauma.
Like her?
Borderline personality disorder also traits shows cutting or self-harm.
She's doing that.
Relationships are also usually very intense with your friends. I love them. I can't live without them. And in her journal, she does talk about, couldn't go a day without them. Some of her friends. I'm so lucky to have them. There's also some devaluation. There's idolization and devaluation in your relationship. So one person you idolize, one person you can't stand. As a clinician, a provider, I often see this where they'll say, Dr. Pickett, you're the best doctor that I've ever seen. You're the only doctor who ever listens to me. But then they'll go see another doctor, or they'll come see me and I'll say, Dr. Pickett, you're the worst doctor. I hate you. I can't stand you. But this other doctor, he's the only doctor. So there's idolization. And with Carly, I believe there may have been some idolization of Ashley and devaluation of Kevin. Then borderline personality also deals with abandonment. Now, when I asked Carly about abandonment, whether that was an issue, she did not make it a big deal. But the way she describes her friendships, I would be skeptical if one of her friends were to abandon her, how she would take that.
What about the fact that her father abandoned their family when he was beating the bejesus out of her mom and they had to escape in the middle of the night when she was 4? What about the fact that her baby sister died tragically of a genetic disorder when the baby sister was 18 months old when she was 4? What about those kind of abandonment issues, doctor? I hope to God that he is not a parent. That's all I would say. Thanks for coming to my TED Talk.
A lot of patients will trade emotional pain for physical pain. So they'll cut. It's not an attempt to kill themselves, but it's an exchange. And so borderline traits, again, even though she has, and rage, anger, difficulty controlling your anger is another characteristic of a borderline personality. And so their relationships are often up and down, hot and cold, rocky. They can have trouble with their rage. And that was the last theme when I reviewed Dr. LPC Kirk's notes, was they had talked about anger as a secondary emotion, how to appropriately manage that. That was the day before. And so generalized anxiety disorder, which can explain a lot of her nervousness, the restlessness, the zoning out, the sleep disturbances, and anxiety is a overwhelming thing throughout all of her, most of her psychiatric records. The borderline personality disorder is much more consistent with traits. I'm not going to label an adolescent with the disorder. And the DSM-5 says, the DSM-5 TR says, all of the traits can become present as early as 12 to 13 years old. They can be present. So even though I'm reluctant, the DSM-5 TR recognizes that you can call them out. You can address them when you see them in unusual cases, which I think this is. Then I also said some psychopathic traits. And I don't use that word lightly, especially in an adolescent. But as I was reviewing her journal, where she says it's okay to be evil, when I see the callous nature in which she left her dead mother to text her next intended victim, and then even used the word honey, that is callous. And it is very concerning to me. In her journal, she often talked about, there were violent themes. I think she may have some
I love how
with her
people
friends as I was
who
reviewing
I love
discuss.
how people who have been blocked come back under a different screen name, and it's so obvious when they do that because they're repeating their same phrases that they used with their old screen name before. Block Island is so lovely this time. If you've never been there, it's off the coast of Montauk and it's part of Rhode Island. And Block Island is lovely. Any of you who watched The Affair on Showtime might remember Block Island. I think you could take a ferry from Montauk to Block Island, or I think New London, and I think maybe from somewhere in Massachusetts, um, or maybe Rhode Island. But it's a lovely place. And so many of you are finding your way there today with a one-way pass. I have fun.
There's memes about violence. There's often this mix of fantasy, dark humor, and violence. Uh, I've seen a lot of memes. I won't go into them, but the callousness at which she did that, she has this superficial charm. She's charming. She's very likable. I liked her when I did the interview. I don't like saying any of these things, but I truly believe them. And so she's very charming. Manipulation. She took extensive notes about how to manipulate. And I have somewhere in here, and I can find it, it's 85 pages of some manipulative behaviors that I document. Okay, here we are. I can find that if we really need to. I'm happy
That's
to
right,
find it.
Dr. Pickett. I mean, based off of the evidence that you reviewed and her journals and sketchbooks,
Yeah.
and the interviews with the other children, family, and friends, you determined that she exhibited some manipulative behavior.
I did. Real quickly, and I'll move on, I thought there was a lack of remorse. I think she has shown
Real
some.
quickly, it's like Lally saying, "I'll be brief." He does not like her. He does not like her at all. I don't, you know what I find so disturbing is that he usually testifies on behalf of defendants. So, I mean, are there people out there that he actually thinks are mentally ill? That surprises me. He said in his long monologue that we've been listening to for like 3 hours now, he usually testifies for the defense.
Remorse now.
Yes. I'll tell you what, ladies and gentlemen, the jury, we've been going for a little while. I'm gonna let y'all go ahead and take your afternoon restroom break, okay?
Oh my God, it's only an afternoon restroom break for real? I wonder if he gets paid by the page.
You can object from there.
But, I just wanted to make aware that both SK's parents and BG's parents have texted me during this witness exam, say that their children's names are being used and.
I didn't associate their children with this case. I've done everything I can do to prevent their names from being used. But at some point, the law does not prohibit the witnesses from using their names. That's not the law.
I think she just said that the parents of the children witnesses texted her and said, could they please stop using my children's names? And he's like, nothing I can do about it now. So their kids are being doxxed.
Can do to prevent their names from.
Hold on.
To say that their children's names are being used, and I just wanted to make you aware that both SK's parents and BG's parents have texted me during this witness exam to say that their children's names are being used, and.
I didn't associate their children with this case. I've done everything I can do to prevent their names from being used. But at some point, the law does not prohibit the witnesses from using their names. That's not the law.
No, Your Honor, but it was in your court order that it wasn't to be put on the media.
I think the media is doing their best with this. They're doing their best. I mean, the most important people in this case that everybody seems to have forgotten in this room is the jury. So we're going to take a 15-minute break and both sides take a pregnant pause and think about the jury.
Ooh, snap, Dewey K. Arthur. That deserves a rewind. What? Court officers are like, Dewey not having it. Oh, wait, I guess
Both
this
sides
again.
forgotten the most important people in this case that everybody seems to have forgotten in this room is the jury. So we're going to take a 15-minute break and both sides take a pregnant pause and think about the jury.
He slammed that gavel. Did he slam that gavel? Oh my goodness. Wow. We too are going to take a pregnant pause. We're taking, I don't know how many minutes ago that was, but we're taking 10 minutes so that my moderators can take a break. We have not had a break all day. It's 6 hours and 45 minutes into this thing. Um, I don't know how much longer I can go, but I'm going to put up the break thing. We're going to take a break right now. Let's all do that. Go fill up your drinks, do whatever it is that you need to do. And we'll see y'all real soon. Come on back now. You hear? All right, they're coming back. Thank you, Akron Rain, for your matcha latte. And thank you, Miss Jones, for the 5 matcha lattes. You guys are awesome from Canada. And Kathy, I thanked you earlier, I believe, but thank you for giving me 3 matcha lattes and for telling me to breathe. I appreciate that. This is like up there with the I mean, this isn't as fun as like the Robert Telly's trial. It's up there with Ashley Benefield and Karen Reed with regard to the vitriol that people are spewing, but at this point, I suppose we're used to it, right? Grandma's mad at the lawyer. Oh, I did not see that. This I am guessing that the reason the long crime feed is so bad is because whatever reception they're using, like on their truck, to send this into the internet world with they must not have good reception because it's happened a couple of days. This isn't the first time. Dewey disassociation break almost over. Danielle Savoy for the win. Did you find out about the a little therapy, a little
Last question was, that's all right, Dr. Pickett, based off the evidence that you reviewed her journals and scratchbooks and interview with other children, family, and friends, you determined that she exhibited some manipulative behavior.
She doesn't need to ask for a readback. He's got it right there. I'm curious if anybody practices law in Mississippi, what system are they using as opposed to we have still the old-fashioned court reporters with the stenography or whatever the machine is. In Massachusetts, they talk into an athletic supporter or a cup. Thank you, Lisa Crawford. Any trauma educator knows full well that children disassociate. Thank you for the 5. And JD Lyon for my language slip earlier. Mea culpa. No worries. I got you. Thank you. Elaine Burris lurking and working. Just thought how awful it would be if she ends up in Mississippi State Hospital. And this guy is one of her doctors. He despises her. I know.
Next question.
It's crazy. That's
Dr. Pickett, we were discussing the diagnoses that you had rendered about Carly, and we left off, you were talking about manipulative behavior. Were there any other diagnoses that you attributed to Carly?
Yes. I didn't finish my thoughts on the psychopathic traits. There's a few other characters I'd like to just say real quickly.
Sure.
I wish, Nancy.
About the manipulative behavior. I found one example. There's others, but I thought, her journal that talked about the emotional manipulation and the happy hurting, I thought that was, concerning. She describes herself in the journal as melodramatic, and she asked herself at one point, am I just pretending just so my friends will feel obligated to comfort and care for me? About her emotional state, I thought that was manipulative. I thought about
Is it manipulative or is it a trauma response from a child who has never felt loved or wanted or cared for or protected? Are there 2 different opinions with regard to that? Perhaps a cry for help, yeah. Yeah, absolutely. To kill someone, there is just really wrong with that, 100%. But he's saying that all of these things are making her look like a master manipulator, like some people in the chat love to throw in there every 3rd chat message. Could it also be a trauma response from a child who never felt wanted, loved, cared for, or protected? I don't need to go through the litany of things this child has been through since she was 4 and earlier. But couldn't it be that? But this doctor only sees her as a master manipulator. God. And we wonder why our children, there's such a mental health crisis after we locked them up in their rooms in some parts of the country for 2 years during their formative years.
The fact that she didn't tell some of her.
Wait, I gotta hear them again.
Am I just pretending just so my friends will feel obligated to comfort and care for me about her emotional state? I thought that was manipulative. I thought about the fact that she didn't tell some of her, like LPC Kirk, about some of her marijuana use and such. I thought that was hiding and manipulative. And then when we were talking, sometimes she kind of de-emphasized certain things, and I kind of felt like I was being, pushed, not pushed towards a certain diagnosis, or I thought it was manipulative. So that's where I got that. Another psychopathic trait is like poor behavioral control. So I looked through a lot of things. I mean, obviously, the incident is a poor behavioral control, and doing the there's other things. The knife incident with the school, where she initially said it was for somebody told her to. She told me that a friend told her to bring it, but then after reviewing the discovery, it said that she had told them it was for protection and mentioned some high school students. And then some promiscuous sexual behavior. There was a sex toy found at the scene. There was
What?
the nipple piercings, and
What?
so
Promiscuous behavior? Okay, this guy's getting a little too holy roller for me. There was a sex toy found at the scene? What? That's the first I'm hearing of this. Hold on.
promiscuous sexual behavior.
She was
There
promiscuous?
was
Did we hear that already?
a sex toy found at the scene. There was the nipple
What?
piercings, and so I'm certainly not diagnosing a 15-year-old as a psychopath. I'm just saying there are some concerning traits. And given me trying to rationalize why did this happen, that played a factor.
We heard about the
some
nipple
degree.
piercing, but
And then lastly, I agreed with some other specified trauma and stress related disorder, like an adjustment disorder with prolonged duration of more than 6 months without prolonged duration of the stressor, which basically adjustment disorder, which is a type of trauma related disorder.
sex toy.
And considering all of those diagnoses, what was your final conclusion? We talked about it kind of in the beginning. I want to come back to it. Your final conclusion about whether or not Carly meets the standard of McNaughton insane in the state of Mississippi.
So all of those diagnoses gets me to consider McNaughton. So she's got the ticket, she meets the threshold to consider it. So I considered it, but her actions for which I observed.
The way he says that, she's got a ticket. Like she's got a golden ticket. Like she's gonna go tour Willy Wonka's factory. Yeah, she's got the ticket. We'll give her the ticket. That gets her in. It gets her in to get an excuse.
On the video and reading on the text messages and reading all the discovery and understanding what seems to be the context.
Oh, Tom's back. Tom's
in
back.
my
Tom says
opinion, her
parents need to hold their
actions-
kids responsible for their actions and quit making excuses by enabling them. How about parents who know their kids have mental health issues don't leave a loaded fucking Magnum 357 underneath the little cubby under their mattress? How about that, Tom? What do you think? How about that? You think that would be a good thing for parents to do? I do.
strongly demonstrate that she
Get 'em outta here.
understood the nature, quality, and wrongfulness of her actions on that day. And therefore, in my opinion, the ultimate decision is for the fact finders, but my opinion is that she does not meet Mississippi's standard for insanity.
And is that opinion to a reasonable degree of medical certainty?
Yes, it is.
Let's hear what is your
Cross. Thank you, Your Honor.
I'm done with you people that are not giving grace to a 14-year-old child who has been through a life of hell. No, that does not give her an excuse to murder her mother. No, it doesn't. But when you take the totality of circumstances that this poor child was born into, and I'm not going to list them all again, you think maybe you might want to show a child a little bit of grace? Maybe a little. If you have one goddamn empathetic bone in your body, we did this to our young people. We did this. And now you want to throw her away, put her in an adult prison and lock her up for the rest of her life? Really? Is that what we're doing here in the United States of America? Is that what we're doing? We did this to our kids. We made them like this. And now we should just lock them up and throw away the key, put them in Gen Pop with the rest of the lifelong criminals? I'm disgusted by some of your opinions, disgusted. And I may be cutting this short. I don't know how much more I can stand. It's disgusting. Yeah, I know. Sorry about that. I don't do that. Yeah, and then make it difficult for them to get help. And then have doctors like this mock them. Disgusting.
I may beg the court's indulgence for just a second to get organized, Your Honor. Good afternoon.
Good afternoon.
I have a few questions for you, I guess, regarding your report and everything that you've just testified. First of all, I know you're a forensic psychiatrist, and I know you're, I think you're qualified in emergency room technique or as emergency room doctor, as a psychiatrist and as a forensic psychiatrist.
Yes, sir.
My understanding is, when did you become a psychiatrist? I guess when you become a forensic, or when I say psychiatrist, a forensic psychiatrist, that's when you become board certified. Is that sort of, or do you just take the classes and then you get board certified?
So you complete your psychiatry residency first. You graduate from that. You get a degree that you're a psychiatrist, but at that time you're just a general psychiatrist. You still have to take whatever state boards to be licensed. Then you apply for a fellowship. It's a very competitive process. You get selected, and then
Yes,
you
we know
are
how
a
smart you are.
fellow. You're not on your own, but you are seeing forensic related cases under the supervision of your supervisor.
And when did you become, I guess, become an official board certified forensic psychologist or psychiatrist?
So I graduated from my fellowship in forensic psychiatry in June of 2023. And then I believe I took my boards around September. No, not 20. Yeah. That would have been September 2023 when I got my board certification. But you're doing forensic cases, that would have started in July of 2022.
Okay, so you've been doing forensic cases since July of 22, which is approximately 2 years.
Approximately, yes, sir.
Okay. And you actually became board certified in, I guess you said October?
I'm estimating September of 2023.
Okay. So it'd be about a year from now, right around about a year. Okay.
Approximately, since I was board certified, yes, sir.
Okay. And you don't have a specialty in child or adolescent psychiatry, correct?
No, sir.
Okay. And wouldn't you agree that anytime you're dealing with kids, adolescents, there's little nuances and differences in those situations, correct?
I think there's certainly subtle, little, as you said, little nuances. But as a general psychiatrist, we do have experience with pediatric and adolescents. We do at least a year in our residency of exclusively child and adolescent. So we do get trained on it in residency. And as a general psychiatrist, you commonly can see whatever age you feel comfortable with. You don't have to be board certified to see it, is what I'm
Right.
trying to say.
Not saying you don't. I guess my question is I'm sort of getting into, there's an actual, I guess, board certification, which is for children and adolescents.
Yes, sir.
And so how many more years of school would you have to go to get to that point?
That's 2 years, I believe.
Okay. And that sort of, you get all the specialties and everything, so you know the nuances and how everything works. Is that correct?
I think they could have more training in it. I agree
Okay.
with that.
And Dr. Clark, who you watched testify yesterday, he's board certified in children and adolescent psychiatry, correct?
According to what he said, yes, sir.
Yes. And are you doubting what Dr. Clark said about his qualifications?
No.
Okay. So he would have more, I guess, training and stuff in as far as, I guess, in with children and adolescents, correct?
Yes, sir.
Okay. And he's also, I think, been practicing for, I think it was 25 or 30 years, correct?
I think that's what he said. Yes, sir.
And so he would have a lot more experience than you do because you're, I guess, where you're at for forensic psychiatry just started about a year ago. Would that be correct?
What part of that are you asking is correct? That my training was just a year ago, or that he has
Now
more
feels like a
experience than me?
fool.
He has a lot more experience than you.
Yes,
Okay.
sir.
And in fact, he's even taught psychiatry, correct?
That's what he said.
Okay. Now, Les, I want to go through this. It seems like, have you ever heard of the term confirmational bias?
To some degree, yeah.
Okay. And isn't it true that what confirmational bias is you get something in your head and then you go out and you start trying to prove it, as opposed to figuring out what the big picture is, you sort of narrow it down and you try to get a specific result. Would that be correct?
Yeah, I think that would be the definition of confirmation bias.
Now, do we have a little bit of confirmational bias in this situation?
Honestly, I do not believe so. I told the prosecutors that I'm going to be as objective as I can, but once I start reviewing discovery and learning about this case, depending on what those point me to, will determine my opinion. And once my opinion falls on the side, then I'm going to, advocate my opinion.
Well, there's some things that I guess and I'm not going to go through everything as far as your report and everything, because I'm not a psychiatrist, and you know a whole lot more about psychiatry than I can ever ask you questions about. But you would agree with me, Dr. Clark testified that he had diagnoses that were very different from the ones that you had today.
Yes, sir.
And you would also agree that Dr. Clark has a lot more experience, correct?
Yes, sir.
Okay. Now, there's some things that I wanted to go over because you talked about, I guess, that there wasn't really anything that that could be used that would lead you to believe that she was suffering from, I guess what Dr. Clark called wasn't delusional. What was it? What did he term it? What was her condition?
He said many things.
Yeah, wasn't it dissociative or something? What was it? What was he saying that she was suffering from?
I don't want to.
Now you don't remember?
Dr. Clark, but I believe he was saying something along the lines.
Disassociation, maybe?
Yeah.
Okay, is that what he was saying, that she was in a state of disassociation?
I think he said that.
Okay. And so you don't believe that, well, one, let me back up. You said you're not really familiar with that, correct?
I said I'm not the nation's leading expert on it, but we get trained on it in residency. I've read about it in the DSM-5 TR. I've read various articles about it preparing for this. So,
have you had people that have been under this affliction before?
Very few.
Very few. And it's not something that's common.
It's not.
And I think something that's important is you said this is a very unusual case. This is a rare case. When you agree on that?
I think it's unusual for a 15-year-old to shoot and kill their mother. And it's unusual in that aspect. It is not unusual as far as the psychiatric diagnoses and mental health based on review of her records, in my opinion. That's actually very common.
So the situation is very unusual. You don't see this very often. And the fact pattern is really unusual in this, isn't it?
Can you elaborate a little bit on what you mean by fact pattern?
Did you ever see any violent tendencies at any time? Were you able, in your, I guess, review of everything?
All right.
were you
They
able
need to
see
stop
any-
glitching. Stop glitching. Stop, stop, stop.
Correct.
Yes, sir.
Now, the one thing, and this is where I get into this confrontational bias a little bit. Every time there's something that points to a different position or different, or sort of what Dr. Clark brings up, you say you're discounting the journal, that where she says that she's hearing voices and all this kind of stuff, and she's hearing voices before this incident. You're like, I'm going to discount that. That doesn't really count. But then you turn around and want to use stuff like this and say, yeah, I'm taking these little statements and it's violent tendencies. So why is it that you're sort of, how do you say, cherry picking the different parts of it that suit you?
I would have to disagree with that. I'm bring up a few highlights that are concerning to me. But also in my report, I mentioned that in her sketchbook, she has some sketches of little ponies. That wouldn't support that she's violent. That's included in my report. And also, some of the journal stuff is inconsistent in that she mentions, feeling numb and things like that in January in her journal. But then come February, she tells that to the nurse practitioner and they attribute it to her Zoloft. And so some of the things in her journal, are conflicting with what I'm hearing from other sources. So I don't put a whole lot into it. I'm certainly not basing my decision about her insanity on those things. But to even consider insanity, you have to have the prerequisite threshold diagnosis. And therefore, I did a deep dive into an adolescent's journal, but that was only one piece.
Now, the biggest thing that you said led you to believe that, caused you concern was that you were not seeing, I guess, any reporting from either of the two. I guess it's Kirk and the other therapist, and that caused you some concern because you were saying that normally, individuals are going to confide in that person. Would you agree?
Generally, most people would confide in their mental health professional about things that they were concerned about regarding their mental health.
Yeah. Now, we had some testimony from one of the therapists today, and she said that it had taken her, I guess, a year and a half before Carly had opened up about issues. And I think with these people that she started seeing in January, that would have only been about 3 months of seeing people, correct? So there wasn't a lot of history with therapists between, I guess, when she went in January 15th to when the incident happened. Would you agree on that?
I agree that there was only those two within that period, but there are older records from a therapist that were also reviewed in my report.
Thank you, Mama She, for your very generous $75 donation to a good bottle of liquor. She says I need it. And also, Kathy, thank you for another matcha latte, and also thank you to Lynn for your Venmo. It's Lynn. Thank you so very much for thanking me for empathy for Carly, and Zelda as well. Thank you. Thanks, Zelda.
And she wasn't having these issues back then, or correct?
No, and that was actually closer to the traumatic event.
Now, are you sure that's the traumatic event? Because that's one of the things you go to the traumatic event. You can have other things that cause you to have a traumatic event, correct?
You can.
Yeah. So when you're saying that there's a traumatic event in her life and it's whatever happened, it's 5 years ago, we really don't even know if that's what it was, correct?
We don't, but by talking to her and asking about her history, it does seem like when she's talking that was a significant trauma. The Kevin, the neglect, the abuse, and her sister dying at a young age, and her parents divorcing. Those were big, and she hasn't mentioned anything bigger than that to me, or that I have seen in the records.
So they were big, but they had no effect on her mental health?
Now, she was diagnosed with, I guess it would be a major, I guess, psychological issue in January. Was that correct?
I believe LPC Kirk diagnosed her with adjustment disorder, with mixed anxiety and depressed mood, and the mental health nurse practitioner Lieber agreed with that, also diagnosed her with adjustment disorder, and said that she met criteria for a single episode of major depressive disorder.
Yes, and I want to say medication was prescribed, correct?
Yes, sir.
And it was never discontinued, correct?
No, sir.
And when we're saying discontinued, I'm not trying to, play loose and fast with my question. It is, she's continued to have medication to this day since January of January of this year until currently, as far as you know, correct?
I know she had it up until the incident. I have heard some of the things that she's been on in jail or being detained. I don't know the specifics of all that.
Now, in jail, she was diagnosed with a psychological disorder and treated with high doses of antipsychotics, correct?
I would say it's a moderate dose. I think it's 10 of Abilify, Dr. Clark said. I mean, when I'm at the state hospital, now these are adults, I do go up much higher doses, 20 milligrams, even maybe even 30 at times. So 10 milligrams, adolescent, seems moderate. One of the current is, I believe she was on Celexa in jail. So Celexa, that one's a little concerning to me because Lexapro and Celexa has Lexapro in it, essentially, in a very basic term. Citalopram is two mirror images, the R citalopram and the S citalopram. They're mirror images. It gets into biochemistry, blah, blah, blah.
Blah, blah, blah. Blah, blah,
It has
blah.
both in it. The Lexapro is just the S citalopram.
Your expert testimony is blah, blah, blah. Thank you, Christy. Appreciate you.
Portion. So to me, if you're really concerned that the medication was causing some issues, having her on citalopram, Celexa, which is still Lexapro, doesn't make a whole lot of sense to me. Now, the Abilify,
You've been in practice for
we use that for many things.
one.
And that could explain some of the,
Well, and this is one thing Dr. Clark had explained it yesterday. And he said that, yeah, your Celexa has the Lexapro, but it has the other, whatever the other qualities, and it affects the brain a little bit different. So some people that don't do well in Lexapro do well in Celexa. Would you agree on that?
I would recommend if somebody had reportedly a bad experience on Lexapro, then you shouldn't use the SSRI that is as close as possible to it and literally contains the same medicine. I think that would be a bad idea.
And so again, that's where you differ with Dr. Clark.
Yes, sir.
Okay. Let's talk about, I think you were talking about Dr. Hardy's evaluation of Kevin Gregg.
Yes, sir.
And that's a person you have never, ever seen. you have seen 3 pages of, was it medical records I think you testified to?
Yes, sir.
And you're wanting to basically say that the doctor that has seen him is wrong on his diagnosis, that actually saw him. I know you said it was only for a few hours according to the records. 1 hour for the records that you saw.
Total for all 3 visits was 1 hour.
And so you're saying that he got it wrong, and you don't know if there's even more medical records, do you?
I've asked for the other medical records. I wanted the other medical records because I really wanted to confirm or deny whether Mr. Kevin Gregg actually legitimately has one of these mental disorders, or whether it's just
Well, you know, there's this thing called HIPAA.
substance abuse.
So the way I got it and the way your testimony was, and maybe I could be wrong, but it seemed like you were saying you don't want to say, or first of all, we were dealing with bipolar, and evidently there's a heredity issue with bipolar.
Yes, sir.
And so you were wanting to say that Kevin Gregg really doesn't have bipolar, therefore the heredity part of the prong that would go towards Carly doesn't exist.
I would say yes. If he doesn't legitimately have bipolar disorder, then it makes it less likely that Carly has it.
And so your reasoning is that you want to make another diagnosis over a doctor that actually saw the individual and diagnosed them with bipolar.
I don't want to, but as my job entails, I have to look at the details. And people are misdiagnosed frequently. I know this because I work at the state hospital, and these patients come to me and reportedly they have a diagnosis of this or that. And we kind of go through their history and we're like, no, it actually seems more consistent with this. So it is standard to question previous doctors on their records, especially when they're so sparse.
Okay, once you say
Especially when you get-
especially, I just can't take you seriously. Especially.
A big history of drug abuse that can make you look manic, that can make you look psychotic. I wouldn't be doing my job if I just accepted any piece of paper that says somebody has a diagnosis.
So even though there is a diagnosis, a valid diagnosis from a doctor, and you don't have anything to overturn it, you're like, I'm not accepting it. It's basically my understanding.
I disagree with the diagnosis based on extensive review of Mr. Kevin Gregg per all the records, Ashley's description of him, Carly's description of him,
Everyone says he's bipolar.
grandparents' description of him to the deputy as I was watching the video. Anybody that knew him knew he was addicted to many substances, and
See the
he
dig
was
emoji?
prescribed Adderall, Klonopin, and and Ambien. If I have somebody with bipolar disorder, I'm not going to prescribe them Adderall because that can really push them into a manic episode. And when I reviewed Dr. Hardy's records, he did not justify. If I have a patient that comes to me and this is our first interview, typically I will say, according to the records I've reviewed, Mr. Johnny has schizophrenia because he had delusional thoughts, he had disorganized thinking, he had auditory hallucinations, and here's the records I based that off of. And Dr. Hardy did not do any of that. And actually, his substance abuse was minimized in those records. And so I just don't believe that Kevin may have been as forthcoming with Dr. Hardy, and he may not have had all the records.
Now, what is Thorazine?
It's an antipsychotic.
And that would be something that that was prescribed to Kevin Gregg by Dr. Hardy.
I don't know everything Dr. Hardy may have prescribed him. I know the ones that were very concerning.
And you didn't see that one? You didn't see that?
I don't remember.
What about, I guess it's Respira?
Risperdal?
Yeah, what's that?
That's an antipsychotic.
Okay, that was prescribed to Kevin Gregg by Dr. Hardy. which would be consistent with what's that treating?
We use antipsychotics for behavior. So if somebody comes in and they are acting erratic, violent, aggressive, yelling, screaming, throwing fits, hurting people, we often use mood stabilizers and antipsychotics. So just because somebody's on an antipsychotic does not mean they have psychotic illness or bipolar disorder.
Now, did you you never looked at the I guess the medical records from the jail, correct?
I looked at the ones that were sent to me from Region 8 and I glanced over them. I didn't necessarily put a lot of weight on them only because I am evaluating her sanity at the time of the offense. And what she says to people now that cannot be objectively confirmed, I can't see it and do it in myself and really see that I see this without such giant secondary gain. I'm real skeptical of those things. And so I didn't put a lot of weight into them.
Because the way I understand it is she gets diagnosed in January with, I think, with a major situation, however you want to call it. I guess it was a one-time kind of deal.
Yes, sir.
And then you were in here when one of the witnesses disclosed that Carly and her talked about Carly hearing voices. Remember that?
I do.
Okay. And so that happened before the situation happened on the 19th. And then you had in the journal, it talked about hearing voices. And I think that was on the 12th of March, which was right before the situation, correct?
Well, a few things I'm skeptical about is the friend. I believe they're still friends, is what was said yesterday, and that they still communicate to some degree. And sometimes ideas can be implanted after the fact and people don't know. So I'm real skeptical of that because of the large secondary gain and the things that have been consistent with malingering. The journal article for the 12th.
All right. Swifty, hi Swifty, thanks for the 5. Swifty says, let's say she gets committed, how long is appropriate and how is that determined? It depends on the jurisdiction. So I don't practice in Mississippi. Sometimes it's for an indeterminate period until the doctors in the mental hospital deem that she's no longer a danger to others and or herself. So it depends on the jurisdiction. So, and the judge would be the one to set the sentencing based on doctors' recommendations. It's a very complex process. So I can't really answer the question, but it is a good question. Welcome. Thanks, Anna, for your Canadian 5.
When I see people that have schizophrenia and they are suffering with these auditory hallucinations that they do not want, they do not like, that bother them, they usually do not describe them as quite silly, and they do not describe them as ravenously screaming at each other. And thankfully, physical altercation is not fruitful. That's not
usually in the 1 year that you've been practicing. Usually. And they're adults. I've had it.
I think she would go to her mother and say, Mom, I'm hearing voices. And the mother, especially if she was as involved as Ashley, would have taken her and made sure that the mental health providers knew about it.
Well, I think all the testimony is that she didn't want her mother to know about that. Yeah. Correct? Isn't that what all the testimony is?
I have heard all of the testimony. I've heard the last 2 days.
I mean, even for the last 2 days, I think the testimony has been, especially you heard everything that Dr. Clark said, everything was that the mother did not want to, or Carly didn't want the mother to know about her I guess, issues. I think you even talked to her in jail about this very thing, didn't you?
I never talked to her in jail. I talked to her here in the courtroom doing my evaluation.
It's connected.
Okay, yeah. My impression was that she wanted to hide, especially some of the more negative things from her mother, the burner phone, the marijuana, talking to the boy. It's not my impression that she was trying to hide her mental health from her mom. I think her mother, from everything I could gather, was very aware of her mental health, and therefore her mother insisted on taking her to seek help.
Then why did her mother leave a loaded gun in her bedroom where her child could get it?
Point is, and he brought it up a couple times, the individual, like clients, patients, however you want to characterize it, a lot of times they're not forthcoming with everything to people like psychiatrists, psychologists, individuals that are therapists, people like that, correct?
Yes, sir.
And I think you heard from one of her therapists today that she was having to drag stuff out, that she was almost about to, say, hey, we need to switch to another person because I'm not getting a lot of, I'm not pulling stuff out of you. I'm not helping you a whole bunch. Do you remember that?
My impression was that Dr. Kirk thought that she was doing fairly well and was considering discharging her, or referring her elsewhere if necessary. But at that last visit, pried her, kind of pushed to talk about the stuff with her mother, and that's when the rage and the anger came up.
Moon Goddess, you're very sweet. Thank you.
Carly, and this is stuff, again, put in her journal and said that she had a psychological or psychotic break. Carly, and this is stuff. Now, at one point, Carly, and this is stuff, again, put in her journal and said that she had a psychological or psychotic break. Do you remember that part of the journal?
Yes, sir.
And you said you didn't put a lot of credence into it because it was something that she wrote. And I think you said the journal was, she was using it sort of like theatrical and things of that nature. Is that sort of your take on it?
Yeah, I said there's a mixture, seems like, of what might be truth and what seems theatrical.
Now, the disassociation, which we were just talking about, you're not really, you said you know about it, but you're not an expert. And you said you have seen it in rare cases. We agreed that this was a rare case, correct? Or your words, I can't remember.
It's an unusual case in that a 14-year-old killed her mother. It's not unusual in that her mental health, so anxiety and depression, those are common.
And Dr. Clark had gone through and spelled out exactly how disassociation works and how it could work with her, how it was working that on the 19th, correct?
Yes, and I enjoyed the academic exercise of talking about dissociative spells, but in my opinion, what Carly did that day was not consistent with dissociative spells at all because of so much specific intent.
And just getting into the specific intent that you're talking about, if you're in the dissociative, I guess, situation, you wouldn't be knowing what you're doing with all that. You could be doing that. And I think the research shows that you can do that, correct?
I think the literature is very sparse on this. I think the literature talks, there are case reports or examples of violence being completed in a dissociative state. But again, based on my review of the video and Carly's text messages at the time, in my opinion, shows way too much intentional, high-level executive functioning to be in this unknown dissociative spell, and yet do so many specific.
Right, and it sort of goes back. You're talking about, I think what the literature says is that happens. It's rare. This is a rare case to begin with, and then you have more, I guess, rarity in a lot of the facts. So, I mean, it's possible that happened, correct?
It's in the realm of possibility.
Yes.
But I have to say that what's a lot more common and the literature supports is arguably the most commonly malingered thing is malingering amnesia, particularly after a homicide. And that's much more common than what you might be possibly do in a rare dissociative state.
Right, and that's where you go back in and you start looking at sort of different things that had happened as far as you're looking in the journals, you're talking to the friends, you're seeing things like that. One thing that on the jail records that was very important was it showed that she had said that she was having hallucinations. I think more than, I think she did that in at least a couple months, and they gave her a Abilify. I think you remember that.
Were they visual or auditory hallucinations?
Auditory hallucinations, I believe. Yeah, auditory hallucinations.
That she reports.
She reports to the medical staff at the jail. They give her a Abilify, and then after a few months, it gets better.
That's all per Carly.
Yeah, but that would also be consistent that because you can have a I guess a episode, a psychiatric episode, and it doesn't all start at one time. It builds, correct?
Cases vary. Some people, it shows subtly and then progresses. Other people, may do a substance and then it causes a break or something like that. So it can vary.
It can vary, and you can, in this situation, there was stuff that was out there before this happened. And then we have the 19th of March, and that's when the situation happens. And then right on the back end is where you have, I guess, she's telling the person in jail, this is what's going on, and they prescribe her this medication, and then it gets better. Did you talk to her about that, about the hallucinations no longer being present?
I don't remember us getting into that too much. Sometimes I try not to interject or implant. I don't want to say, hey, are you having this? Are you having that? I want them to voluntarily tell me, because I don't want to implant ideas in people's heads. And so most of the time, if they're really experiencing these things,
Most of the time in your 1
when
year's
I see my
experience.
patients with schizophrenia at the hospital, they gladly tell me and eagerly tell me and beg for me to help them.
Really? So because she didn't beg for your help when you saw her, I don't know, 2 weeks ago, and she's already on antipsychotic and she's been in solitary confinement for 6 months, because she didn't beg you for help, you don't think there's anything wrong with her? Got it. Got it.
Well, you keep saying when you see your clients at the hospital who have schizophrenia, you didn't diagnose her with schizophrenia, correct?
No, sir. I'm just using schizophrenia as a standard psychotic illness.
Well, when you saw her, I guess it was on the 30th of August, not too long ago.
Yes, sir.
She's competent. She answered all your questions, all that kind of stuff. There wasn't any problems, correct?
Correct.
She's lucid. I mean, she was on the 30th. She was 100% fine.
Yes, sir.
The big question is how she was back on the 19th of March, correct? That's what you're here for.
Yes, sir.
And so right after that, there's records at the jail where she's saying she's having these hallucinations. They're giving her medications. And then it seems that works because she no longer, I think there's some notes that she no longer having them. So wouldn't that be something that you would want to look at?
It's not necessarily pertinent to how her mind frame was at the time that she killed her mother, especially when I have video footage of her at that time, and I have text messages of her conversations at that time. I know I have all the statements of everybody who knows her way better than me. I have medical records from years, hearing exactly what she says afterwards when there's a big secondary gain.
Well, what about the victim in the case, her stepfather? Her stepfather describes her as, that's not Carly. That's what his testimony was. And he's the person that actually saw her. And I know you haven't said anything about that. And that would seem that would be something that's very, very important when he's saying she was not in her right mind. And that's when it's happening.
I tried to call him and interview him, and he didn't want to talk to me. But later he called me for about 6 minutes on the phone at the request of Attorney Todd, and we talked, but it was very limited to Carly's been forgetting things and zoning out. I wanted to talk to him and hear his side.
Well,
Did you not hear the testimony?
he testified twice in this trial, and you could have been home watching it on YouTube, sir. Doctor?
I wanted to talk to him and hear his side.
Did you not hear the testimony?
You cyber check.
I didn't hear his. I was only here for yesterday and today's.
Oh,
Okay.
it's on TV.
Because he said that would this have any impact is if he's saying that she did not look like she knew who Heath was.
Thanks,
She
Barbara.
called his name 3 times when she knew he was coming home, and she texted him and said, hey, when are you coming home? So I find it hard to believe that she didn't know who he was. Now, him being in a shocked state, looking in her eyes, if she's in a shocked state too, because she's about to shoot him or attempting, I don't know how much he could decipher accurately at that time.
He's not
So
reliable.
his opinion on her state and how she looked and things like that really doesn't play with you very well.
I would take it into consideration. I do not think it would change my opinion.
And I mean, just so the jury knows, there's nothing that I can say up here when I'm asking you questions that's going to change your opinion, correct?
If you were to give me some objective evidence, things, I would certainly take that into consideration.
You wouldn't just go like what we did with Heath Smiley and just say, no, I don't think that he can make a good determination.
No, I've based my opinion off of the mountain of evidence that I have reviewed, my clinical evaluation of 4.5 hours with Miss Carly, reviewing all the medical records. I have based my opinion on that. And if there was new information that was relevant, I would certainly consider it.
May I beg the court's indulgence?
Love it when they beg the court's indulgence. Just means going to have a second, Your Honor, to get my act together or to go get a paper or it's a new rap.
Do you treat many kids at all?
Yes, excellent.
Not as a general psychiatrist, not as a forensic psychiatrist, as an emergency physician, I frequently treat kids.
And just dealing with I guess your role as a forensic psychiatrist in this situation, how many evaluations on adolescents and kids have you done?
This was the first.
As a forensic psychiatrist?
Mhm.
Yes.
Probably my first.
Okay.
It's
How
his
many times
first.
have you been qualified as an expert to come?
This is his first evaluation on a child. Today, you're hearing it. And he's so damn sure about his opinion. So damn sure. Wow. Just wow. I need to revel in this moment. Midnight Mike, thank you for gifting 5 memberships. And for those of you who were gifted them, welcome. Romy, thanks for the 10. According to this dude's resume, he was a deputy sheriff for Hines County from 08 to 011. 08 to 011. 08 to 2011. Being in Massachusetts, I have trust issues with law enforcement testifying in trials. Thank you, Barbara. I think I put this up. Who said she's not going to beg a man she just met for help, especially since she knows he's not there to help. And Crystal, thank you so much for the cash up. Cash app. She says it's for putting up with this guy all afternoon. I need to rewind that. And then I'm just going to turn my mic off and make facial expressions.
As a forensic psychiatrist?
Yes.
Probably my first.
Okay. How many times have you been qualified as an expert to come in and give opinions?
I did have to testify in another case on a patient who was bipolar, and the ex-wife was trying to say just because he has bipolar, he couldn't see his kids. And I said, he's doing great. He's taking his med. He could just see his kid. I was an expert in that. It wasn't, it was mental health in the legal system. So I think that would qualify, but that's my only other time.
Okay. So this is your first time in a criminal case.
Yes, sir.
Okay. And this is your first time doing an evaluation on a 14-year-old.
I'd like to clarify my last answer. This is my first time testifying in a criminal case. I have done competency evaluations and sanity evaluations for patients regarding criminal cases. I just haven't testified in those cases.
No, you said you've never evaluated a child as a forensic psychiatrist until today, till this one. Would you like to phone a friend? Dr. Pickett, would you like to phone a friend?
Have you done many evaluations of children and adolescents?
No, sir.
May I beg the court's indulgence for a moment again? Dr. Clark and I think Giuliano?
Yeah.
Okay. Neither one of them came to the conclusion that there was malingering, correct?
Not that I recall.
Okay. We would tender, Your Honor.
Dr. Pickett, you've done more than, or close to over 100 evaluations regarding competency and insanity. Isn't that right?
Yes, ma'am.
Mr. Camp asked you about if Dr. Clark had more experience than you. I guess that means he's been practicing longer.
I guess.
I submit to you, there's attorneys that are quite older than I am and have practiced a lot longer than I have that have been disbarred. Does more experience always mean that you're a better doctor?
I'm sorry.
Not
Did
necessarily.
Dr.
Does more
Clark lose his
experience-
medical license? Did we miss that part of the trial where Dr. Clark is no longer licensed to practice medicine? She's given those two evil stepsisters in whatever part of Florida that was, because I've already forgotten Manatee County. I think she's given them a run for their money.
Does this mean that you always get the diagnoses right?
No, and I would like to just clarify quickly, even if she has all of these
Objection,
diagnoses,
objection.
what matters is that just lets you start to consider insanity, even if she has all of them. And I'm completely wrong about all my diagnoses, and she has all the diagnoses that Dr. Clark says. In my opinion, based on reviewing the video footage, the text messages, the extensive discovery review, her actions at the time strongly suggest that she understood the nature, the quality, and the wrongfulness of what she was doing.
And just one more follow-up, Dr. Pickett, to that. Mr. Camp mentioned that when you evaluated the defendant, I think he said that she was competent and 100% fine. But she actually was claiming to you that at that very moment, she was in one of these disassociated spells, right?
Yes.
No further questions, Your Honor.
State have any further witnesses?
The state rests.
This witness may be released by the state, correct?
Yes, sir.
By the defense. All right, you can stand down.
Stand down forever. You're out of
The
here.
state finally rests, correct?
That's correct.
Ladies and gentlemen of the jury, it's 5:05. I'd ask y'all to be back in the jury room 8:45 tomorrow, ready to go, okay? Everyone remain seated while the jury exits.
It's so funny because in most jurisdictions, in New York, you stand while the jury exits. See if Dewey's taking a Zanny. Done some mindfulness exercises, able to lower the blood pressure. His Apple Watch is picking up AFib. Oh, look, she's fixing her hair.
Record reflect we're outside the presence of the jury. Does the defendant wish to re-urge its motion for its motion for directed verdict? Yes, we would, Your Honor. Any further grounds? State have any further arguments?
None other than we've already made, Your Honor.
All right, court will again deny the motion for directed verdict. Y'all need a few minutes to gather your stuff for jury instructions.
Briefly, grocery break, and then if we could have about 5 minutes or so.
10-minute recess. We'll do jury instructions. Be back at 5. I'll tell you what.
Opposing
be back 5:20.
arguments, opinions are allowed. Deirdre, just don't be a dick. And if you don't like it here, you can go to Law and Crime. You can go to Court TV. You can go anywhere you want. Nobody's forcing you to stay here. Okay? Can't with these people. These people in Mississippi. Barbara, she looked robotic to me and she's comforted the dogs, the only beings that probably showed her real love. Truth. Truth. Mm-hmm. Well, look, if I'm not your favorite trial person anymore, I'm sorry. D-Bear, I'm sorry. I mean, do I need to apologize? I'm sorry. People are coming in here from all kinds of other people's chats that have stopped covering this trial for this exact reason. And so when people are vitriolic, it's a problem. And It's fine. You're not going to hurt my feelings. If you go somewhere else, you're just not going to hurt my feelings. But like chatting amongst yourselves about it, like I can't see you, Deirdre. Like I can't see you. It's childish. Like, do you think you can just chat whatever you want and I'm not going to put it up on the screen? It's like you're begging for attention at this point. Thanks, Dr. Sue. Thanks, Mama She. Staying seated for the jury's been bothering you too. Right. Exactly. No, I'm not going to apologize. What I'm going to do is I'm going to sign off. I'm going to say goodbye. I've had enough for today. Um, and I'll see you tomorrow. Thanks to my moderators for keeping it semi or as well as you could, keeping it as good as you could today because it's ugly out there, my friends. It's ugly. But you know what? This is what it's like. This is what it's like out there in the real world. In the real world of people who just think we should lock up our children and throw away the key. That's what it's like. No grace for anybody who's been through severe abuse, trauma. And no, it's not you guys. It's not you, Scott. You guys are amazing. I've just had enough. I've had enough. So, hey, smash the like button on your way out over to Law and Crime or Court TV or wherever you go to watch the jury instructions, and we can talk about them tomorrow. But for now, I love my moderators. They're the greatest in all the land. All the land. You guys are amazing. And as for the rest of you, if you don't like it here, just go somewhere else. It's totally fine. You're not going to hurt my feelings. Not going to hurt my feelings at all. But there are a lot of people who do like it here. And we have empathy and we have compassion and we have grace, especially for the kids. Because shouldn't we be all about the kids? I don't know. I think we should. Smash the like button on your way out. Do all the YouTubeish things that YouTube likes to help the algorithm. Share it out for people who are like-minded and empathetic towards the children of our country. And for the love of God, be cool, be kind, be classy. It's not hard. It is really so not hard. Peace. Good night.